Good morning, good morning, good morning to all listening and viewing. The Committee of the Health, Hospital, and Human Services of September 30th, 2022 is hereby called to order. A pleasant good morning to the people of the Virgin Islands, and of course, before we get into today's agenda, I really want to say happy Hispanic Month, happy Heritage Hispanic Month. Felicidades a todos estas viernes. Felicidades. And also use this opportunity to say prayers for all the residents of Puerto Rico, of course, in the post-Fiona hurricane situation there, as well as Florida. And all those that continue to be in the path of Ian. And we know that Florida got hit pretty hard. A lot of us have family members in the state of Florida, especially the Orlando, Miami, Fort Lauderdale, Tampa area. So again, we want to send our prayers out to those individuals. A double prayers for all of those that had to endure last night inclement weather, especially those with the soft roof, blue tarps. Oh my gosh, mopping all night. I feel your pain, and again, certainly you're in our prayers and during this difficult time, and we're hoping that the rain ease up a little bit. But we understand that we're in the height of the hurricane season and up until October 15th, and certainly we need to be mindful of that. Today, the Committee of Health, Hospital, and Human Services Committee is meeting to receive an update on JFL North. Our community is frustrated, especially when there is a sense that promises that have been made thus far to open the JFL North have not been kept. So today, expecting that JFL leadership to reassure our community that in fact, again, we're working hard and feverishly to ensure that we're working towards the opening of JFL North. And from the reading of the testimonies last night and my conversation with the leadership of the hospital, I think that there will be some good news that will be shared with the community today. The committee will also do a deep dive on our senior care in the territory. Senior care is in crisis, not just in the Virgin Islands, but across the country. There aren't enough caregivers, affordable beds, and services to support our elders who have done so much for our community. We see the challenges and hear the cries of those families that are doing their best, but still struggling for care for mommy and daddy and other relatives. As well as when we talk about seniors, we have to also look at the issue. I just heard a lady this morning, her passionate plea as she continued to experience behavioral health issues with her son, her adult son, and certainly she's living in her home under siege as a result of not having adequate facilities here to take care of our homeless population that's experiencing behavioral health issues. So that is something that we've been working on, and later on today, I know that we'll be having some discussion in respect to that. Today, the committee will hear from the Department of Human Services and the Department of Health on our senior care in the territory, and I had a good opportunity, myself and some of my colleagues, to visit our senior centers earlier this week, to include the Herbert Gregg Home and the Richmond Senior Center, and we'll have some further discussion in that respect later on today. Our community is getting older, and we must be proactive in ways to support the health and well-being of our aging community. The two issues presented today are interrelated. In fact, a Washington Post article about population decline in the territory was published last week, directly references an aging population living in healthcare deserts. While that article was nothing surprising, it was still tough to read. Before we proceed, I'd like to extend my condolences to the family of Maud Omaha Dowdy Roberts, and her funeral is today. She's being laid to rest today, and several of my colleagues will be attending that funeral, and then they'll be joining us a little bit later on. As they lay Miss Marty to her final resting place again, Miss Dowdy has certainly been a fixture of our Frederiksted community and someone that I was fortunate to interact with during her long life, and may she rest in peace. And I'll tell you that Maud was a handful. She's one of those Frederiksted stalwarts that spoke her mind. And the unfortunate situation is that she died on her 100th birthday. as family members and everyone was there, celebrating with her. So that certainly was a sad situation, but nonetheless, Ahmad has certainly lived a long life. I take this opportunity to remind my colleagues and also the testifiers, those of you with cell phones, so please put your phone on mute or turn the ringers off as not to interrupt today's proceedings. And those testifiers that's appearing virtually, please keep your devices off until you speak, and be mindful that in fact, whatever you're on camera and whatever you do in the background could very well be viewed by the public, so just be mindful of that. Madam Clerk, please call the roll.
Senator Marvin A. Blyden.
Present.
Senator Blyden, present. Senator Samuel Carrion. Senator Carrion, present. Senator Kenneth L. Gittins. Senator Gittins, absent. Senator Alma Francis Heiliger. Senator Francis Heiliger, absent. Senator Janelle K. Soro. Senator Soro, absent. Senator Kurt A. Violet. Senator Violet, absent. Senator Novell E. Francis Jr.
I'm here.
Senator Francis Jr., present. Mr. Chair, you have 3 members present, 4 members absent.
Very well, thank you, Madam Clerk. Do you have any correspondence to be read into the record?
Yes, I do, Mr. Chair.
You may proceed in reading those correspondence.
September 30th, 2022, Honorable Novell Francis Jr., Chairman, Committee on Health, Hospitals, and Human Services. Dear Senator Francis, please excuse my tardiness for the Committee on Health, Hospitals, and Human Services scheduled for today. I will be paying my last respects at a funeral service and will make my way to participate in the hearing as soon as services are concluded. I note the importance of the agenda items to be discussed in today's hearing and look forward to weighing in on the discussions upon my arrival. I thank you in advance for your understanding. Sincerely, Kenneth L. Gittins, Senator. September 30th, 2022, the Honorable Novell E. Francis Jr., Chairperson, Committee on Health, Hospitals, and Human Services. Dear Senator Francis Jr., I will be late for today's Committee on Health, Hospitals, and Human Services hearing due to a previously scheduled engagement. I apologize for any inconvenience this may cause, and I look forward to participating upon my arrival. Thank you for your kind consideration in this matter. Respectfully, Kurt A. Violet, Senator, 34th Legislature of the Virgin Islands. September 30th, 2022, Honorable Novell E. Francis Jr., Chairman, Committee on Health, Hospitals, and Human Services, 34th Legislature. Greetings, Senator Francis Jr. Please note for the record, I will be tardy to the Committee on Health, Hospitals, and Human Services scheduled for today, September 30th at 10 a.m. in the Fritz E. Lowetz Legislative Conference Room on St. Croix. Thank you for your understanding. Regards, Senator Alma Francis Heiliger, 34th Legislature. That concludes the correspondence, Mr. Chairman.
Thank you very much. Madam Clerk, please mark Senator Gittins, Senator VLA, and Senator Francis Heiliger as excused or tardy until they get here. We'd also like to recognize the presence of Senator Angel Boquez Jr. Welcome, Senator, a non-committee member. Thank you for being here. Madam Clerk, at this time, please read today's agenda into the record.
The Committee on Health, Hospitals, and Human Services has scheduled a hearing on Friday, September 30th, 2022, 10 a.m. in the Fritz E. Lowetz Legislative Conference Room on St. Croix to receive an update on JFL North. The committee will also receive testimony and an update on the Herbert Gregg Home for the Aged, as well as the state of senior care in the territory. Block 1, the status of JFL North. Invited testifiers, Mr. Douglas E. Cook, Chief Executive Officer, Governor Wang F. Louis Hospital and Medical Center. Mr. Christopher E. Finch, Chairman, Virgin Islands Government Health and Hospital Corporation. Mr. Darrell A. Smalls, Executive Director of Facilities and Corporate Development, Territorial Hospital Redevelopment Team. Block 2, update on the Herbert Gregg Home for the Aged, as well as the state of senior care in the territory. Invited testifiers, the Honorable Kimberly Causey Gomez, Commissioner, VI Department of Human Services. Ms. Ernie Pennyfeather, Administrator, Senior Citizens Affairs, VI Department of Human Services. Mr. Alvin Milligan, Assistant Administrator, Senior Citizens Affairs, VI Department of Human Services. Ms. Ana Velez Martinez, Director, Herbert Gregg Home for the Aged, VI Department of Human Services. The Honorable Justa E. Encarnacion, Commissioner, VI Department of Health.
Thank you very much. And quickly, we'll go to the testifiers to introduce yourself, and then we'll commence with the testifiers, and of course, we'll begin with the chairman of the board, Mr. Christopher Finch.
Hey, good morning, Christopher Finch.
Good morning.
Good morning, Doug Cook.
Good morning.
Good morning, Darrell A. Smalls.
Good morning. Do we have anyone virtually? Mr. Bryant? You're mute, sir. Yeah, we're not hearing Mr. Bryant there. Okay, we'll come back and do a test with that. We'll have media work out that issue in respect to being able to hear the audio from Mr. Bryant. At this time, Mr. Board Chair, you recognize your testimony.
Thank you. Good morning, Honorable Chairman Novelli Francis Jr., other members of the Committee on Health, Hospitals, and Human Services, other senators attending, Senate staff, other hospital leadership testifiers, and the listening and view at public. I am Christopher Finch. I am a member of the St. Croix District Governing Board for the Governor Juan F. Louis Hospital and Medical Center, and chairman of the Virgin Islands Government Hospitals and Health Facilities Corporation, commonly known as the Territorial Hospital Board. Thank you for this opportunity to testify on the status of JFL North project, the temporary hospital which will replace the current Juan F. Louis Hospital while a new hospital is built. I'm joined today by Douglas Cook, Chief Executive Officer of the Juan F. Louis Hospital and Medical Center, and by Darrell Smalls, Executive Director of the Hospital Redevelopment Team. Mr. Smalls' testimony will focus on the construction aspects, progress, and challenges of JFL North. Mr. Cook's testimony will focus on the extensive planning to transition an entire hospital into a new place. My testimony will be to share the prospective involvement of the Board of Directors and to discuss the challenge that border patients pose as we plan to transition into JFL North. I will start by putting on the record that the most unhappy people that JFL North is not yet open are the hospital leadership, including administration and board members. No one is more frustrated or disappointed than we are. We understand the community desire and the need for JFL to be open, JFL North to be open. We understand the difficulties encountered by our staff in providing care in our patients receiving care in a compromised hospital building. We know how much the environmental challenges that all who work at JFL experience. We know the expectations were for this facility to have been opened long ago. We understand all this. We work diligently on getting it open, and we are constantly looking for ways to shorten the time until we can open. We remain mindful that once open, it must meet all accreditation guidelines and enable the safe provision of top quality care our patients deserve and our staff provides. The Territorial Hospital Board continues to be closely involved with the completion of JFL North. The board provides an oversight and planning function and approves procurements of over $100,000. A year ago, the board asked Mr. Darrell Smalls to take the leadership in finalizing the construction of JFL North. And I would add, it's not in the written testimony, that Mr. Smalls embraced the challenge and has been spending considerable days weekly since that time, May a year ago, in getting the construction completed, for which we are very grateful as a board. As Executive Director of the Hospital Redevelopment Team, Mr. Smalls reports directly to the Territorial Board and specifically to me as Board Chairperson. The Territorial Board meets monthly and receives update reports from Mr. Smalls. In preparation for this hearing, I looked at board meeting agendas and minutes for the last year, which comprises a dozen full board meetings. We had JFL North reports and discussions at each meeting and procurement approvals at almost every meeting. Communication does not just happen at board meetings. Both CEO Cook and I are in communication with Mr. Smalls multiple times a week. The procurement process is a multi-step process. Mr. Smalls and his teams arranges for the procurement, creates and issues the RFPs, manages the competitive process, puts together the evaluation committee, and recommends a vendor. 2 to 3 times a month, I host an informal procurement meeting with both hospital CEOs, Mr. Smalls and their respective procurement leaders, where we discuss upcoming procurements and agree on strategy. Procurements over $100,000 are then vetted through the monthly Territorial Board Finance Committee and finally approved by the Territorial Board. Since the focus is on JFL as a construction project, the procurement is largely contracts, contract amendments, and change orders. As useful, the board consults with the Office of Disaster Recovery to ensure that what we are approving meets federal guidelines for reimbursements. The ODR Director, Agent William Zochteline, has advised the board on several occasions, for which we are grateful. Mr. Smalls and Mr. Cook will provide more detail about the progress on JFL North. I want to address one challenge that is a present and long-standing challenge for both hospitals and will cause great difficulty for the move into JFL North if not properly addressed. This is the issue of boarders. Boarders are mostly very frail seniors who live at the hospital because they have nowhere else to be placed and cannot live alone and take care of themselves. JFL presently has, and this actually presently has 8 boarders as of today. We do not have the bed capacity in JFL North to handle several boarders like this. Presently, the boarders are mostly housed in the Virgin Islands Cardiac Center. Our immediate plan, as JFL is demolished and a new hospital built, is to use the Virgin Islands Cardiac Center for all the outpatient services of JFL that will not fit in the temporary hospital. We cannot do that if the rooms of the Virgin Islands Cardiac Center are filled with boarders. And it's useful to understand the complexity of the border challenge. First, the hospital is not the best placement. While they receive physical and health care, the hospital is not set up to provide the social and emotional and recreational services they would receive at an appropriate senior facility. A hospital bed is far more expensive than any nursing home. The hospitals cannot charge any of the third-party payers, not insurance or Medicare or Medicaid, for border care since they are not properly hospital patients. In other words, there are no medical reasons for the person to be hospitalized. The hospital loses the revenue that would otherwise be provided from that bed being used for its proper hospital patient purpose. For the public, the phenomena that our limited beds are thus occupied may mean a delay in scheduling surgery or spending days in the emergency room waiting for a bed opening. Additionally, this creates a morale challenge for staff. The border problem is related directly to the shortage of long-term care services in the territory. For clarity, long-term care beds includes both nursing homes, which includes medical care, and assisted living beds, which provides 24-hour care in a non-medical setting. Long-term care services include both the facility-based nursing and assisted living beds, plus home and community-based services. Presently, the hospitals are working closely with the Department of Health, the Department of Human Services, and the Office of Management and Budget to find alternate placements for the 18 boarders currently at Juan F. Louis and Schneider Regional Medical Center. Hospital CEOs and I have started meeting weekly with the Commissioners of Health and Human Services and the OMB Director to coordinate this effort. At the invitation of the Department of Human Services, a team from a Puerto Rico long-term care facility that has agreed to take 6 boarders came to the territory this week to meet and assess the care needs of the potential patients. And they provided that assessment on Wednesday at Schneider Regional Medical Center and yesterday, Thursday, at 1F Louis. The Department of Human Services is planning for additional boarder placements in the Herbert Grigg Home and the Queen Louise Home for the Aged and potentially other on and off island facilities. The hospitals are greatly appreciative of this initiative from DHS, DOH, and OMB. It's important to understand, though, the need for more local long-term care services as the only lasting solution to the border issue. The hospitals have been emptied of boarders before, only to receive new boarders. I believe the Department of Human Services will inform the Senate this afternoon that they have around 6 dozen people on waiting lists for the limited number of long-term care beds. Let's look at the numbers. The 2010 census showed 14,388 persons in the Virgin Islands aged 65 and older. That represented 13.5% of the then population of 106,405. The 2020 census reported our population had dropped to 87,146 people. I have not been able to find population by age statistics. However, if we assume that those over 65 remains at 13.5% of the population, that will give us 11,765 seniors. A yardstick once given to me by a federal senior services official was that a community should have enough long-term care beds for 5% of its over 65 population. That would indicate a need for 588 beds. Another, perhaps more conservative, Federal Health and Human Services report indicates that 3% of the over 65 population lives in nursing homes. That's nationwide. For us, that would mean 353 beds would be needed. Whichever number is correct, 353 or 588, we know experientially that we have far fewer than the long-term care beds that we need, and even than we had a few years ago. Presently, the hurricane-damaged Herbert Grigg Home and Queen Louise Home for the Aged have 40 beds between them. Pre-storm, and while Seaview was still open as a nursing home, we had 109 beds in the territory. We have lost 63% of our already too few nursing home beds. Facility-based beds, whether nursing home or assisted living, are only one part of the long-term care services. Home-based services are extraordinarily important and can provide enough assistance to help people remain in their own homes, where research shows most seniors prefer. This includes homemaker services and visiting nurse services. We have some home-based and community services through the Department of Human Services and the Department of Health, and nonprofits providing home services such as Continuum Care, providing home health care and home hospice care, and Lutheran Social Services providing a variety of assistance to the seniors living in its housing, especially Flamboyant Gardens, Gannip Gardens, and Ebenezer Gardens. We need more, much more, of each of these services. A recent example demonstrates this. A patient was hospitalized at 1F Louis. This patient's spouse came along and was also given a hospital bed because our patient was a full-time caretaker for the spouse and had no one else to provide care. More robust home-based services could have alleviated that need. We must increase our long-term care services, government and community-based, if we are to eliminate the need for our hospital beds to be filled with boarders. In conclusion, I want to assure the legislature and the public that we are focused on properly completing JFL North as soon as we can. I address the border challenge as a present concern for the hospital and one that will be increased if we need to find spaces for boarders in JFL North. I want to thank the men and women of the 1F Louis Hospital and the hospital redevelopment team, including leadership, professional staff, bedside staff, and administrative and operational support staff, for their work, their dedication, and their passion to deliver the best health care. This concludes my testimony. I'm available to answer questions at the appropriate time.
Thank you very much, Chairman Finch. Next, we'll go to, and of course, we'll have some further discussion in respect to the borders a little bit later on. But we'll go to CEO Cook for his testimony.
Thank you, Senator Francis. Thank you, Mr. Finch, and good morning, Honorable Senator Novell E. Francis, Jr., Chairman of the Committee of Health, Hospitals, and Human Services, other senators of the 34th Legislature, and the U.S. Virgin Islands present, and the listening and viewing audience. I am Douglas Cook, Chief Executive Officer of Governor Juan F. Louis Hospital and Medical Center. I appreciate the opportunity to be here with you today, this morning, and discuss our progress with JFL North. To assist with the presentation today, along with Mr. Chris Finch and Mr. Darrell Smalls, we have present Interim Executive Vice President of Finance, Rosalie Javois, Chief Nursing Officer, Doris Plaskett, Chief Operating Officer, Hazel Filbert, Chief Information Officer, Gregory Bryant, and Interim Vice President of Human Resources, Nicole Samuel Miller. Chairman Finch touched on several of the challenges associated with the needs of the healthcare community. I want to publicly thank the Territorial Board for their ongoing support and leadership of making JFL North a reality. Additionally, I want to thank this body for their continued oversight and support. And finally, I want to thank the Honorable Governor Albert Bryan and his team for his years of leadership and commitment to seeing this project through despite its many challenges. As you are aware, this temporary hospital project has faced many challenges. Some should have been avoided, while others could not be foreseen. The good news is we are continuing to move this temporary hospital forward, as the people of St. Croix deserve to have a reliable, consistent hospital available to them. The JFL employees and all the physicians that practice at the hospital should be commended and thanked for their service. They too deserve a facility that is free of infrastructure challenges. Many of the failing infrastructure challenges are highlighted in items during times of severe weather events, such as the most recent tropical storm Fiona. While on this topic, let's be reminded of our friends and families and colleagues in Southwest Florida that are dealing with the devastation and destruction of Hurricane Ian. Our thoughts and prayers are with them as they begin their recovery efforts. During Tropical Storm Fiona, our failing infrastructure experienced plenty of challenges, but the resilient JFL team did an amazing job responding to all of them, and for the most part, there were very little disruption to our patient and services. We should be proud and appreciative of the dedicated staff of JFL. We also need to acknowledge and thank all of our partners that assisted us in the preparations and response, specifically Vitima, WAPA, Department of Health, Carib Supply, and several other public and private entities. The transition to JFL North is not only about infrastructure challenges. There are many obstacles that need to be addressed so that we are able to provide the necessary services to our community. Chairman Finch touched on the ongoing challenge with borders. This problem has been going on for decades and is largely outside the control of the hospital. Yet the failure to address this problem adequately results in the burden falling directly on hospital operations. Our ability to effectively and efficiently conduct medical care to this community is compromised on a daily basis. Our beds, nurses, and other resources are being tied up by individuals that have no medical reason to be at the hospital. We have on average 8 to 10 boarders in the hospital every day. This takes up approximately 35 to 40% of the adult medical surgical beds. This causes a backlog in the patients that are being admitted to the hospital, now occupying rooms in the emergency room. This is why we have extremely long waits in the emergency room. On most days, we operate our emergency room with 4 or 5 rooms. We should have at least 12 available for services. We need to implement permanent solutions so that our community members in need of medical care are not unnecessarily delayed when they arrive in the emergency room. I am very appreciative of the work being done by the Department of Human Services, the Department of Health, and Office of Management and Budget, and other agencies to assist in finding creative solutions and resources for these individuals. Another major challenge we will continue to face as we transition to JFL North, it will be staffing. As you know, nationally, there is an emergent crisis with shortages of medical personnel. Just like the rest of the country, we are dealing with the effects of an aging workforce, retirements, burnout, and the increasing cost of traveler or agency staff. In fact, most of the successful health systems across the country are posting record losses this year, with 53% of them projecting negative margins. As we continue to progress towards our plans to transition to JFL North, a similar nursing staffing plan has been developed that is based on the preliminary designation of inpatient beds, outpatient services, and specialty services that are relatively parallel to the current JFL nursing services. JFL's staffing plan is based on both industry and regulatory indicators with each service line. The current staffing plan reflects a need for 140 bedside staff RNs. Presently, a total of 73 bedside staff RNs are at JFL at approximately 52% vacancy rate. JFL is currently being supported by multiple staffing agencies to assist with the critical clinical vacancies. At JFL, we are appreciative of the recent ARPA funds that have been made available that allowed us to provide some retention and recruitment bonuses for hard-to-fill positions. Many of the employees were also recognized as part of the premium pay program. I am also happy to report that both hospitals are in active negotiations with nursing unions. These efforts, along with other strategies to increase the number of clinical staff, will eventually lead to more sustainable workforce. Let me pause and acknowledge every employee at Governor Juan F. Louis Hospital. Your efforts are extraordinary. Your dedication is admirable. And I am continually inspired by the men and women that I have the privilege of serving alongside. We continue to identify and recognize talent within the organization, such as Kathy Mendoza, who we recently promoted from the security team to the patient access team, so that her skills as a translator can be of greater value to our patients. We also acknowledge people and employees such as John Gums, who brings his passion and love and help to work every day. The heartbeat of our organization resides in the doctors, nurses, and all the staff that share their skills and talents on a daily basis. As we move closer to the completion of JFL North, our transition teams are doing the exciting work of verifying the transition plans. In order to ensure a successful transition to JFL North, operational readiness activities for the clinical, ancillary, and support services are underway. Operational readiness activities focus on the review and coordination of all aspects of hospital operations to provide safe and efficient patient care services. Our community anticipates the long-awaited transition to JFL North, and we are diligently working in collaboration with Mr. Smalls and the hospital redevelopment team to achieve this goal. As we focus on the operational readiness activities to include plans of patient movement to the new temporary facility, regulatory compliance with CMS conditions of participation is of top priority. JFL will continue to work towards this goal to ensure compliance with regulatory requirements and provide safe, quality care for our patients. I have discussed several challenges that we'll continue to work through, but I want this committee to know that there are exciting days ahead. When we open the doors of JFL North, we will be welcoming a state-of-the-art structure with brand new surgical suites and technology, along with dedicated labor and delivery rooms that allow the mom and baby to recover and stay in the same room throughout their stay. A fully outfitted trauma and emergency room services department. We will also have a new 128-slice CT scanner with full cardiac imaging package and many other services. By decreasing our time and energy on addressing failed infrastructure problems, our teams will set new goals that focus on customer service and improving the quality and efficiency of care being delivered to our patients. Together, we will continue to make a difference. As always, the JFL executive team thanks Honorable Senator Novell E. Francis, Jr., Chairman of the Committee of Health, Hospitals, and Human Services, and the members of the Committee of Health, Hospital, and Human Services for granting us the opportunity to provide this testimony today. I will now turn the presentation over to Mr. Darrell Smalls, Executive Director of the Hospital Redevelopment Team, to walk us through the details of JFL North construction and look forward to answering any additional questions you may have.
Thank you very much, CEO Cook. Next, we'll go to Mr. Darrell Smalls for his testimony.
Good morning, Honorable Chairman Novell E. Francis, Vice President of the 34th Legislature and Chairman on the Committee on Health, Hospitals, and Human Services, Honorable Senators on the committee, other Honorable Senators of the 34th Legislature, Senate staff, fellow hospital testifiers, and the listening and viewing audience. My name is Darrell A. Smalls, Executive Director of Facilities and Capital Development for the Territorial Hospital Redevelopment Team. Thank you for this opportunity to testify today as to the status of the temporary hardened structure, or JFL North as we have come to know, here on the island of St. Croix since our previous presentation before this committee on May 25th, 2022. As the Executive Director of the THRT, my primary role is to manage and oversee the planning, programmatic design, final design, bidding, project management, construction, procurement, and closeout for the redevelopment of the Juan F. Louis Hospital, the Roy L. Schneider Hospital, the Charlotte Kimmelman Cancer Institute, and the Myra Keating Smith Community Health Center. With respect to JFL North, I am excited to report that we are nearing completion of the construction activities previously delineated as it pertains specifically to the mechanical building, which, once completed, will house the critical systems required for the temporary hospital to operate. These systems include components of the life safety system, the domestic water supply system, the medical air and vacuum delivery systems, the oxygen supply system, the emergency backup generators, the fire suppression system, and the liquid propane distribution system. In my previous testimony, I presented that the scheduled completion was to be August of 2022. However, due to manufacturing delays, the major component, the 260,000-gallon water storage tank, was impacted by the world's steel shortage. In June of 2022, we were informed by the tank manufacturer that due to force majeure, which in legal terms translates to, and I quote, unforeseeable circumstances that prevent someone from fulfilling a contract, unquote, the delivery of the tank would be delayed and was rescheduled to be shipped to the territory by July 31st, 2022. On August 4th, 2022, we were once again notified by the tank manufacturer that, and I quote, production of the Juan F. Louis Hospital, MIP 01605-0, has been further delayed due to ongoing supply disruptions and steel raw material challenges, end quote. I am pleased to report today that the tank finally arrived on the island of St. Croix on September 26, 2022. While this is indeed a huge milestone, I would be remiss if I did not take this opportunity to share in detail as to how the THRT, or the Territorial Hospital Redevelopment Team, has evolved since inheriting this vitally important project for the island of St. Croix in June of 2021. I will provide an update on the current state and the next steps for opening the facility, and finally, the next phase of work that is required to be completed to support the operations of JFL North. Where we are. The original design-build contract executed on July 6, 2018, following Hurricane Irma and Hurricane Maria, was to design and build a 55,000 square foot temporary hardened structure by December 2019. That was to meet the regulatory compliance requirements set forth by the Centers for Medicare and Medicaid Services and the Joint Commission on Accreditation of Hospitals. Equally important to note is, in December of 2019, a supplemental contract was entered into which provided the necessary equipment, or FF&E, required to support patient care within the new structure with an amended completion date of July 17, 2020. The original design contract incorporated connections to the existing JFL for the supply of domestic water, both hot and cold, medical oxygen, medical air, medical vacuum, as well as a fire suppression system or fire pump. Once the systems were connected to the existing Juan F. Louis Hospital and testing was initiated, it was revealed that the existing JFL mechanical systems could not sustain both facilities, both JFL and JFL North. On or about this same time, FEMA notified that it determined the hospital qualified to be a prudent replacement and would therefore be demolished. The fact that the current systems could not support the operations of JFL North and the fact that Juan Louis was determined to be replaced, the decision was made that a new structure would have to be designed and constructed with all the required systems needed to operate JFL North as a standalone and self-sustaining interim hospital. These systems included the need for a water storage tank, medical air, medical vacuum, domestic water pump, domestic hot water heating system, a fire pump for the sprinkler system, an oxygen supply system, as well as a liquid propane system, just to name a few. In May of 2021, the Territorial Board made the decision that the THRT was to assume the responsibility for the completion of JFL North and all ongoing disaster-related projects that were or would be associated with the operability of JFL North as a standalone interim facility. Shortly thereafter, in June of 2021, the THRT, which was originally responsible for rebuilding of our hurricane-damaged facilities territorially, officially assumed the responsibility for completing JFL North. My team and I immediately commenced with evaluating the current state of the construction activities and what would be required to bring the project to a successful completion. The first order of business was the issuance of the solicitation package for public advertisement to select a contractor to construct the mechanical building. The project execution timeline was as follows. The CMU building solicitation was issued on June 17, 2021. The notice of award was sent to the contractor on July 29th of 2021. The contract was executed on September 2nd, 2021. EHP clearance and certification of determination was approved on November 24th, 2021. The notice to proceed was issued on December 6th, 2021. Where we are. Over the period from June 2021 to present, the THRT, along with the Territorial Board and the executive leadership, has forged a transparent and collaborative working relationship to bring to the forefront and address all issues that have arisen while overseeing the project development. The construction of the mechanical building, which commenced in December of 2021, is nearing completion and is more than 75% complete. While we have encountered numerous roadblocks throughout this project, my team and I have continued to work tirelessly and creatively to obtain the required services to finalize the construction effort needed to successfully open the facility. Housed within the mechanical building are a medical air and medical vacuum system, the domestic water pump, the domestic hot water system, the water treatment system, the fire pump, as well as all other components which must be physically connected to JFL North. One of the most significant changes that had to be implemented was the pipe distribution system. The system, as originally designed, routed the piping through an area that would be constructed within the future demolition zone, which would then have to be disconnected and rerouted, thereby causing a major disruption and would affect patient care in the very near future. A plan was subsequently derived and the change was approved to reroute the system of piping from an exterior and exposed system to one that was constructed and installed in the space underneath of JFL North. It is significant to point out that this decision was vitally important in that this newly constructed mechanical building will not only supply and support JFL North, but it will also support the Virgin Islands Cardiac Center, or the VICC, as this facility is presently supported by JFL, which when demolished, would impact the operability of the VICC. This work effort, which is simultaneously underway, will not impact the opening schedule of JFL North. As a matter of fact, the original work was projected to take approximately 6 weeks. However, as of today, The work is substantially completed in under 4 weeks. In conjunction with the mechanical building project, the construction of the foundation for and the installation of the bulk oxygen storage system to supply JFL North continues to progress and is nearing completion. Once the bulk tanks are installed during the first week of October, we will proceed with the installation of the piping to connect the bulk tank storage manifold to JFL North. We anticipate the first shipment of oxygen during the week of October 17th, after which we can immediately commence with the testing and certification of the oxygen delivery system. It is our objective, barring any unforeseen circumstances, to have the system approved and certified by the end of October 2022. Also under construction is the foundation for and the installation of the interim propane tank, which is substantially completing. The existing tanks, which supply JFL, must be removed due to the fact that this location is to be utilized for the 2 new generators that are to be installed to provide backup electrical power for the mechanical building. The next step in the process of the propane tank installation is the completion of the gas lines to connect both JFL North and JFL. We must maintain the connections to JFL until we have fully vacated the existing facility. The anticipated completion of the temporary tanks is slated for the week of October 17th. Another major challenge we currently face is the removal of the existing propane tanks. These tanks must be depleted of propane prior to any attempt to safely dismantle them from the current location, as the tanks are physically welded into place. Any delay in their removal inhibits the installation of the new backup generators. The installation of the 260,000-gallon water storage tank has commenced. The excavation for the installation of the tank base has been completed, and the foundation steel is currently being installed. With the arrival of the tank this week, included within the shipment are steel components referred to as embeds, which are essential to the tank foundation and must be installed prior to the concrete pour. The tank manufacturer's installation team is due to arrive on Monday, October 3rd, to begin the inventory and inspection of the footing steel prior to the initial pour for Wednesday, October 5th, 2022. A great day indeed. A second slab will then be formed atop the initial slab, wherein steel and the embeds will then be installed with an expected pour the following week on Friday, October 14th. Between the pours, the manufacturer's installation team will also start the fabrication of the miscellaneous steel and dome. Approximately 2 to 3 days after the second slab is poured, the tank erection will commence with an expected completion of October 31st. Here is an illustration of the step-by-step process for the tank installation. What you see here are the external walls of the of the water tank, or what we call it the first course, and you'll notice there are jacks. Once that slab is poured, these first row will be installed, and then immediately after, these jacks will then lift that first row, and sequentially as a row is added, it will continue to jack it up. Therefore, there's no need for a crane to assist with this installation. The culmination of the tank will look similar to this when once completed. One may ask, why did the construction activities with respect to the installation of the water tank and the interim propane tanks wait until August 2022 to commence? The THRT, on behalf of the JFL, successfully entered into a lease agreement for the 5-acre parcel in April of 2022. After the lease agreement was executed, Juan Louis received notification from FEMA on July 27, 2022, wherein approval of the scope of work change for the, and I quote, installation of a water tank, propane tank, and waste management compactor, end quote, was granted. On August 24th, we received the formal EHP approval wherein the authorization to proceed with excavation on the 5-acre parcel for the 3 items was granted. Where we are going. While I initially focused on much of the construction activities, I felt it was important that I provided this overall perspective of the entire construction effort to convey to this body and the general public that while there has been much discussion as to why this project has taken as long as it has, there have been many factors that have contributed to the delay in opening the interim facility. There is nowhere that I can go on the island of St. Croix, or within the territory for that matter, where I'm not asked, when is the hospital really going to be open? My response has consistently been, there is tremendous work that has been put in by the Territorial Board, CEO Cook, the past and the current executive leadership team of Juan Louis, FEMA, ODR, the THRT, numerous contractors, and the various other stakeholders to ensure that we finally and successfully open JFL North. The next steps to facilitate the opening of the interim hospital include the certifications of the various internal systems, the installation of internal and external signage, the implementation of the transition plan, which includes upcoming tabletop and live exercises, orientation of key staff such as physicians, nurses, and other ancillary staff, as well as training on newly installed equipment, to name a few. The training and certification process could not be accomplished without the systems that are currently nearing completion. There are several other key components that are required to support the operability of JFL North that have yet to be implemented, which, however, will not prevent the opening of the interim hospital. One of these items is the construction of the critical administration building that will be constructed in the space between JFL North and the VICC. This support structure is vitally important as it will house critical non-clinical functions such as physician and nursing administration, but more importantly, this structure will serve as the main entrance to JFL North and will be physically connect the interim hospital to VICC. The contract to design and construct this 6,500 square foot single-story structure has been executed, and the work effort is slated to be completed by July of 2023. Another key component is the development of the recently leased 5-acre parcel located directly east of JFL North, which, once developed, will include parking for staff and visitors, a critically needed building to provide storage for food and medical supplies, medical records, and support services for facilities maintenance. At present, these services will have to remain within JFL until these structures can be completed. Of course, the question remains, when will JFL North be open to serve the residents of St. Croix? Based on our current construction schedule, all systems are to be installed and operational by October 31st, 2022. The coordination of the testing and certification processes will commence during the third week of October and run into November 2022. Once we receive notification that all the systems have received favorable certifications and no further modifications are required, the leadership of Juan F. Louis Hospital will immediately initiate the official transition process to relocate the existing patients within JFL to JFL North. Once this transition is completed, all inpatient services will cease operations within Juan F. Louis Hospital. While there is still more work to be accomplished, the motto of the THRT is, "Together we will be stronger," provided we work collectively towards one objective, and that is to construct the most efficient, resilient, sustainable, and state-of-the-art healthcare facilities for the people of the Virgin Islands. Before I conclude my testimony, please allow me this opportunity to share a brief presentation of how JFL North has evolved and what JFL North is shaping up to become. Here we are in 2017, prior to Hurricane Irma and Hurricane Maria. Here we are in 2017, following the hurricanes. Here we are, both Juan F. Louis and JFL North in 2021. Here we are today in 2022. When you drive by JFL North, this is what you see from the main roadway. At this time, I would like you to come and take a flight with me and go behind the scene to see what you have been unable to see. As you can see from this aerial shot from the roadway, it appears to be a very small structure, but if you see the JFL, the original Juan Louis in the background, you could see the proportion that this is not a small facility, but indeed a large facility to provide the care that is going to be required here on the island of St. Croix. As we transition here, this is the site, the original site where the CMU building has been constructed. Here is the official first dig that was conducted on the site, the initial excavation that began on the site, the huge foundations that had to be dug to support the structure that would be eventually constructed. Here is the initial foundation of this building prior to the first pour. Several months ago, this is a two-story structure that has evolved from that initial pad. Here, you're looking at the hot water heaters and the hot water storage tank. Here, we're looking at the water treatment and water softening system. Again, another photo of this particular system. These systems all had to be shipped into the territory. This is what the exterior of the CMU building looks like today. Inside of JFL, here's our state-of-the-art 128 slice CT scan. Here you're taking a look at the observation bays within JFL North. As you can see, already outfitted with beds and the required equipment to provide patient care, a typical observation room. One of 4 state-of-the-art operating theaters within JFL North. This particular room will handle our orthopedic cases. All the specialized equipment is currently installed within this room. As I indicated, there are 4 state-of-the-art rooms within JFL. As I conclude my presentation, I want to personally thank my dedicated THRT team, who has diligently worked to mitigate many challenges we have faced along this journey. I would also like to recognize the Office of Disaster Recovery, led by Ms. Adrienne Williams-Octolin, for her tenacity with assisting with any challenges we have faced as a liaison between the hospitals and FEMA. Equally important, I want to thank the Territorial Board, the executive leadership of Juan F. Louis, and the staff of Juan F. Louis for their support to the Territorial Hospital Redevelopment Team. This concludes my update on the status of the progress of JFL North. At this time, our team will remain available to answer any questions you may have.
Thank you very much, Executive Director Smalls, for that comprehensive report and where we're at with JFL North, where we have been, and certainly where we're headed. And I'll tell you that I've been asking for this type of presentation to be made for the public, for quite some time, because I think it's important for them to be able to get an appreciation for what's being done behind the scene to address this particular issue as it pertains to JFL North, the complexities and challenges that's been faced, and how some of those have been certainly overcome, and put us in a perspective where we could see some light at the end of the tunnel coming. So I appreciate this. I still don't have a answer to your question, though. Your rhetorical question that you asked is, when will JFL be opened? And that's still kind of up in the air. I heard you mention about some of the timelines and inspections and certainly certification that needs to be done. But is there a projected timeline that you have given to the board in respect to when do you believe, giving yourself somewhat of a cushion, but when do you believe that in fact we'll be able to transition and open the JFL North?
Currently, our discussion with CEO Cook and the Territorial Board, as I indicated, once the mechanical systems are completed and we could proceed with the certification and inspections, the first moment that we have that, we can proceed. This can be as early as the middle of November or proceed towards the ending of November, beginning into December. We don't foresee any challenges. However, once the regulatory entities that come in and provide that certification, they ultimately have to give us that green light. Of course, we would love to be able to say that the day after October 31st that we're ready to move forward, but it would be irresponsible of us to do that. We must. It's imperative. We don't have a choice. We must get the certifications prior to moving in.
Have there been any contemplation, in terms of being able to contemplation and being able to determine whether or not we could move this into a 24-hour operation again for the purpose of expediting, understanding the crisis situation that we're at? Have there been any contemplation in respect to turning this into a 24-hour operation?
Absolutely. The work effort is definitely a 7-day-a-week process. Concrete, unfortunately, there's what we call a cure time. We can't expedite that. However, when it comes to the inspections, we're already scheduling much of the certification teams' travel arrangements for coming into the territory to help expedite this. This is a serious matter, and we are all putting every effort that we can to ensure that we can get it done as quickly as possible.
Very well. Before we go to a quick recess and also open up the floor for additional questions, I'd like to have the Madam Clerk read a correspondence that we received into the record at this time. I think it's from the Nurse Association.
Petition to evacuate the Governor Wang F. Louis Hospital and Medical Center. Greetings. The Virgin Islands State Nurse Association is registering its grave concern relative to the delayed occupation of JFL North. This concern is on behalf of the nursing personnel and other healthcare workers who have been working under dire, stressful environmental conditions at JFL Hospital. While the association recognizes that this transition to JFL North is a monumental undertaking, the fact is that the current working environment is untenable. The staff who have remained committed to providing the best quality of care possible deserve to work in a safe and healthy workplace. Their overall health and well-being and that of the patients who seek care are of paramount importance. As the voice of registered professional nurses in the territory, VISNA implores all leadership to exhaust every avenue to expedite this move into JFL North. The association, VISNA, can no longer allow this situation to drag on and would like to see this matter addressed with a sense of urgency. The quality of nursing care is seriously impacted and nurses' licenses are in jeopardy. VISNA requests the evacuation of JFL and activation of JFL North within 30 days. Respectfully submitted, Yvette Rivera, President, Virgin Islands State Nurses Association.
Very well. I'll allow for either the chairman or the CEO just to quickly respond to the correspondence. It was addressed to the chairman of the board initially and also copied to the CEO as well as to the governor and myself. Any comments on that real quickly?
Yeah. Okay. I received a copy of that letter some point last night. I'm going to write back and really reiterate much of what Mr. Smalls has said, indicating that, we certainly understand their feelings because we have the same feelings and addressing diligently, we have been doing that for quite some time. As Mr. Smalls laid out, a number of activities, once it was determined, not only once it was determined that JFL North would be demolished for a new one to be built, but as we moved along in that process of the design in realizing that there was a number of extra steps we would have to do that would not then compromise JFL North operations in the future, that we needed to take the time to do them now, so once we move in there, we won't be in situations where gas or water or air has to be cut off because we have to reroute things, et cetera. That has taken extra time, to everyone's frustration, but I cannot imagine the frustration would be if we were in JFL North and then had this crisis where we're trying to do those things in an operating hospital. You know, we understand, you know, their position, and as you know, we're going to respond with the facts.
Very well, thank you. Anything else to add to that?
Yeah,
Mr.
thank
CEO?
you, Chair. You know, I work with nurses on a daily basis, walking through moving water buckets to leaking roofs, picking up infrastructure challenges on a daily basis. And I have a full listing of, you know, just the things that happened during Tropical Storm Fiona. So no one wants to be out of that building more than I do. And it's not about me, it's about our patients and our healthcare workers. So, and I think you saw during my testimony that I commented very similarly to the expressions that were just read into that correspondence. But I would close, so I very much agree with their thoughts. But I think the part that we may be missing is our communication. And I think communicating a little bit more openly and frequently would be of assistance here. And I will commit to doing that to anybody that is willing to have that conversation. Because to put a time limit of 30 days is, to me, it's irresponsible, because it's not focusing on what we need to focus on, and that's the quality and the safety, most importantly, the safety of our patients and our staff that need to move into that building. And we will not do it until we can assure that. And I think that I would have the support of this body and the board and everyone involved to make sure that we're doing this in a safe manner. But understand the sense of urgency.
Thank you very much for your response there, and of course we'll you know, address that a little bit more on the other side of the break. But I just want to say that haste make waste, and I think some of the challenges that we have experienced with the JFL, original JFL, is what got us to where we're at today, and it's very, very important that we're able to cross our T's and dot our I's. And while yes, you know, it's taking some time, it's very critical that we're able to address those issues meticulously and make sure that we really comprehensively address the problem that we're experiencing, so we don't find ourselves in the very same predicament that you know, where we're at today. So yes, I know that this has been somewhat time consuming, you know, but when you look at the work that has been done, and I've stayed in touch with all of the stakeholders, certainly the board chair, the CEO, as well as the executive director and Office of Disaster Recovery, in regards to all of the dynamics that's involved in moving this project along. And yes, every single one of us are frustrated, but it's so important that we're able to get this right, you know, and be able to make sure that we're moving our nurses, our patients in adequate facilities, so we don't have the same problem with going outside to bathrooms and all of the frustration, you know, long waiting lines and these type of frustration that we're currently seeing in the JFL. You know, we need to get this right. So at this time, the committee will take a 5 minutes recess, and when we come back, we'll open up our floors to my colleagues for questioning. Committee of Health, Hospital, and Human Services, stand in recess for 5 minutes. And we're out of recess. Again, today we're having the Committee of Health, Hospital, and Human Services. We have before us the leadership of the Governor Juan Francisco Louis Hospital, and we've been discussing the issue of JFL North. But certainly, Mr. Chairman and CEO, I know that we spoke this morning, and your passionate plea regarding the border situation is one that I believe it is critical, and continue to be problematic for quite some time now. I had it earlier this week, visited the Herbert Gregg home, and I believe that there are some opportunities there for us to be able to retrofit a wing at the Herbert Gregg home. We spoke with the commissioner as well as the staff, the chief nurse, Aaron, at the Herbert Gregg home, and I believe that there's really a plan afoot, and I'm trying to get a cost analysis done to determine how we could perhaps get maybe 10, 12, perhaps up to 20 beds ready in short order at the Herbert Gregg home. I think that's critical. I've taken it as a priority item over the next few weeks, so that we could be able to get a cost analysis and work with the administration to get the proper funding to get that taken care of. Of course, we have to balance the 18 borders with the waiting list. The commissioner is very concerned about that, but nonetheless, I believe that we could reduce significantly the amount of borders that we're seeing at our healthcare facility at the hospitals in short order. So it's something that we will be working on in the near future. I just wanted to go ahead and put that on the record because it is problematic. In addition to the possibility of placing some of those individuals off island, have been discussed. I would prefer for us to at least be able to at least get them housed here locally, because I think that to just relocate them, even though there's very limited or no visitation being done at the hospital, as soon as you move them off island, have family members and everybody else coming out to really address that. In addition to that, we're really going to take a look at how the individuals that's ultimately responsible for them, if in fact the state has become the ward of these individuals, then the funding and everything associated with their maintenance needs to also come to the facilities that will be taking care of them. So that's also, we're looking at legislation that will be able to address that. You can't continue to receive the Social Security benefit, disability benefits, and you utilize it for your own aggrandizement while your family members remain at the hospital and really being taken care of by the government of the Virgin Islands. So, comprehensively, we'll be taking a look at that. Okay?
Yeah.
Thank you.
May I make a comment on that, Senator?
Absolutely.
When you look across the United States, the number one payer for long-term care beds is Medicaid. And when you look at the Medicaid program overall and say, where does most of the Medicaid money go to across the country, is long-term care. Because of the territories' different treatment than states, the territories have been allowed to limit the amount of Medicaid that goes to long-term care. And in part, because as you know, our traditional by law, split with the federal government is 45% Virgin Islands, 55% federal, and it's just been a series of continuing resolutions. Like I believe the one passed last night gives us the 83% federal rate to December 16th. So again, it's just weeks, and that goes on and on. So it's been difficult for the local Medicaid system to be able to undertake having more beds paid for by Medicaid if they do not know that they're going to have the dollars to come up with the local share. So this is where we lose. When Seaview was open, it was either 20 or I believe it increased to 25 beds of the 40 at Seaview were designated for clients with MAP, with Medicaid, and of course we've lost those. To some extent, although it's no one would agree it's the best, since we do not have any CMS certified long-term care facilities in the territory right now, that when you go to the States or you go to Puerto Rico, you can find a facility and at least you get most of the costs paid for through the Medicaid system, particularly right now where the federal government would pick up 83% of it. And so I think long-term, what's going to be needed is this increased number of beds, but also the support given to human services and potentially private entities to be able to get through the Medicaid certification process, and then to use some of our Medicaid dollars, because as you will know, Herbert Gregg Home, Quinn Louise Home for the Aged are 100% general fund budget.
Yes, absolutely.
And,
we will fund it.
and that's one aspect that you can't overnight, but it can be worked on.
Yeah, I think ultimately what I want to do is at least bring some relief to the hospitals. I think that for far too long we have had this situation where the mere fact that these individuals, a lot of them don't even require full-time medical care, but rather just utilizing it as residency, and the time has come for us to really sever that situation and make it a little bit more manageable. All right. At this time, the chair will open up the floor for a 6-minute round, and we'll start off with Senator Blyden, and then we'll come to Senator Bulk and Senator Carrion. Senator Blyden, you recognize for your 6 minutes.
Thank you so much, Mr. Chair, and good morning to my colleagues, the listening and viewing audiences, staff, central staff. Good morning. Good morning to Board Chair Finch. Good morning to CEO Smith, and good morning to ED Smalls, and thank you so much for your testimony. I must say that I do agree with my chair. This is a very comprehensive testimony. I appreciate the data. I appreciate the picture. That gives a clear indication of exactly where we're at in terms of timelines. But before I go into my line of questioning, I want to ask all parties involved, Mr. Smalls, Mr. Smith, and Board Chair Finch, in respect to the FISNA, in terms of communication, have this information that has been shared with us here today been shared with FISNA thus far? Let me start with Mr. Smith, CEO Smith. Do you know?
Good morning, and thank you for the question. Just for the record, my name is CEO Cook, and
Sorry.
I think
I'm
you're
sorry.
addressing that question to me. The information relative to the information
Mr. Cook,
relative.
it's just a yes or no. I just want to ask yes or no. Have it been shared? Yes or no? As far as you know.
Today's presentation has not been shared with the VISNA committee, but we do give frequent updates to the nursing and all employees at the hospital.
Okay, thank you. ED Smalls, do you know?
Good.
Especially that information you shared was critical. Those are very important information that you shared with us today.
Good morning, Senator. As CEO Cook indicated, not in the detail that I presented today. However, there is constant communication between the leadership of JFL and the nursing staff.
Okay, thank you so much. Board Chair Finch?
I would give the same answer, Senator.
Okay, the reason why I asked, and I made a statement because CEO Cook mentioned that it was irresponsible, but I believe we got to be careful when we speak, because I believe the nurses and all other individuals at the hospitals are concerned just as we are. And I believe it's the information was not clear enough to them in terms of the logistics, because ED Small spoke in respect to many logistics where he spoke to the pipe distribution system, how long it takes to support in terms of long-term planning, how it will support the VICC. He spoke to the oxygen delivery system that's completed in October, will be completed next month. He talked to the propane tank that needs to be removed and generators installed, etc. And as you stated, CEO Cook, you spoke to the safety matters, and I do agree with you. But it's clear and it's obvious that there needs to be more communication, and I believe that we are all on the same page and we all want the same results. So moving forward, I believe there needs to be more communication in respect to what's going on with all that's going on with JFL North and the interim hospital, because I believe that there's light at the end of the tunnel, and I'm happy to see exactly where we're at right now at this point. And the staff has been doing their part, as you stated, CEO Cook. I appreciate them also in what they are doing and what they have been putting up with. So we just got to be careful in the words we use moving forward and assure that we communicate with all parties involved to assure that we're all on the same page. Edie Smalls, you spoke to the Interim Hospital and GFL North and exactly where we are going. And you also spoke in terms of the territorial board involvement. Let me ask you, the water tank, the 260,000, the 260,000 water tank with the in-beds, etc. And you spoke to a process in terms of inspectors coming down and so on and so forth. For the first phase of that water tank, in your opinion, do you foresee any challenges or anything where they will say, well, we did not do this right or that right, and we can move forward expeditiously?
Thank you for the question, Senator. Currently, we do not foresee any challenges as it relates to the installation of the tank. One thing that I perhaps did not elaborate when I mentioned about the fact that there's two different pours. The first pour is approximately 3 feet deep and a 30-foot diameter. So that's a huge amount of concrete. The following week, there's another pour that's 28 feet in diameter and also about 3 feet. So we're talking about approximately 6 feet thickness of concrete. Concrete by nature has a cure time, meaning that it must cure for a minimum period of time, after which then you could put weight on top of it. The installation of the tank itself is not considered considerable weight that would be atop the concrete. So that's why that process can proceed. The actual filling of the tank with water to its full
1 minute.
capacity, that's where we have to make sure that we adhere to the cure time for the concrete.
And I'm happy you mentioned that because that was my next question, because I know the concrete must be cured. So I appreciate you putting that on the record. Also, the mechanical system, which will support both the GFL North and the temporary structure at the same time. And you stated in your testimony that that was the most critical piece, because without that, you could not move forward in any way, shape, or form. So you say that's completed now, or it should be completed in totality by next month? Well, I did not remember what you said about that.
Okay, that is an ongoing, and it will be completed in totality by the end of October. All of those systems that I referred to in my testimony, they're physically on the site. Some are physically placed inside of the building. Some are waiting for one contractor to get out of the way so that other piece of equipment could be put inside of the building. But all of the piping, electrical that's associated with all of that equipment is ongoing and to be completed by October 31st.
Time.
Okay, very well. Thank you for that. And in closing, Mr. Chair, I also want to state for the record, when it comes to the borders of the hospital, I'm happy that you're working toward a resolution, because that's where I was going, but apparently it has already started, so I appreciate that, and thank you so much for your testimonies and responses. Thank you, Mr. Chair, for the time.
Thank you very much, Senator Bloyd. And Mr. CEO and Mr. Chair, I think I need a commitment that, in fact, that there'll be some communication. I know that this presentation was made or prepared, just recently for this hearing, but nonetheless, I think that there should be some communication made with the Nurses Association or the rank and file, because they're your best partners, and they certainly need to be briefed and what's transpiring at the GFL North, and so that they too could be aware of what's going on. So I need a commitment from you that, in fact, the associations and the rank and file, whether by email, whether by committee meetings, whatever forum that you see fit, I think that I need a commitment that, in fact, they'll be briefed.
Absolutely, sir.
Thank you for that. So I know that, Mr. CEO, you mentioned that, in fact, that the negotiations have started, and I know the negotiation is what it is, right? It's an opportunity, and sometimes there's a tendency to start at a low level and meet somewhere in the middle. But from the text messages that I've received is that the associations, the unions are very discouraged by the initial conversation in respect to the negotiation. And just so you could be aware of that, I mean, certainly I know that these are ongoing matters, and you probably can't have any public discussion in respect to that, but they feel a little bit demoralized by the initial overture
by the administration in respect to negotiations for the nurses' salary.
Would you like me to respond?
Well, if you have anything to say to that, I mean, I know it's an ongoing matter. But.
Well, yeah, I won't say too much because in the ground rules that we all agreed to during the negotiations is that we weren't supposed to comment on how they were going. So I won't comment much further than that, other than to say that, you know, we value the nurses, and we want to pay as much as we possibly can, you know, to show that value. Quite honestly, I don't like the process. I wish we could just have more of a direct dialogue to say, hey, this is where we think we're at, this is what we think industry norms are, and move things forward. But as you mentioned, start low, they start high, we meet in the middle. It lends to that exact kind of feeling that because we're starting low, we know that we're going to negotiate, but it makes it feel that it's less valued, and that's definitely not the case. So I appreciate your comments.
Very well. Thank you for that. And before we go to Senator Balkes for his 6 minutes, quickly, do you have someone in your staff that could discuss the premium pay issue? You know, that continues, my office continue to receive calls in regards to the premium pay. You know, there's no clear reason or rhyme, in my opinion, as to who gets the premium pay, who's eligible for it. You know, what is transpiring in that space in terms of communication and discussion? Is there an avenue for the employees to be able to query, you know, the eligibility for premium pay?
Yeah, a great question, and thank you. Again, this is Doug Cook, CEO. The premium pay program that was rolled out by the government, we were given certain criteria to submit names for. And that criteria is really around those employees that worked from March 2020 through March 2021. There was a qualification of number of hours, so I believe the minimum employee had to work 80 hours during that year to at least qualify. The next things that were on the list, from my understanding, is that any employee that worked those minimum number of hours and made less than $50,000 annually was eligible for a bonus of $2,000. Anyone who worked above $50,000 but below $70,000 was eligible for $1,250. So we submitted JFL. We submitted pulled our payroll records of anybody who worked during that time frame, and we submitted 625 names that were eligible. The first batch of checks were distributed to us on August 19th, and we received in the first batch 299 checks, and those had all been distributed to our employees. We are awaiting future distributions or rounds of checks. I assume that's still in the works. We have 111 employees that are under that 70,000 threshold that haven't received checks yet. Mm-hmm. So that's our update.
Okay, very well. So there's, I guess there's some additional checks to be delivered at some point. Have you been able to glean when those checks will be coming?
My understanding is there's multiple rounds of checks coming. I have not received an update on when the next round is coming, but we have made that request into the Department of OMB.
And are you aware of how the checks are sent out? Is it alphabetical order? Is it by area of assignment? Is there any methodology used to determine who gets the check first, second, or third?
To our understanding, that there is no order into the process, at least from the checks that we received. We could not distinguish that it was based upon a specific department. It wasn't specific, like alphabetical or anything like that related to how we were receiving them in.
Very well, thank you. Senator Balkes, you recognize for your 6 minutes at this time.
Thank you, Mr. Chair, and greetings and salutations to everyone. Feliz mes de la herencia hispana. Happy Hispanic Heritage Month. Good morning, Executive Director Smalls, Chairman Finch, Executive Officer Cook, administrative team of JFL. While I'm not a member of this committee, I understand the importance of healthcare and this very critical project for the island of St. Croix. I certainly can understand the issues of the healthcare workers and their concerns that have worked through storms, the pandemic, and obviously that has been an obvious deterrent to the completion of this project. But second to your staff, your nurses and your doctors, your most important factor in operations is electricity. Healthcare facilities require electricity for operations, your lighting, your security systems, fire alarms, med systems, environmental controls like AC, hot water, cold water, etc. And of course, to house your records and the array of electricity-dependent durable mechanical or medical equipment and devices to provide care and proper service. Now, I know that there has been a number of outages. I think the most recent one was back in July of 2022, and I believe that was a double generator failure of some sort. And I'm curious to find out if that issue has been rectified and what steps are being taken to make sure that we are prepared for such an outage that would not disturb the operations of the medical center.
Thank you, Senator. Doug Cook, CEO. I will begin to answer that question. Yes, our last outage that we had back in July, where we had a multiple generator failure for, I think it was like 40 seconds, was unfortunate. I'm sorry, 24 minutes, was an unfortunate time. Since then, we have brought in certified electricians that service our generators to evaluate, to fix and maintain those generators. I would say that we've had multiple outages, electrical outages in the community affecting the hospital since that time, where our generators have functioned as intended. That being said, they are not in good shape. We have 2 generators that are, I don't know if they're 30 plus years old, but are, I would say, limping along, and we are constantly working to maintain them. During the most recent Tropical Storm Fiona, we had multiple outages with electrical power, and the generators performed, but we had to do significant maintenance on them, and we have to continue to do significant maintenance on them. I'm actually having a meeting after this Senate committee specifically about our generators.
Okay, excellent. So I know that also there's 2 1200 kW generators that are slated to run the facility independently. What is the status on those? Are those one second. Are those separate from the other generators that we're talking about?
No,
Or
those
in
are
fact the same
the
ones?
2 generators
The
we're
same
talking
ones,
about. Same
the
ones.
30-year-old generators.
Yep.
Okay, so, and are there any plans to replace them with newer models that could potentially help operations?
Yeah,
rather
so
than try to maintain them?
Thank you, Senator. To answer your question, the meeting I'm having actually following this meeting is specifically about those 2 generators. One we actually had repaired again yesterday, and we had to actually take parts off of one generator to make the other more sustainable. So we are having a conversation later today about what is the need of potentially bringing in a rental generator to support the hospital and its needs going forward. Clearly, it would not be the sourcing of these type of generators, the size of them, you would not even be able to replace within months because of what the infrastructure would take. So we are looking at what possibilities we need to do in the very short term.
Okay, thank you for that. And I wanted to also inquire about Meditech Expense and Medical Imaging, Inc. I know that those were pending contractors. Has that been settled at this point in time?
Thank you, Senator. Doug Cook, CEO. Meditech Expanse, both hospitals have worked together to create RFP. That process is ongoing, and we also have Mr. Greg Bryan, our CIO, on the line here who can answer any questions. But I think to answer your questions, yes, we feel comfortable that we are moving that project forward.
Okay, excellent. Concerning the borders, I believe that was Mr. Finch, Chairman Finch, I apologize. You mentioned that was an issue with the hospitals currently. Have you tried to work with any other nonprofit organizations like Catholic Charities or Methodist Outreach or Comprehensive Care Centers that would be able to help or facilitate with that issue that you're experiencing with borders?
There are, thank you, Senator Chris Finch. There are No entities that are providing 24-hour staffed beds, which is what the borders need, other than presently Herbert Gregg Home, Queen Louise Home for the Aged, and then a couple of smaller Turning Point on St. Croix, some board and care homes on St. Thomas. So we are working closely with Human Services to
1 minute.
really identify all of those. So we've been looking at facilities in Puerto Rico. Juan Luis presently has been paying for 4 people in Puerto Rico that were previous boarders. That Juan Luis, at his own expense, moved to Puerto Rico. Human Services has others in the same facility. Human Services is looking at taking a few people in both Herbert Gregg and Queen Louise Home for the Aged over the next several days, several weeks. Again, Puerto Rico, they've discussed with the other on-island providers. Department of Health has certificates of needs that they have issued to yet other entities that want to create facilities, but those don't exist yet.
And before my time runs out, I'm curious to know about nurse retention strategies that you have in place, if there are any. I believe that we bring in a lot of travel nurses, but is there any sort of retention type strategy or program whereas you can try to retain the travel nurse by obviously having them become a resident here in order to fill the gap that you're experiencing? I believe the testimony said about 52%. Do you have any nurse retention strategies in place?
Yes, thank you, Senator. Doug Cook, CEO. To answer your question, I believe strategies for nurse retention happen every day. We are actively working in multiple different areas on that. By expanding and improving the nursing leadership that we have that support all of our nurses to make an environment, a culture that is where our employees feel valued. We are also, one of the several things around nursing retention is actually pay. We've implemented we've rolled out the premium pay. We're working on the retention recruitment bonus packages. We've also are in nurse negotiations for the first time in several years with the unions. We've also trying to give our nurses more support by giving them access to actually more agency staff. We've signed a new contract with a new agency that will allow us to bring in more travelers to help support our current staff. So I think that there is a multi-pronged strategy in place. We can always do more. And I think it's that dialogue and that communication with our nurses, the frontline nurses, about what are they expecting, what are they looking for to make it a place where they want to practice for the coming years.
Okay, I would suggest CEO Cook and team to please continue on that pathway. Our doctors and nurses are most evidently some of our superheroes here in our community
Absolutely.
and territory. So thank you for your answers, and thank you, Mr. Chair, for the time.
Thank you very much, Senator Volquez, for your line of questions. Next, we'll go to Senator Carrion. You're recognized for your 6 minutes.
Thank you, Mr. Chair. Good morning. Is it afternoon? Good afternoon now. To my colleagues, good afternoon to the testifiers, and to the viewing and listening audience. I too join my colleagues in celebrating Hispanic Heritage Month, which began September 15. Proud Hispanic. So it's a time of celebration and recognition of the contributions that Hispanics have done throughout the years to the United States. But also next week on Thursday begins the celebration also of VA Puerto Rico Friendship. So I want to also extend my congratulations to the committee for the lineup of events that they have. They started this week with a gospel night, which was Wednesday, and next week is the village opening at Cananguita Ballpark on Thursday. So we invite everybody to come on by. Our prayers and thoughts are with those that have been suffering due to Fiona and also Ian's Path, the hurricanes that have caused so many damage. So we pray that God would continue to protect and lift up the families that have been suffering. So now to business. I just want to say I appreciate the testimony that was presented by testifiers this morning, particularly Director Small for his very comprehensive testimony and for really presenting the visual component of it, because I know a lot of people in our committee weren't too sure what was going on in JFL North, and being able to see visually the progress, I think really says a lot. We've had the opportunities to walk through the facility more than once, but I know a lot of people in the community, like you mentioned, only see what you could see from the street and don't really have an idea of everything that you all have done thus far. So I commend you for that. I do have a few questions. I know Commissioner Finch really pointed out and addressed one of the challenges, which is the borders, or maybe that's your main challenge at the moment. But I want to ask you, are there any other challenges that you are concerned about other than the borders with, that have to do or can affect the transition into JFL North?
Well, there's a couple of things, Senator. Thank you for the question. Certainly, as brought up earlier, the ability to hire enough nursing staff is constantly on our mind. Just yesterday, the Joint Commission on the Accreditation of Hospitals is this week doing their review of Schneider Regional Medical Center, the 3-year review, and is speaking with the leader of the nursing regulator that was inspecting Schneider. She mentioned, she described it as a national problem at the president's level of getting enough people at the bedside through hospitals throughout the country. So we know our ability to compete in that field is always going to be a challenge, no matter what we can do. So that is that's an extreme concern. We are certainly hoping that as we open it, that ultimately when CMS comes and does their inspection, that we're able to pass that with flying colors, and we don't have anything we have to sort of undo, redo, do over. Seek would probably be items that we have to seek waivers for. CMS doesn't really have a temporary hospital guideline. You're either a hospital or you're not a hospital. And so even if you're a temporary hospital, you're supposed to be 100% a hospital. And so until that gets through that inspection, we're not going to know completely how we do. We're doing everything we can to make sure we pass every possible function. There is there's a concern. I think Senator Francis brought it up earlier. There has been a tremendous need in the community for psychiatric beds. We've had 0 in St. Croix hospital-based psychiatric beds for a very, very long time now. We will have a few at JFL North. My guess is there's going to be huge demand for those beds, and they're going to be far from adequate numbers.
Well, thank you for sharing that. And we're hearing you in regards to the shortage that we have in the field of nursing. And I think part of the question is the solution to that, and what is the hospital doing to really fill in that gap? And how can we assist you in that endeavor? Because clearly it's not something that's only affecting us here territorially, but there is a national shortage. So we have to look for ways to maybe incentivize individuals to really seek and pursue this field, but also to, like we mentioned before, retaining the ones that we have. Cost of living clearly in the Virgin Islands is high, so we really need to, apart from the lack of housing, which also creates a problem, we have to have the proper infrastructure in place if we want to really attract nurses. But definitely we need to increase the salary for nurses if we want to retain them and attract others in that field.
Right, and I think also, Senators, I know, for example, when I first moved to the Virgin Islands, most school teachers came from the mainland. Over time, the ability to educate teachers here was increased greatly, and that changed. I think we're going to have to put every effort we can in making sure there's enough opportunities to become an RN, to become an LPN on island, so that it makes it more accessible for people who are living in the Virgin Islands who may not have the ability to travel off for several years.
The same is also with regards to short-term the shortage in long-term care services in the territory. So we really have to find ways to incentivize nonprofits and maybe people in the private sector to endeavor in that field, because we clearly have a need and a shortage. I think my time was called. Thank you, Mr. Chair. I'll continue later. Thank you.
Did you have a follow-up question, Senator?
Yeah, I do have a follow-up question. Mr. Chair, you mentioned, the chairman mentioned about the cost that this is for the borders, that is, having the borders within JFL Hospital. Can you quantify that? What is that? What is that cost?
I believe Mr. Cook would be better at able to answer. The point I wanted to make was that becomes a bed that is zero revenue for the hospital. There's no one the hospital can charge for the border patient. They are not a hospital patient, so there's no justification of a charge. If that bed was either occupied by Medicaid or Medicare or Cigna person, the revenue would be different, but at least it would be revenue. And then plus the knowing that they may have to delay surgery, knowing they may have to stay in the emergency room, it leads towards, I think, more incentive for people to seek medical care outside the territory, so it hurts in that respect as well.
Thank you, Senator, for the question. Doug Cook, CEO. As Chairman Finch described, it's hard to quantify. There's a lot of different ways you can quantify costs. Are you talking about reduced revenue? Are you just talking about physical expense? But we've done this a bunch of different ways, and what we've really come up with is about $1,800 a day is the cost to the organization to fill that bed with a boarder and not with another patient.
And if I may, just a follow-up question. The 4 that you have in Puerto Rico, how much is JFL paying for the care for those 4 individuals? Because that also can give us an idea of that cost, too.
Thank you.
Thank you, Mr. Chair, for leading us.
We pay $5,100 a month for each patient that we have in Puerto Rico. I think there's some recent quotes that number may have come down a little bit to $4,500, but our current bill is $5,100.
Thank you very much, Senator Carrion, for your line of questioning. I know that Senator Sarro has joined us. Please, Mark Clerk, please mark Senator Sarro as present. Before we go to her for her 6 minutes, I wanted to ask the oxygen generator donation that was done by Tim Duncan. What's the status of that unit? Is it operational? What's happening with that?
Good afternoon, Senator.
Good afternoon.
That oxygen generator is currently not in use. It was anticipated that we would bring it up to JFL North and incorporate it into that oxygen delivery system.
And that's still the plan? I mean,
It's still a plan. Unfortunately, the size of that generator is not going to be able to meet the demands of the hospital. However, it will serve a purpose, especially for a backup or to assist with filling of empty cylinders.
Okay, so that generator have never been put in use, or
No, it has not been put into use. And again, if it was put into use within JFL, it would have to be demolished and relocated. And I think that's why, prior to us coming on board, that was one of the decisions as to why it was not installed at the time.
Okay, very well. Thank you. Point of inquiry, Senator Bolkas.
Thank you, Mr. Chair. I have a quick question. JFL, what is it classified as? I mean, I know it's not a full-service facility, but what is the current classification?
Of JFL Maine Hospital?
Maine, yes.
We are classified and certified by CMS as a acute care hospital.
And once the North opens, what would be the classification for North? The same or
The same.
not a full service?
A full-service acute care hospital.
A full service acute. Okay.
Yep.
Thank you.
Thank you very much. Senator Saru, you're recognized for your 6 minutes.
Mr. Chair, good morning. Senator Francis Heidegger was here way before me, so I just wanted to
Very well. I didn't
let you know. Okay, thank you. No problem.
Yeah.
Thank you.
Thank you, Senator. Heidegger, I didn't recognize that you were here, so you're recognized for your 6 minutes and welcome. Madam Clerk, please record her as being present.
I would like to thank my colleague for recognizing that I've been here. Appreciate it. Good morning to my colleagues, the testifiers, Good morning to the people of the territory. The first question I would like to ask is, can you share with me what has been the total number for change orders for this specific project?
Senator, I would not have that information before me here today.
Okay, so you came for a discussion on JFL, but you don't know a total. Okay, so do you know with all the change orders, what's the total amount of the projects thus far?
In totality, if I'm not mistaken, the original contract for the main facility was just over $48 million. The FF&E was approximately $27 million. Subsequently, there have been a number of change orders through the process. Now, that number, those are the numbers that are contracted for that particular contract. We also have the contract currently for the CMU building, which is approximately $11 million.
Okay, thank you. One of the things that was stated in the testimony had to speak about the leadership feeling that they were the most disappointed. I kind of beg to differ. I have a major concern with the fact that individuals, unfortunately, who have to leave the territory for cancer treatment cannot get services here because of this long-awaited project. They're the ones that's suffering, to be honest. They're the ones that most disappointed. But I understand you having some sort of connection or emotion to feeling disappointed, but the people that really need the services, they're the real disappointed ones. So what I want to ask, as several of my colleagues have asked, of some type of commitment date as to understand when this is going to be completed, because I was elected in 2020 and this conversation was happening. I was sworn in 2021, and I was here last year when we were talking about it being completed by summer. And here we are in the fall of 2022, and we are still having the same conversation. So I am really, really concerned as to really getting some type of idea or a legitimate ballpark as to the completion of this specific project in regards to the modulars and starting off to get that completed and letting that go into use so that we could really move on to the demolition and really start building out of this other JFL project and hospital. Tell me some time frames. I understand you're not putting numbers on certain things, but I need to be able to respond to my constituents when they call and they're frustrated.
Senator, with all due respect.
And yes.
Senator, with all due respect, as I mentioned in my testimony, some of the challenges that we were faced with, we know we had the COVID-19 pandemic. Unfortunately, there are other world events that are occurring, which has impacted the delivery of materials that are needed to complete the project. While we can sit here and say that, yes, this is our anticipated completion date, as I stated, we were faced with what's called force majeure, where a contractor by law cannot fulfill their delivery because of an act of God or something like that. Those type of events are unforeseeable and unfortunately has impacted the completion schedule. Bring fast forward, in my testimony, I indicated that barring any unforeseen circumstances, all mechanical systems are to be online as of October 31st, 2022. Prior to that,
outside of acts of God, and I fully understand acts of God. Outside of that, are there any penalties in place in the contract for people not completing benchmarks or time certain for projects to be done outside of acts of God?
absolutely. Every contract has built in if a contractor does not fulfill their responsibility. However, at this point in time, there are certain instances, well, most instances, that we could not hold a contractor accountable for any of these delays.
Okay. So basically, at this point, hopefully around a time certain October, we'll see something. I also wanted to ask a question about sanitation. I was listening and reading in regards to porta potties and the utilization of those. And you know, the hospital should have the utmost sanitary situations. Do you think that that is a feasible situation or in the best interest of the hospital? Specifically, I guess we could speak to the CEO. of the hospital?
Good afternoon, Senator. Doug Cook, CEO.
Good
Do I think that that is the best use? No. We are, but I understand that this has been in place for going on before the actual hurricane. So we do our best to maintain those restrooms adjacent to the emergency room for our patients and for our staff.
Okay. Now, in regards to utilizing federal grants to do, for example, the modular and stuff like that, is there a time certain that these monies have to be spent? Have we expended all of it? Does any of this money have to be returned if we do not spend it by term certain? Could you tell me a little bit about that aspect?
Well,
1
Senator,
minute.
I really appreciate because you raised one of our major concerns, and that is making sure that we adhere to all the rules and regulations set forth by the federal funds to ensure that, one, that we will be reimbursed in its entirety and that we will not have to return any of the funds. So that is key to any decision making that we've been doing. Is there a time certain for time expenditure? At this point, no, because this is considered what we call Cat B, emergency measures that are the result of the hurricane. Until you could complete those emergency measures, that's the time, you're within that timeline. So there's no set timeline.
Okay. I think time was called for me, so thank you, Mr. Chair, for the indulgence. I, as a representative of the people, I am just hoping that at some point, thank you. I am hoping at some point that we are able to get this hospital to a place where we could start utilizing all the monies we have invested into these modulars so we can get the JFL up and running and built. So I'll be cheerleading you in all your work to get that done, but understand specifically the people of St. Croix, they're desperate and they really want to get some help in this regard because safety and their health is number one. If we're not healthy, nothing else matters. Okay? Thank you.
Thank you very much, Senator Francis Heidegger. Madam Clerk, please recognize the presence of non-committee member, Senator Genevieve Whitaker, as well as committee member, Senator Franklin D. Johnson. Senator Sororo, you recognized for your 6 minutes at this time.
Thank you. Thank you, Mr. Chair, for the time. Mr. Finch, on the long-term care discussion, because I think you're in a unique position as the former Commissioner of Human Services and as the head of the hospital board. So what does that dialogue look like? Because the board issue didn't start post-storm or post-pandemic. So what is the dialogue? I read your testimony, but what are your timelines? What does that strategic discussion look like?
Senator, there's both I think a short-term and a long-term answer. The short-term answer is we are meeting weekly with the Department of Human Services, Department of Health, and Office of Management and Budget to address the current borders at Juan Luis and Roy Lester Schneider Hospital, and there are plans not for 100%, but for almost that, between a facility in Puerto Rico, between the two human services facilities.
So tell me, so what's your timeline on that? Because we never work on timelines in this territory.
I would say within the plans that are currently laid out, it was within the next 3 to 4 weeks. Some of the movement could happen quicker, but like we know, for example, Queen Louise Home for the Aged has to complete its COVID protocols before it can take anyone. And so there's a variety of placements. That's the short term. The concern, as I mentioned, is that we'll simply have new borders because this has happened before, and the long-term solution is really the territory doing what it can to increase the number both of facility beds and for home and community-based services, and that is a long-term range. But as I tried to lay out in my testimony, we're far under what we need.
Okay, so that needs, just like how there's a judicial council, there seems to be a need for a council between the entire healthcare system, correct?
Correct, yes.
Okay. Mr. Cook, emergency room, do you have a fast track system in place?
Yeah, good morning, Senator. Thanks for the question. Doug Cook, CEO. Yes, we do have a fast track, but it does not function as a component of the emergency room.
So what does it function as?
It functions as an outpatient center, a place where we see outpatients, so post-surgical follow-up type patients.
Okay. So what are you doing now to shorten the time in your emergency room?
Several things. Making sure that, number one, we have the right amount of staff. But if you read during my testimony, what I stated is most of the times where we should have 12 to 14 to 16 rooms available, we're actually down to about 4 to 5 rooms on a daily basis because all of our other beds are filled up with inpatients that are waiting for an inpatient bed that are currently being housed by boarders. So we have to work around that process, and you really have to compliment our emergency room physicians and staff for the extraordinary efforts that they do to try to turn those patients through in that time frame.
Yeah, no, we're not denying the work of staff at all today. Now, let's talk about, I think in your testimony you said you have about 70-something full-time nursing staff, correct?
Yes, currently we are at 78 bedside nurses.
Now, the last time you gave us numbers, you said about 50-something, and that was the reality of the hospital not too long ago. And now you're saying 70-something. Are you including your part-time and other staff in that 70-something?
The number of 78 bedside nurses includes registered nurses and LPNs.
Okay, so did you include a part-time staff in that number?
Yes.
Okay, so you don't have 78 full-time.
I apologize. I didn't know if I said full-time. We have 78 bedside staff nurses.
Okay. Now, tell me your plan. Your auxiliary power at JFL was out roughly for a week and a half, correct?
Auxiliary power. No, I'm not. Can you explain further that question? We were never out without auxiliary power.
What are your backup power? What's your plans to maintain your backup power? That's what I'm asking you in a nutshell.
Oh, great.
1 minute.
Yes, we had that question a little bit ago. We answered that we have two 1,200 kW generators for the facility. We are currently working to maintain both of them. We actually have an emergency meeting after this in support of how we're going to bring in potentially a rental generator to make sure that we have one additional backup generator available.
Okay, so we're saying that we're working on that. That we're in the middle of hurricane season. That should have been done immediately.
Senator,
We're in the middle of
Senator, that has been done continuously. These are 30-plus-year-old generators that are constantly being maintained. We've had them up. They've been running. They've been functioned. They've been signed off on by external electrician. And then when they get energized and have to be utilized, different components of the units fail. And then we work constantly to fix them, to make them work.
So
and we're getting to a...
Hold a second. So do you need new generators?
Time.
We do need new generators, but we're not going to be able to bring in and replace new generators within a time frame of less than 6 months because of the size and the complexity of them. So, our best strategy right now is either to maintain the ones that we have and also look to bring in a rental generator.
Mr. Chair, were we going to have a second round? Because I had one more question. I can wait if we have a second round.
You go ahead and proceed with your additional question. I'm hoping I have the next block 2 in the wait. So we try to wrap this up. So go ahead and ask your additional question.
Thank you for the latitude. Mr. Smalls, briefly, if you could just give me some clarity here on the hospital redevelopment team and the concerns, of course, that we have were all these cost overruns and change orders. We've seen that with the propane project. We've seen it with Poly Joseph Stadium. So the body gave you $170K to pay staff, and that was supposed to be reimbursable. Then we gave you another $750K to keep the hospital team going, but you had outstanding bills to pay that ate up that $750K, correct?
No, that's not correct, Senator.
Okay, so help me out. Give me some clarity.
Okay, fiscal year 2022, there was an appropriation to each facility for $150,000 each facility, and the purpose of that money was to be able to cover the salaries with the intent that through the management costs, it would serve as basically a revolving fund that would reimburse that, that initial expenditure by each hospital. We have not received the management costs for the hospitals. The only project that really we have received any significant management costs has been the Charlotte Kimmelman Cancer Institute. We have not received a prudent cost replacement for Schneider nor for Wang Louis, so therefore we do not have that management cost. Fast forward to fiscal year 2023, that appropriation is now $750,000 for each facility to cover the expenses of the redevelopment team. We anticipate during fiscal year 2023, we will have received the fixed costs offer from FEMA for both JFL and Schneider, at which time, beyond fiscal year 2023, we should not be seeking any additional funds for the territorial redevelopment team. You alluded that the change orders and what have you relative to the contractors, that's independent of this particular fund.
Okay, perfect. Thank you for the clarity. Mr. Chair, thank you for the latitude.
Thank you very much, Senator Sarro, for your line of questions. At this time, the chair will recognize Senator Whitaker. You're recognized for your 6 minutes.
Good afternoon, Chairman. Good afternoon, colleagues. Good afternoon, Central staff. Good afternoon to our testifiers. Thank you. And I know it's been a long morning, so I definitely have listened and won't be repeating questions. What I want to find out is really the hospital board plan, real true concerted plan to recruit doctors and nurses. Do you all have a strategy, a plan that's written, and can that be shared with this committee? Because of course, as we know, we continue to face shortages of nurses and doctors. And can you also indicate which doctors and areas have you prioritized in the recruitment process?
The question is to me, Senator?
Yes.
Okay, thank you. For the nursing staff, it's really been two pieces, because really at the end of the day, if our salaries are extraordinarily below market rate, there's limited things we can do. So as a board, we have supported, and we're very appreciative of the additional money that the Senate has awarded to be able to enhance the salaries, and we've been supporting and pushing that as a board. In addition, with the ARPA recruitment and retention monies, of which the first payments were made just last week in both hospitals, has been another initiative to hopefully enable our nurses to feel that they're getting closer to market rate. Ultimately, since this is such a national problem and the nurses' salaries are just exploding upwards all across the country, we're going to have to do everything we can to keep up with that. As I mentioned earlier, I believe another area of focus is going to be to make sure that there are sufficient LPN and RN programs in the territory for, as people decide that they want to choose that as a profession, that they're able to get trained here. I'm on part of the committee with UVI that's helping UVI look at its medical school application, and of course there's a long-term goal in there that would be able to help with physician availability in the territory, both from the access to the students and then hopefully
And how regular are
graduates.
those meetings? Because I recently, as of this week actually, Dr. Hall and I had an exchange over a concern that was brought up about the teaching program at UVI. So have you been working on a regular basis and a plan to even support University of Virgin Islands and the teaching staff as well?
Well, the next meeting is at 3:30 today if I get out of here in time. They have, we had, Fiona killed, we were going to have an all-day in-person meeting for the first time that Fiona stopped. But this committee has only been meeting for a couple of months, and we've had several meetings in that period of time.
And in terms of so the goal is we've heard the date a lot. I went out last year, went on the tour, and we keep on talking about this opening date. So what is the plan B if you do not make the opening date? What else is going to be done in the interim if you're not able to open for this next date that you guys are proposing?
We just keep working at it, Senator. I mean, this project has had an extraordinary number of challenges, some with hindsight, you can feel like if you had a crystal ball, you would have done things differently, or a time machine, you would have done things differently. But we have been, and Mr. Smalls has been very diligent in keeping this in front of all of us in the board and in the JFL leadership. He's in constant communication with Mr. Cook. Mr. Smalls and I are in constant communication nights, weekends. He's bringing his issues in front of to the board. I don't believe that there is any time where we have really passed on a change order or a contract amendment. We've done everything we can to expedite these as quick as possible, and just as the challenges come up, we address them. And we would just keep doing that.
To CEO Cook, one of the conversations we've had early on in your tenure, we had our individual meetings as well. Can you really highlight the efforts in terms of some of the retraining, some of the professional development support that, as your leadership is, in your leadership position now, that you've executed to really support the staff? A lot of concerns come when people enter the emergency room, who can be seen first, and as an example, how have we worked on real retraining and training efforts to support the staff?
Thank you, Senator. Great question. Training and constant education to our teams is very important, and quite honestly, we probably don't do enough of it just in medicine. We constantly need to be doing this because technology continues to change, so it needs to be a cornerstone of what we do, and it also goes back to how we continue to retain good employees. We just this past week, we had a meeting with our OB physicians on how we're going to work together to make sure that our nurses are properly trained in fetal monitoring testing. So we have a plan in place for that as just one example. But there needs to be a lot more work done in this space. One of the things we want to do is get to students early. So we started a graduate nurse program here so that this year we've hired 9 of the UVI graduate nurses to come on board. And we've developed a NCLEX training program that they can go through that we sponsor to assist them in training them to get their NCLEX in there. What we found unique in this is that we had many other nurses that have gone through nursing school but couldn't pass the NCLEX. So they're working in our hospital in different positions. They're working in the lab, et cetera. So we had, I believe the number was 8 other employees join that program so that they can be eligible to take the NCLEX and hopefully pass and come on board.
Thank you, and thank you for your answers. Thank you. Thank you, Chairman.
Thank you very much, Senator Whitaker. We got one of the best pass rates when it comes to NCLEX here in the Virgin Islands. When UVI prepare them, they actually go through an additional semester in preparation for being able to take the NCLEX. So I must say, kudos to UVI and also to those students. We have a very high pass rate in the space. Madam Clerk, please recognize the presence of committee member Senator Kenneth Gittins and Senator Franklin D. Johnson. You're recognized for your 6 minutes at this time.
Good afternoon. Thank you very much, Mr. Chair. Good afternoon to my colleagues. Good afternoon to the testifiers. Good afternoon to the viewing, listening audience, and the audience right here today with us. I want to start out with CFO Cook. I saw you had a lot of meeting, a lot of discussion with many agencies in regards to the borders, but I haven't seen any discussion with the Attorney General office. And my reason for asking this, a lot of the borders are seniors that are people that have pension, have Social Security, have Medicaid. Family members are collecting this money whilst the hospital is taking all the debts. Why have we not had that type of discussion with the Attorney General to find out where we can go if someone is going to leave their loved one in our care but yet collect all the benefits?
Good afternoon, Senator. Thank you for the question. It's a very good question. We've been, as you mentioned, we've been working with multiple different agencies. We have not reached out to the Attorney General's office. We do have our in-house counsel who is who screens these patients, these not patients, these boarders, to do they have family? Are they involved in this type of scenario where there are assets out there that we can do? But we have not physically or personally approached the AG's office with this, but I can commit to doing so.
And my follow-up question with it is, majority of your boarders do have those benefits, do they?
I don't know if I'd say a majority. Each one has to be looked into individually, but from what I hear, there are specific ones that do.
I really would appreciate if you could look into that direction, because I think it's unfair to those who are in there that someone would just leave them like that. But at the same time, it's more unfair to the people of this territory that someone is collecting a check and we're taking care of all of these bills. It's absolutely wrong, and I don't call a spade, I'm gonna call it how I see it. If they're getting benefits and someone is collecting the benefits from them, then we need to find a way to stop it. And then maybe people will start being more responsible for their loved one. It hurts me so much when I see this and hear about these stories, knowing that many of these seniors deliver service to the people of this territory and now is left alone. So we have to find a way to get around it and make it better for all of us. My next question is, again, to Koch. When was the last communication with that long-term facility in Puerto Rico? When was the last time you had conversation with them?
We actually had the long-term care facility physician and staff member on island yesterday at JFL, touring our facility, talking to some of the patients that they could accept over into Puerto Rico. So the last communication was as of yesterday.
As of yesterday, sounding good, like we have something promising?
Yeah. They have some room for some of our patients, and again, we're as we talked earlier, we're trying to make sure that we put these people in the right location. If we can support them on island, we will absolutely do so. But recognizing the need and the opportunity, we will take advantage of that availability.
And I might be asking questions that was asked and answered already, and so I'll still go along to find out what was the answer. We mentioned in October 17th for Juan Luis North. And I mean, this date has been pushing each time with different problems, different issues. And the last time you guys were here, I said to you guys, you really need to show the people of the territory what's there and what's waiting and awaiting them. Because sometimes just that hope makes someone sleep a little bit better. And you have a hidden gem there. My tour that I saw of Juan Luis North, I just can't wait to see this place open. But every time we hear a different pushback on the date, do we have a solid date now?
I'll let Mr. Smalls answer that question, but I will say that, and I'll commend Mr. Smalls for, you missed an excellent video, which I'm sure you'll have access to.
Yes,
that showed you and the community what's inside JFL North.
Okay.
Absolutely, Senator. You really missed a great opportunity, but I know you'll have the opportunity to take a look at it later. But yes, I agree that the dates have been changing, and this is by no means any type of excuse or whatever, but when manufacturers cannot deliver because of shortages of material or goods that are required to complete the facility, unfortunately, the date has to be extended. It's not that anything that we want. We've been pushing as hard as we can push for as long as we can push. Right now, currently, all the pieces of equipment that are needed are currently on island, on the site. So right now, the date is October 31st for all of the equipment to be up and running and functional. Of course, you've got to go through the certification process. That certification process is going to begin as early as the third week of October until we get all of the certifications completed, after which we'll be ready to move patients.
All right, I think their community is awaiting it. It's something that's needed so we could start preparing for Juan Luis Hospital itself. Time is not waiting on none of us, so please, let's see if we can finally execute this. To Mr. Chris Finch, Chairman of the Board, what is the number of traveling nurses working at Juan Luis Hospital? What's the salary? What are they being paid? If anyone knows, it doesn't have to necessarily be.
I want to pass that to Mr. Cook because that actually has been a very much of a fluctuating number.
Thank you, Senator. I'm looking through my notes here. I don't have the actual number of traveling nurses that we have on staff right now. As Chairman mentioned, the number does fluctuate. But I would say that we're in the range of having, I'm going to say approximately, Grace, do you know? Grace? 22? Yeah, exactly 22.
22?
Yeah.
All right. And my last question, in regards to Snyder, are we looking at complete rebuild still, and where are we in that position right now with Snyder Regional?
Senator, I believe you're aware that we did receive from FEMA a prudent replacement for Roy Schneider Hospital. We're actually going through getting ready to embark on a strategy session on how to go about replacing Roy Schneider Hospital. Okay. It's a little different here than here Wang Louis, whereas Wang Louis, we're demolishing and building anew. Perhaps one of the strategies that we're looking at for Roy Schneider is build anew and then demolish. Okay. So stay tuned, great things are coming.
Thank you very much. Thank you very much, Mr. Chair.
Thank you very much, Senator Johnson, for your line of questions. At this time, the chair will recognize Senator Gittins. You're recognized for your 6 minutes.
Thank you, Mr. Chair, and good afternoon to everyone. Let me first take this opportunity to thank our first responders and all those emergency responding agencies, Public Works, WAPA, and everyone that kept us safe last night into today. I saw a lot of road work being done on my way up here. I apologize for my tardiness as I felt compelled to attend the funeral services of Miss Maud Dowdy Roberts, our centurion who made 100 years on September 3rd and died on her birthday. May she rest in peace. Gentlemen, you know, as I sit here and I look out, I see three men that I have a lot of respect for. Mr. Darrell Smalls has been a personal friend for quite some time. I've held a lot of respect for the former commissioner in his various capacities, and now you, Mr. CEO. But I'm telling you, as I sit here, I'm a bit livid. And it has come full circle personal. And I don't like to bring my personal stuff to the Senate floor, but it affects the people that lives in this territory. And my latest experience with the Governor Juan Francisco Luis Hospital was not a good one. And for us to sit here today, I didn't come here for a mortal soul to be patting themselves on the backs about JFL North. There's no reason why we shouldn't be discussing the final completion of a newly built hospital. But rather, we still here discussing and patting ourselves on the backs about a temporary hospital that should have been done 5 years ago. I am like sick to my stomach. Now, my experience was, which one I want to ask about, you have a compliance unit within the hospital? And if you do, how many people are assigned to that compliance unit?
We do have a compliance unit, and number's 2.
Excuse me? Can you pull the mic? I want to be able to hear you. I really didn't hear your response.
I said the number was 2.
2 people assigned there?
Yes.
And how is it working?
Can you be a little more specific with your question?
Is it working out for you? You're the new change agent that just came on board. Since you came on, how is this compliance unit working out?
Well, we do a monthly report to the boards. We do updates. We are frequently evaluating risk across the organization.
After surgery, you have what you call post-op. That's what
Yes,
it's called?
That's correct, yeah.
How is that working?
To my understanding, well, normal. I haven't heard any recent concerns with the post-op department from staff or our patients.
So you're fully staffed up with this post-op section within the hospital?
We have a number of traveler staff that we brought in to complement the OR staff. We may be down a position or two that I can get you a hard number. Actually, yesterday I met with our chief of surgery, and he was actually fairly satisfied with how things were going, from his words.
Well, I'm not satisfied,
Okay.
not one bit. My sister was, I would say, evicted from the hospital because, and this is why I wanted to ask about your protocols within the hospital when it comes to discharge. What does your discharge protocols look like? Especially when someone is discharged from the hospital in the evening hours. What do those services look like? What is supposed to happen? Because my sister just had surgery, and I'm saying, I don't like personalizing this, but this is what happened with me, my personal experience the other night. When a family member just had surgery, hip surgery, can't really walk on their own, and was discharged in the evening hours with no medication, no equipment, nothing to assist you, and not even knowing what the condition is at the house where she will be going to. What is your discharge protocol like?
Well, Senator, I would have to know the specifics of every situation to be able to respond specifically to discharge instructions about a specific patient. As you know, every patient is different. We rely on our medical physician staff to make sure that the patient is safe for discharge.
I asked for the discharge to be delayed one day to ensure that once she is out, that I can get whatever I need to assist her. Bedside commode, walker, everything. And I'm told by a doctor on the line that she has to be discharged now because the insurance is not going to pay for it. Listen, that was hogwash. As I'm sitting here, I don't even know how to express myself because I'm telling you, I am upset. I am truly upset because the doctor was telling me a bunch of crap on the phone. And the easiest way to get out of it is to say that it's the insurance don't want to pay because the insurance is not there to defend themselves. But we just met with the insurance just last week. And we know that the insurance doesn't determine how long you stay in the hospital.
Time.
It's whatever the doctor puts on that document. And if the doctor said that we have no further care or whatever, then that's what the insurance takes up. But the insurance doesn't make that determination. The doctor does. And lo and behold, because this doctor license was going to be expired in a couple days and already left the territory, my sister was put out of the damn hospital. And now there's no smooth transition because there's not another accepting physician to follow through. For her to even be able to get her PT done. So now we have to sit and wait and see how we will get her now to see another physician because the other physician, rightfully so, stated that they didn't want to have anything to do with the case because they did not do that surgery on the patient. This is not good for us. None of us. And I'm telling you, not because it happened close to home. These are things that we've been hearing about that I can't understand, and that's why I'm asking you about your protocols. These things must be in place and must be followed by everyone across the board. I don't care if it's my sister, I don't care who it is. It should be done right. So again, if you can tell me briefly, quickly, what, and if you do have discharge protocols in place, and whether or not we're reviewing these things.
Senator Gittens, let me start by saying I apologize for any lack of care that you perceive that you or your family member received. I'd be happy to talk with you offline on that topic to make sure that everything is covered. But I can assure you that we have a discharge process. We have a discharge team filled with case managers and nurses, et cetera, that follow process and protocols related to this to ensure that situations like this don't happen. So again, on behalf of me, you have my sincere apology, but I'd love to discuss this further with you to make sure that we ensure that transition of care is taken care of, but we also follow up to ensure this doesn't happen again.
Through the chair, I would like to have a copy of your discharge protocols and your post-op protocols. And lastly, Mr. Chair, if I may beg your indulgence, I just wanted to ask, I did hear part of the discussion when the chair was asking about the premium pay. Now, have Wang Louis, you spoke about 600 plus employees' names submitted for the premium pay. Have these employees been advised respectively that their names were submitted and not having to be in suspense whether or not they're to be receiving premium pay or not?
Yeah, thank you, Senator Doug Cook, again, CEO. The 625 names that we submitted, we did communicate with our entire employee base that these names have been submitted if you worked during that time, and that the first batch of checks had been received, and that we have communicated back to the Office of Management and Budget that we received those, and what we were told is that there was going to be more batches coming.
But we keep saying if you had worked between that time. That time is March, what, 2020 to March 2021 or something like that. Yep. But I'm asking, were those affected employees advised respectively that they are entitled and will be receiving the premium pay?
No, Senator, because we don't make the hospital doesn't make the determination on who gets that premium pay distribution. That is not handled by the hospital. The only obligation of the hospital is to submit the names of the people that worked during that time frame.
And I humbly disagree. Because you will have to determine to OMB. OMB doesn't know who is doing what their assignments are, etc. You have to determine that the agency and submit those names to OMB. So correct. I would like for agencies to notify the respective employees so that these employees don't have to be wondering whether or not I am entitled. Why would the morgue attendant not be one that receives premium pay? We had people dying every day during COVID. I mean, not as a result of COVID, but we had people dying every day. So why wouldn't someone in such a position not receive premium pay?
Again, Senator, I don't make the qualifications for the premium pay, so I can't answer that question.
Thank you, Mr. Chairman.
Thank you very much, Senator Gittens. Going back to the issue of quality assurance, what is the mechanism by which individuals that is dissatisfied with the services at the hospital, how do they get relief?
Yeah, thank you. We have what we call patient advocates, which is a number that I can get for everybody, but and we display that number throughout the facility and to all patients and families, where that they can call or we can call on your behalf, and they can come and meet with individuals or families or patients to discuss any concerns that they're having with their care. That's kind of an immediate process. We also have a risk management department where we forward all of our complaints to go to so that they're properly vetted and evaluated.
Do you have an opportunity to review such complaints and for again to ensure that in fact that the mechanism by quality assurance risk management is being adhered to?
Yes, so what we do with our complaints is we categorize those into different criteria, and then those are reviewed on a monthly basis, and they actually go up through a subcommittee that we have, a subcommittee of the board called our PI committee, and where they see those overall trends and are able to ask additional questions if necessary.
Very well. Is there any other burning questions from my colleagues as we go into a wrap up in this particular block? I wanted to really just quickly follow up in terms of what is the game plan? What is in terms of the transition? How are you developing that seamless transition from one facility to the next? Can you just quickly just touch on that? Because obviously you still have to continue to ensure that operations at the traditional Juan Francisco Louis Hospital occurs while transitioning into the JFL North. Can you speak to what that transition will look like?
Absolutely, Senator. We have been meeting on a regular basis over the last couple months, and not necessarily next week, but the week after. We're going to start rotating between the nurses, the physicians, and all the clinical staff in preparation for 1, tabletop exercises, 2, actual live exercises with a sample patient in preparation for that physical exercise. It's not just the physical transition of patients, but it's also the transition of dietary services, pharmacy, medical records, facilities. Everyone is going to be touched as part of this transition process.
Okay, and in respect to allowing for some smooth transition, at least a dry run, is there any contemplation in the discussion by which you could start to do a soft transition? Is there all of the components that needs to be removed from the hospital over to the JFL North require all of the amenities that you're still waiting to put in place?
Well, the one fortunate thing as part of this transition, much of the equipment and beds already reside within JFL North. So it is not in the way of too much equipment moving. So the purpose of the initial process, going one by one, each individual department, we'll do that first, and then after that, when we start to get to a live exercise, between dietary, medical records, nursing, the physicians, they will all be a part of that actual dry run, if you want to call it. Not just a tabletop, but the actual live exercise. Because part of this process, as we have it planned out right now, it would occur, let's say, on a Saturday morning beginning at 7 a.m. Meaning the shift that finishes at 7 a.m. that morning, the new shift, when they come to work, they will be coming to work at JFL North. So when those patients come up to JFL North, they would have already had their breakfast in Juan Louis. Their lunch and dinner will now be provided in JFL North. So all of that transition period, all of those logistics are, is what we're going to be going through over the next couple of weeks.
And does the transition period allow for or the need for additional nurses to be brought in from perhaps the school nurses from other facilities? Would you be able to handle all of the transition within JFL North, or will you need ancillary or outside support?
Of course, Senator, we're looking at any alternative or other resources that we might be able to tap into. But however, the big thing that we will do is when that date is defined, we look at what the census is, what is the condition of the individual patients that need to be relocated. Those that are ambulatory, meaning those that can walk, we could get those over much easier. Those that are confined to, let's say, a bed or based on their condition, they will be transported over via an ambulance. One of the things that we're also looking at in coordination with the physicians is, again, we're looking at a transition period on a transition day on a Saturday. So then we have to look at the surgical procedures that are done between Wednesday and Thursday and the condition of those patients. whether it's an outpatient surgery or inpatient surgery, whether it requires an overnight stay. So all of that is a part of the whole entire transition process. And it's not just the THR team. We're working collaboratively with CEO Cook, the leadership team, and all of the department heads within JFL.
Very well. Thank you. And again, thank you for your presentation here. And I'm hoping that there is an opportunity for you to continue to, well, certainly on Legit TV, we'll be showing this this hearing over and over and over, but certainly on the government access channel, any other avenue that you could get that information out, especially the comprehensive reporting that you gave, the overview of the facility and the work that has been done thus far. I think will be critical for the public to be able to continue to see that and have something to look forward to. At this time, I'll give you a 30-second closing. I didn't hear any takers, so I was ready to move on. Senator Balkas, you're recognized for a wrap-up question.
Thank you very much, Mr. Chair. And health and hospitals, I have to tip I don't wear a hat, but I wear a turban, so I'll tip it to you because I know that you have to remain very focused and diligent on your work for health and healthcare here in the Virgin Islands. And maintaining the balance between life and death is a never-ending battle where no one side concedes. So I know it's very difficult. And I have a question, a burning question that is mostly data-driven. Is there anyone here that has specific data that they can provide to us concerning the individuals that fly out of the territory and the specific areas such as whether it's cardiac, cancer, trauma, etc.? Do we have any statistical numbers that you can share with us concerning that?
Thank you, Senator Doug Cook, CEO. I can give you the specific numbers related to off-island transfers from January through August of 2022. We've had 177 off-island transfers. The top 5 services requiring a transfer, number 1 is neurosurgery. Number 2 is interventional cardiology. 3 is trauma, orthopedics. 4 is pediatric specialties. And 5 is higher level of intensive care services.
Through the chair, can I request that information for the committee, please?
Absolutely. What is the information you needed?
The statistical data concerning all patients that have to be flown out of the territory for services.
Okay.
Thank you, Mr. Chair, for the time.
Thank you. Senator Gittins, you recognized for your wrap-up.
Thank you. 2 things. How did JFL North stood up over your assessments after Fiona and the recent torrential rains up to last night? Was an assessment done this morning?
Senator, I was in the facility during both events. As I arrived in the facility this morning, there are some things that I have identified that I would like to mitigate going forward, to ensure that the facility does not have any challenges with the future longevity.
All right, and the regarding the retention and recruitment bonuses and whatnot, the funds you got from the hospital, how many JFL employees actually received these bonuses thus far?
Of the retention and recruitment bonuses, 227.
227?
Correct.
All right, and you have what do you call it? When you ombudsman representative option?
I'm sorry, can you repeat that?
Do you have
question?
an ombudsman?
Ombudsman, yes.
Is that how you pronounce it?
Yeah, ombudsman. Similar to quality assurance, a person that's responsible for.
Sorry, I couldn't hear you.
A person that's responsible for quality assurance, ombudsman.
Oh yes, we have a full quality assurance program. Absolutely.
All right. So we definitely need to have a conversation because again, even to now, there's no services being rendered. I'm playing doctor, nurse, and everything all hours of the night, but we need to do better as we do these discharges. So I'm looking forward to seeing your protocols on those two areas that I asked you about, the post-op and the discharge protocols.
Yep.
Thank you.
Thank you, Senator.
Well, thank you. Again, we'll go to that 30-second wrap up. I don't see any other senators that have a burning question. You don't have to force it if you don't need it. Senator Johnson, you recognize for your wrap up.
Thank you very much. Thank you very much, Mr. Chair. What I would like to ask CFO, do you guys have a good relationship with the university as far as trying to recruit our local nurse, hiring them, making sure they get bonuses so they don't end up becoming traveling nurse and just disappear when they finish with that course? What kind of relationship you have with them, and how is it going so far?
Yeah, we think we've strengthened our relationship with UVI, which has a great nursing program. So we continue to strengthen that. And as I mentioned earlier, we hired 9 of the graduate nurses coming out of St. Croix this year. We put them into an NCLEX review program. Happy to say 3 of them have already passed their NCLEX and are now working at JFL as registered nurses. So very happy with that relationship.
Thank you very much. Thank you very much, Mr. Chair.
Thank you. So we'll start with you, Mr. Executive Director Smalls, and then we'll come down.
All right. Again, good afternoon, Senators. I just want to take this opportunity and to personally thank Chairman Finch, CEO Cook, for their kind words and encouragement and commitment to supporting what the THRT is trying to do, not just here for JFL, but the entire territory. More importantly to this body, for your understanding, your patience. I will be the first to tell you, if I was sitting in your seat, I would be expressing the same concerns. I will tell you that we remain committed as an organization, as a board, as a facility, that we're going to provide the state-of-the-art facilities in a safe environment. We're not going to preempt or bypass anything that will come back and be a problem for us. So with that, I will just say thank you. And of course, to my THRT team, you're the greatest. Thank you for everything that you do and continue to do on a daily basis.
Thank you very much, Mr. Smalls. And again, I appreciate you always being available to take my phone call and try to provide updates as necessary so that I could pass that information on to the public as well. CEO?
Thank you, Senator. I did want to just mention that we are approaching October 1st. And as a reminder, October is Breast Cancer Awareness Month. So encourage all women in our communities to have their mammograms, do their self-breast exams, and we can continue to fight breast cancer throughout this territory. In closing remarks, I would just like to say that, there are so many things that happen in the hospital, and we seem to focus on some of the negative ones and areas that we can improve, which is definitely necessary and we need to do. Unfortunately, we don't spend enough time talking about the great things that happen. I'm reminded of just yesterday that the time we spent watching multiple different agencies come together for the care for a person. And due to HIPAA, we're not able to really talk much about those. But what we can talk about is extraordinary feelings and appreciation that the family gave to that nursing team and other support staff to help them through that difficult situation. I often hear that St. Croix doesn't have a hospital. I can assure you we do have a hospital. It's not the hospital we want, and it's not the hospital that we deserve and that this community deserves. But we do have a hospital, and we have bright days ahead, and we will open JF North in the coming months. And as you saw in the video, it's going to be impressive, and this community deserves it after the years that they've been waiting. And in my final remarks, thank you to this committee for holding us accountable, for having this dialogue, and to thank you to every member of the JFL family, the employees, the physicians, the doctors. They do extraordinary work in difficult situations and with failing infrastructure, and I thank them for their tireless efforts. Thank you.
Thank you very much, Mr. CEO. And men do have breast cancer as well, albeit very rare. All right?
Yes, absolutely. So, definitely.
Mr. Chairman?
Thank you, Senator. Let me start thanking the hospital redevelopment team. They work extraordinarily hard, and JFL North itself is really a full-time job for Mr. Smalls, but at the same time, he and his team are working on the design and all the planning for the new Juan F. Louis Hospital, the rebuilding of Roy Schneider Hospital, the soon to start rebuilding of the Charlotte Kimmelman Cancer Center and the Myra Keating Smith Community Clinic, and I'm aware of all this because of all the reports. So it's a small group of people that are really taking on a huge amount of projects and just working, absolutely diligently at it. And so we really been well served by the work that they're doing, and I think the community will continue to be well served. I want to thank also the employees really of all the hospital units. We're here specifically today to talk about Juan Louis, and so we recognize the work of everybody that's at Juan Louis and understand that they had a facility that had a number of problems prior to the storms of 2017, and they have only just been exasperated since then. And they too have heard numerous states of when they were going to get out of it, and which had not come to pass. So we certainly thank, for all of their dedication and their hard work and the services that they're providing. And I really hope I'm not stealing anyone's thunder, but Roy Schneider had its 3-year surprise inspection by the Joint Commission on the Accreditation of Hospitals this week, and by all reports, they got an excellent report card coming out of that, and so we thank the leadership and all the staff of Schneider for all of that work. And I am certainly very much aware that through this budget process, the governor has supported additional monies for the hospital, and they've been passed and supported by this group. So we thank both of you. Whether or not is the ARPA monies, the premium pay monies, but also the additional budget fund monies that are being given to the hospitals to help us with the recruitment and retention of nurses. And as well as a supplemental budget to help settle some of the old debt, which takes some very, vexing problems off of Juan Louis' lap, things that should have been settled a long time ago. So we're greatly appreciative, because I know that every dollar has a constituency, every dollar has an advocacy, and so for every dollar you give us, you're having to say no to somebody else. So we're very appreciative of the money that we are receiving. So thank you.
Thank you very much. And again, I really want to take this opportunity to commend all of the healthcare systems of the Virgin Islands, but more importantly, the work that's being done at the Juan Francisco Louis Hospital. I know that there's a lot of challenges there. In my role and responsibility and oversight of the hospitals and healthcare facility, I'm often flushed out to come on public and really just to add to the morass, just to add to the criticism that occurs at the hospital and the facilities. I'm not going to be a part of that. My goal is always to work with the stakeholders to make sure that we're improving healthcare in this territory. I believe that the public deserve to understand that, in fact, yes, we do have challenges, but we have some very good individuals that work at the hospital. And while we have a tendency to do the broad brush approach, all we're doing is demoralizing those individuals. We have people that leave their homes during different emergencies, leave their families, the children at late nights, early mornings, or whatever, go in that facilities, work long hours, 10, 12 hours a day, sometimes don't get proper relief, and they're there. And they're there because, again, they care about this community and want to provide a quality of life for the individuals that respond to our hospitals. So, those are the ones that we want to embrace. Certainly I can't be a part of the criticism. I have a responsibility to understand the challenges and to work towards providing the resources to overcome those challenges, as well as to be able to beat the drum to make sure that things happen. But, in terms of the criticism, I'm not going to be a part of that. So Again, I really want to commend all of those individuals that continue to do the work there during the hurricanes, during the pandemic, and we certainly appreciate you and thank you for your service. The Committee of Health, Hospital, and Human Services will take a 10-minute recess, and then when we come back, we go to block number 2. The Committee of Health, Hospital, and Human Services is out of recess. At this time, Madam Clerk, please call up the items in block number 2.
Block number 2, update on the Herbert Gregg Home for the Aged, as well as the state of senior care in the territory. Invited testifiers, the Honorable Kimberly Kazi Gomez, Commissioner, VI Department of Human Services. Ms. Ernie Pennyfeather, Administrator, Senior Citizens Affairs, VI Department of Human Services. Mr. Alvin Milligan, Assistant Administrator, Senior Citizens Affairs, VI Department of Human Services. Ms. Ana Velez Martinez, Director, Herbert Gregg Home for the Aged, VI Department of Human Services. The Honorable Justa E. Encarnacion, Commissioner, VI Department of Health.
Thank you very much, Madam Clerk. At this time, we'll just go to the testifiers to introduce themselves, and then we'll begin with the testimony thereafter. Commissioner Kazi Gomez.
Kimberly Kazi Gomez, Commissioner, Virgin Islands Department of Human Services.
McCall Reimer Brown, Assistant Commissioner, Virgin Islands Department of Human Services.
Ernie Pennyfeather, Administrator for the Division of Senior Citizens Affairs, Department of Human Services.
Alvin Milligan, Assistant Administrator, Department of Human Services, Senior Citizens Affairs.
Thank you very much. And we'll go over to St. Thomas District, Commissioner Encarnacion. Good afternoon. How are you doing?
Good afternoon to you and everyone. This is Justa Encarnacion, Commissioner of the Virgin Islands Department of Health.
Good afternoon, Dr. Nicole Cragwell Sims, Assistant Commissioner, Department of Health.
Very well. And if we could go online real quickly. See Dr. Caesar Hunt.
Hi, good morning. Ty Hunt Caesar, Medical Director, Department of Health.
Mr. Malloy.
Good afternoon, sorry.
Good afternoon. Ruben Malloy, Assistant Commissioner, the Virgin Islands Department of Health.
Okay. And Mr. Harris.
Good afternoon, Watson Harris, Director of Environmental Health and Safety.
Akila. Who else do we have online? Ms. Greenwich.
Good afternoon, Jacqueline Greenwich Payne, Director of EMS State Office, Regulatory Department of Health.
Good afternoon. Mr. Chikochi.
Yes, sir. Good afternoon. Miguel Tricoci, Deputy Commissioner of Operations, Department of Human Services.
Mr. Malloy.
Ian.
Good afternoon. I think I went already.
You went already?
Ruben Malloy, Assistant Commissioner,
Okay.
Department of Health.
Ms. Fredericks.
Good afternoon, Linnea Fredericks, Director of Chronic Disease, Department of Health.
Attorney Taylor Jones. Attorney Taylor Jones. All right, very well. Is that everyone?
I have 3 additional. Supposed to be online. Lydia McGrath, Chief Financial Officer. Akila O'Brien, Disaster Recovery Specialist.
Okay.
And Anna Martinez, Velez Martinez, Director of Herbert Gregg. They were in the waiting area, so I'm not sure if they were able to get in yet.
Ms. Martinez. Ms. O'Brien.
Good afternoon, Akila O'Brien, Disaster Recovery Specialist, DHS.
Okay. Ms. Martinez. And who was the other person you said?
Lydia McGrath, Chief Financial Officer.
Ms. McGrath, CFO. All right, Commissioner Kazi Gomez, you can go ahead with your testimony, and then we'll have them join once they come up online.
Good day, Honorable Senator Novell E. Francis Jr., Chairman of the Committee on Health, Hospitals, and Human Services, committee members, and other senators present, colleagues, and listening and viewing audience. I'm Kimberly Causey Gomez, Commissioner of the Virgin Islands Department of Human Services. Joining me today in the well are Assistant Commissioner Mikkel Reimer-Brown, Administrator Ernie Pennyfeather, and Assistant Administrator Alvin Milligan of the Division of Senior Citizen Affairs. Also appearing virtually are Chief Financial Officer Lydia McGrath, Deputy Commissioner of Operations Miguel Tricoci, Director of Herbert Grigg Home for the Aged Annie Velez Martinez, and Disaster Recovery Specialist Akila O'Brien. It's our pleasure to accept your invitation to provide the committee with an update on the status of the Herbert Grigg Home for the Aged, as well as an overall state of senior care in the territory. Before we begin, I would like to extend our gratitude to you, Chairman Francis, as well as Senator Samuel Carrion and Senator Franklin Johnson, for taking the time to schedule a visit to walk through the Herbert Grigg Home facility this past week. I appreciate the fact that you were patient with our COVID protocols and provided potential solutions during your visit. The staff were pleased to meet with you personally and to be able to share firsthand with what they need to be successful in their role in caring for the most vulnerable. Overview. Every day, our DHS staff members come face to face with the array of needs of our senior citizens. We're called upon by family members, neighbors, hospitals, clinics, and members of this legislature to help bridge many of these gaps. Although I have with me today our senior managers from the Division of Senior Citizen Affairs, it should also be noted that DHS provides services to our seniors via other divisions within our department, to include but that are not limited to the Division of Family Assistance with our Supplemental Assistance to Needy Families, or SNAP, Energy Crisis Assistance Program, ECAP, and other financial assistance programs, and our Office of Medicaid, which provides access to quality health care services, the Office of Intake and Emergency Services, the Division of Disabilities and Rehabilitation Services, and the Office of Residential Services. The Division of Senior Citizen Affairs is the major provider of direct services to thousands of seniors citizens on an annual basis, and has the overarching vision to provide the elderly with more choice, independence, and autonomy, and to help the elderly to continue to live at home as long as possible. The Division of Senior Citizen Affairs operates 11 senior programs, plus the Office of Administration. The SCA division staff members provide critical in-person services to our seniors aged 60 and older and adults with disabilities, ages 18 to 59. We raise community awareness to prevent and, when necessary, report abuse, neglect, and financial exploitation of our vulnerable adults and elderly citizens, and maintain 2 homes for the aged. The dedicated and talented staff of the Division of Senior Citizen Affairs, or SCA, enable seniors and adults with disabilities to safely live in their homes through delivery of community-based services, providing support to caregivers, keeping our older adults engaged, encouraging independence, and promoting wellness, safety, and security for these vulnerable populations. Our homes for the aged. One of the key gap areas in senior services is the availability of nursing beds, like it was stated earlier today at the hospital hearing, and the skilled nursing facilities to care for our elderly, frail, and disabled seniors. This was emphasized early, in Block 1, of course, and then the 2 homes for the aged, Herbert Grigg on St. Croix and Queen Louise on St. Thomas, they provide 24-hour quality custodial and health care to seniors 60 years old and older in a safe environment under the auspices of DHS. Herbert Grigg Home has a census of 22 residents and are pending 3 additional residents to be admitted in the coming weeks. 2 pending admissions to the Herbert Grigg Home currently reside at Schneider Regional Medical Center on St. Thomas, and while the other one at Juan F. Louis Hospital on St. Croix. Because of their unsafe discharge status, these 2 residents were retained in the hospitals as patients, but do not necessarily meet the criteria for acute hospital-level care. They're part of a group of individuals who are commonly referred to as boarders in both of our territory's hospitals. While DHS knows the importance of assisting in reducing and removing all borders from the hospitals, we cannot ignore the dire and dangerous environments and personal situations that our frail elderly who live in our community also face. Due to the lack of long-term care available in the Virgin Islands, DHS has a waiting list of almost 70, which includes the borders. The Queen Louise Home for the Aged is not able to admit any new residents to the facility now as we're under COVID restrictions, and once the all clear is made, we'll consider 1 to 2 additional admissions. The Home for the Aged in the COVID pandemic. Amidst the ongoing challenges of the COVID-19 pandemic, the elderly residents of both homes for the aged have fared well since the initial onset of the pandemic since 2020. Our dedicated staff continue to provide quality care to our senior residents. Unfortunately, just last week, 3 of our Queen Louise Home residents were diagnosed with the COVID virus. Our residents have been vaccinated and boosted, and so that they have had mild symptoms which were managed in-house by our physician and nursing staff in collaboration with the Department of Health. The residents with COVID-positive diagnosis are receiving the recommended therapies to minimize the negative impacts to their bodies. As required by the Department of Health, our physician and DOH staff continue with ongoing testing of all staff and residents at the Queen Louise Home every 3 to 4 days. After a 14-day period of no new COVID-positive cases for residents or staff, the facility will receive the all clear, and then that will be from Department of Health. From March 2020 through August 22, there were 0 new COVID-19 cases in our elderly population at Herbert Grigg. However, at the end of August, 8 of our residents were positively diagnosed. All 8 were immediately treated with the therapies prescribed by our physician along with the guidance of Department of Health, and I'm pleased to report now that all 8 had only mild symptoms and they were maintained quarantined from the other negative residents, and they've been now since cleared and released from that. Although the common reference in the residential long-term care industry is to speak of the availability of nursing home beds for their frail elderly, I also want to emphasize that physical beds and rooms are only one slice of the proverbial pie. The physical damage to the facility caused by Hurricanes Irma and Maria resulted in a reduction of active nursing beds from 40 to the current 25 at Herbert Grigg, and from 29 to currently at 15 at Queen Louise. So for a nursing home to operate efficiently and effectively, there must be appropriate staffing levels in various sectors. So it's not just nursing. And usually it considered the dietary or your kitchen managers, cooks, food service workers, your nursing medical, which is the RNs, our registered nurses, licensed practical nurses, certified nursing assistants, and of course our physicians. Institutional support, housekeeping, institutional attendance, custodial. Social services, whether it be a social worker or a social services aide. And administrator, your director, assistant director, office manager, and other nursing support. Consequently, when contemplating funding for a nursing home, one must also consider the availability of nursing home beds in physical spaces, but also must understand that elderly, frail seniors also need 24-hour custodial care, and the care is literally from the skilled hands of our staff members that we listed earlier. In addition to staffing, the Herbert Grigg Home and Queen Louise Home also have oversight over medication, medical equipment and supplies, food equipment and kitchen supplies, our laundry, cleaning, groundskeeping and equipment and services, our medical waste and other solid waste disposal, transportation, and of course maintenance. I've taken the time to go into greater detail than I've done in the past to help this honorable body have a clear understanding of a nursing home operation. Both homes for the aged have established rates of $166 per day, which is a total of about $5,000 per month. However, it should be noted that on rare occasions that our residents or their family members pay for the 24-hour custodial care the home provides. Now, the national average for a double nursing home room is $267 per day and $290 for a private room. This equates to about $7,800 or almost $9,000 per month. And as you are aware, the cost of living in the Virgin Islands is very high, and if we were to implement these cost increases, it most likely would be additional costs. Because Herbert Grigg is not a nursing home certified by the Centers for Medicare and Medicaid Services, or otherwise known as CMS, which would make it eligible for Medicaid funding, the entire operation, including staffing, is 100% funded by the government of the Virgin Islands. Consequently, the Brian Roach administration, a part of the Healthy Housing Initiative, has prioritized the construction of two state-of-the-art, we're really excited about this part, two state-of-the-art 60-bed skilled nursing facilities and nursing homes to replace the existing Herbert Grigg and Queen Louise Home for the Aged. Once these new facilities are in place, DHS will be able to seek CMS certification for both homes and be reimbursed by the Medicaid program for eligible Medicaid residents. Herbert Grigg Home has admitted boarders from both hospitals during the pandemic. In weekly coordination with the Department of Health, our hospitals, and our DHS staff, we are executing an action plan to relocate the current 17 boarders. Our seniors, 16 and over, and the adults with disabilities for 18 to 59, who now reside in the territory's hospitals. Once the boarders are relocated from the hospital, it's safe to say that DHS will assume responsibility for their care, not for today and tomorrow, but for the rest of their lives. Queen Louise Home for the Aged in Lucinda Millen. The Queen Louise Home for the Aged served 13 elderly frail adults during 2022. Our census has been reduced because of the current Queen Louise Home facility being compromised from the 2 Category 5s. The census currently is 12 at Queen Louise, and we also serve 6 frail residents at Lucinda Millen who receive our nursing home support, or nursing services, excuse me. This is the exciting part. The Federal Emergency Management Agency, or FEMA, has approved the full prudent replacement of Queen Louise Home for the Aged. FEMA has also awarded DHS the federal share, this is not including our 10%, is $65,782,944.53. The prudent replacement funding will enable DHS to repair the current Queen Louise Home and relocate it, building a brand new one in hospital grounds near the hospital. This will have a 60-bed skilled nursing facility. DHS has worked closely with property and procurement to identify the suitable property to relocate. We're in the final stages of negotiation to purchase the land on which that 60-bed facility will be constructed. Because of our foundational belief that our elderly seniors deserve a nursing home that will enable them to live with their golden years with dignity and quality care, the Department of Human Services worked tirelessly over the last 3 years to obtain that full FEMA's decision for that replacement. I'm very proud of our staff for that. I also note that staff of the DHS Nursing Support Services provide the nursing care for elderlies and semi-independent who reside at Lucinda Millen for the Aged on St. Thomas. An average of 6 to 8 residents receive services. These residents would qualify for residency at Queen Louise Home, but because of their residency at Lucinda Millen, the DHS staff, nursing support, provides that at home. A similar nursing support staff was once placed at Wilford Pedro Homes, or WIM Gardens, on St. Croix. The program was disbanded because of the lack of required funding at least about 4 or 5 years ago. We're working with the Housing Authority to assess and determine additional services, and we'll be working together with them. So rebalancing the delivery of services. The 2010 and 2020 census reports have shown about approximately 18% of the U.S. Virgin Islands are now over 65, and anticipated that this percentage will continue to increase over the years to come. Nationally, the current trend is to increase the amount of home and community-based services for seniors who require a continuum care approach to service delivery. This is moving away from the heavy reliance on institutional care like we do in the Virgin Islands, but numerous studies have taught that senior citizens prefer to remain in their own homes as opposed to being placed in institutional residential services. Hence, DHS, Office of Medicaid, added personal care attendant services in 2021 to the VI state plan of Medicaid. And this covers and has launched the Medicare Provider Personal Care Attendant Services. This allows entrepreneurial opportunities for persons and/or businesses in the community. Currently, we have 6 Medicaid providers who perform personal care attendant services in St. Thomas and St. John, and 2 on St. Croix. This is enhanced with our homemaker services. To meet the diverse needs of the growing number of older persons in the United States, President Lyndon Johnson signed the Older Americans Act into law on July 14, 1965. The Older Americans Act set out specific objectives for maintaining the dignity and welfare of older individuals and created the primary vehicle for organizing, coordinating, and providing community-based services and opportunities for older Americans and their families. The VI Department of Human Services is recognized as the state agency or the state unit on aging for the U.S. Virgin Islands by the U.S. Department of Health and Human Services Administration for Community Living. The Administration for Community Living, or ACL, formerly the Administration on Aging, is the principal federal agency of the United States Department of Health and Human Services designated to carry out the provisions of the Older Americans Act of 1965. The Older Americans Act promotes the well-being of older individuals, providing services and programs designed to help them live independently in their homes. Consequently, DHS receives federal funding to assist the providing of home-delivered and congregate meals, our community nutrition program for senior citizens, homemaker services, and the family caregiver support program, our senior socio-rec centers, also known as our senior centers, and limited funding toward the operation of the homes for the aged. It also should be noted that the senior programs under the Department of Human Services are dependent on funding from the local government to operate and meet all of our mandates, as well as meet all of the services for our frail elderly. The Homemakers program. The Homemaker program, services program, continues to be one of our preventative services that reduces the need for institutionalization while fostering independence for our seniors as well as our disabled population. Our homemakers, also known as personal care assistants, provide routine housekeeping chores, personal care, and light meal preparation for persons 60s and older who are confined to their homes, and some assistance with activities of daily living, to include bathing, grooming, dressing, and ambulation. It should be noted that some of our homemakers who are certified as home health care aides or certified nursing assistants, however, homemaker staff are not licensed nurses and therefore not able to administer medication. Homemakers or BCA program is one of the preventative programs that reduces the need for institutionalization while fostering independence of our seniors as well as our disabled. Research by the American Association of Retired Persons, our great partners at AARP, revealed 90% of seniors wish to continue to live independently but really staying at home and in their own community. This valuable homemaker and PCA services is one of the most valuable prevention programs in the territory. It saves lives and prevents untold human misery and stresses on the families and the caregivers, but also saving the territory significant amounts of money in medical costs. Reassessment of our current homemaker services clients continues to reveal the declining health of many of our seniors and adults with disabilities, and especially those with Alzheimer's and dementia. The need for support with additional days of service is evident. Our seniors are living longer, there are increased risks of chronic diseases, and accompanying rising health costs as well. And with this reality comes the need for us to be here, wrapping around the services to support that growing need. The National Center of Health Statistics report that 85% of Americans aged 65 and older are coping with at least one chronic condition, and 56% are coping with two or more. I would be remiss if I did not indicate that there is a much greater demand for the services of this program than the program can provide at the current level of funding. Consequently, DHS welcomes the support of the growing Medicaid-funded providers who offer that personal care attendant services to Medicaid-eligible members. Additionally, Governor Al Bryan's Senior Citizens Health and Wellness Initiative, Live Your Best Life Now, Aging Your Way, has awarded DHS a total of $1.2 million for services for seniors. And $824,000 is designated specifically for personal care attendants. The Adult Protective Services unit exists to investigate allegations of abuse and neglect of elderly persons and/or disabled adults. The APS team is organized and guided by a mission to protect these vulnerable adults from abuse, neglect, and financial exploitation. The APS unit also partners with other local and federal entities to coordinate services for these individuals as well. And this is not included or not limited to law enforcement, VI Housing Authority, Department of Health, VI Superior Court, and the U.S. Department of Health and Human Services, the Administration for Community Living, other community groups, and family members. Any disabled adult 18 to 59 or a senior over 60 who experiences abuse, neglect, or exploitation is eligible to receive our adult protective services. Our senior centers. Our gentlemen were able to come today this week, which was great. I played bingo. I just had to put that in there. I didn't win. I didn't win bingo. But our senior centers reopened throughout the territory in 2022. Strive Center, Senior Center on St. Thomas on March 22nd, St. John Adrian Center on March 29th, and the Richmond Senior Center finally partnered with the Housing, Parks, and Recreation, and we used their lagoon space until recently. Richmond Senior Center went in much needed repairs, brightened up the place, and we did a really wonderful welcome on September 8th. Great celebration that was. Our seniors really are enjoying themselves. We also acquired at Richmond Senior Center a clinical laboratory improvement amendment certification, which is now implemented for the preventative health testing to include glucose, cholesterol, and COVID tests. So we'll be able to administer that as well as monitor their blood pressure. The St. Thomas St. John is also moving into that CLIA certification to carry out that preventative health. It should also be noted that the Adrian Center on St. John is the smallest of our senior centers. And we work with Housing Authority at the George Simmons Terrace Community Center. And we pay $1 annually for that space, and we're very thankful. So approximately, we do 25 clients at our Adrian Center, 64 at Richmond, and 46 at St. Thomas and Strive. We also have a family caregiver support program, and growing up, I personally was able to see the emotional and physical effects of caregiving every day on my family, as my maternal grandmother lived with us. We converted our dining room into her bedroom, and she lived with us on the first floor. She was paralyzed from a stroke when she was 45 years old, and it left her paralyzed on her left side, and she needed oxygen as well. So during that, I was able to play card games. I'm really good at that now, and I'm also really good at puzzles. But I could see what it took on my parents as trying to work and care for somebody that lived in their house. And because of that, it was very, very difficult. I also have several family members with Alzheimer's, and what it's like to care for them at their homes as well as in a nursing home environment. So the daily caregiving is going to be stressful, and it's sometimes unrecognized role of a memory of our family members, especially with somebody with that chronic illness or disability or dementia. We have several people in our offices that are currently in that role right now. And we're truly, truly blessed that our staff really love what they do. The Family Caregiver Support Program is primarily funded by the DHS Social Services Block Grant. We do in-home respite, institutional respite. Some people are raising their grandchildren as well. This program continues to provide much-needed support and respite for the family caregivers. We finally were able to resume our annual retreat for our caregivers, and we wrapped some love around them at Carambola in August. Congratulations for that. It was a long time coming, and we hadn't had our last retreat since 16-17, so we were really excited about doing that. It was held in August. 23 family caregivers from St. Thomas and 23 from St. Croix had a great weekend celebrating our caregivers' inner strength, because it really does take a strength to care for family members. Currently, the Caregiver Support Program has 132 clients in the territory, and the small family caregiver staff is assisted by community-based professional counselors and therapists who also do an amazing job at our support groups. This is a great program, too. It's a foster grandparent program, a retired senior volunteer program. And they provide services. We paused them during the COVID-19 pandemic. And during that time, we were able to conduct training on technology for those senior volunteers. So they learned how to do WhatsApp and Skype and Zoom. And so they also know how to text, to name a few. So we were really excited for them to resume their programs. And so they've started to do that as well. Currently, our volunteer census is about 40, and RSVP is about 29 volunteers. Now, this is a big one, elderly community nutrition or Meals on Wheels. The food insecurity is really, really defined as a state of being without reliable access to enough affordable and nutritious food. As mentioned earlier in the testimony, our Division of Family Assistance provides SNAP and cash assistance to our seniors. However, many seniors who are usually on a fixed income, even those who receive SNAP, still encounter food insecurity in the Virgin Islands. Consequently, our Elderly Community Nutrition Program provides hot lunches to over 900 seniors throughout the territory. This is also known as Meals on Wheels, and that 951 seniors and family caregivers. This equates to 196,800 single-serving meals are provided on an annual basis. So it's a lot of food that we do. We serve almost 1,000 seniors annually, and we have waiting lists for those programs as well. We're also going to be increasing our plate costs for the Meals on Wheels vendors. We did an RFP recently for St. John, and we're going to do one for St. Thomas as well, and St. Croix, new RFP will go out in the spring. And because of this, we went from a $2.5 million program to about $3.5 million because of those cost increases in the amount of people that we serve. Information and referral, senior ID, and pharmaceutical assistance is another really great way that we see our seniors. On May 10th, we waived that fee, that $5 fee for senior IDs. We get a lot of questions about why do we renew the senior ID. We do that for two reasons, and this information and referral is the reason we do it. The initiative was announced during a weekly press conference, the Live Your Best Life, which was spearheaded by DHS in partnership with Sports Park and Rec and DOH. And it's meant to facilitate activities in the spaces of healthy and activity for our seniors and children and families. It still goes back to the age well with dignity and helping families to be active, as what Governor Bryan said. So in INR, our information and referral, served over about 6,000 clients in 2022 and renewed their reissuance of senior IDs. The program also provided prescription medication and supplies to 429 seniors. The pharmaceutical assistance program is a very strong one. So renewing your ID allows us to put eyes on those and make sure that their health is in good shape, as well as provide services and information and networking. CSEP is another work-based program. It's a training program designed for seniors 55 years or older. I always laugh because I'm going to be 55, so I'm going to be in that senior program next year. It's made possible through our Department of Labor. So y'all are ready for that. CSEP must also work with Department of Labor through the WIOA program, and we have that through an MOU. The Centennial Treasures Award during the 31st legislature, the Centennial Living Treasures Award was established to recognize and honor those that had a 100th birthday, and I think that there was somebody that had that today. We're looking forward to doing an additional 6 coming up in the month of October. We'll be delivering those as well, and that is per law. So we really appreciate this body continuing to fund that as an annual appropriation for us and allows us to really celebrate those that have made that mark to be 100. The Elder, Dependent Adult, and Disabled Persons Disaster Registry is also really, really an important part. That registry is designed to identify elder, dependent adult, and persons 60 and older who have a disability or live alone. And we work with BMV or Vitima to register. This registry is specifically to make sure that you're going to go okay during a disaster. It's not for services, it's just to make sure we know where you live. So we probably are serving about 798 or currently about on that registry. We collaborate with a lot of people, and we can't name them all in this testimony, but we have to recognize the essential need for community coordinated collaboration where it's public and private, so we can do all of us as a community work together to make sure we do that. So the U.S. Virgin Islands has traditionally treasured and honored our seniors. Seniors have invested their lives in building a better Virgin Islands. The Department of Human Services is also committed to do our part in providing prevention and intervention services to assist seniors in living their lives with dignity and respect. Although we're constantly reminded of the limitations of a challenging economic reality in this territory, we're not deterred in our missions. Our seniors deserve to live out their golden years with the support of our government, wider community, and their families. I'm stressing the family part. As we continue to do our part to assist our seniors at the Department of Human Services, we know to be successful, we need the help members of this legislature, our Honorable Albert Bryan Jr., and all the agencies of the central government, the judiciary, as we work to protect our seniors, private businesses, nonprofit agencies, to include churches and critically important family members. This is coordinated community response that requires all of us to come together to identify the gaps and challenges and to bravely embrace the opportunities to care for our seniors. This is the highest honor that we have. We're truly thankful for our partner agencies, our federal agencies, our community, who continue to make the Virgin Islands a really wonderful place to live. I would like to extend my gratitude to our dedicated DHS team of professionals, the continued support of Governor Albert Bryan and Lieutenant Governor Tregenza Roach, as DHS continues to be committed to working to make a difference. This concludes my presentation, Chairman Francis. My team and I are available if you have any questions.
Thank you very much, Commissioner Kazi-Gomez, for your comprehensive overview there. Next, we'll go to Commissioner Encarnacion. You're recognized for your testimony.
Thank you, sir. Good day, Honorable Senator Novalee Francis, Chair of the Committee on Health, Hospital, and Human Services, Honorable Senator Marvin A. Biden, Vice Chair, committee members, non-committee members, and the viewing and listening audience. I am Justa or Tita Encarnacion, the Commissioner of the Virgin Islands Department of Health, and I have with me today Dr. Nicole Cragwell-Sims, Assistant Commissioner, Renan Steele, Deputy Commissioner of Public Health Services, Hadia Charles, Deputy Commissioner of Health Quality, Dr. Janice Valman, Deputy Commissioner of Health Promotion and Disease Prevention, and McKeish Taylor-Jones, our department's Chief Legal Counsel. Assistant Commissioner Ruben Malloy is also on the call. The directors that lead the teams that stand at the front line to serve the elderly in our community include Linnea Fredericks, Director of Chronic Disease and Prevention, Jacqueline Greenwich Payne, Director of EMS Emergency Medical Services Regulatory, Lorraine Matthew Benjamin, Director of Vital Statistics, and Jacqueline Canton, Acting Head Nurse, and Kathleen Grant, Head Nurse of Community Health Center, St. Croix and St. Thomas, respectively, and Alex Barron, Head Nurse of Elder Shelterban Facility. We are here today to provide the testimony on the department's role as it relates to the state of senior care in the territory. Our community health clinics are a significant source of care for seniors, as most of the clients seen in both the clinics on St. Thomas and St. Croix are elderly, especially those diagnosed with the chronic illnesses. Diabetes, hypertension, and cardiovascular diseases are three of the major causes of illness affecting this population. Clients on St. Croix are cared for in the clinic by a cardiologist scheduled twice a month. Additionally, clients diagnosed with diabetes are seen weekly by our endocrinologist on staff, and our primary care physician provides general medical services daily. On St. Thomas, services are provided daily by our public health physician on staff. Direct care and supportive services are provided primarily through the expert skills of the public health nurses under the leadership from key administrative staff. These services include adult immunizations like the annual flu vaccines, timely filling of prescriptions, and ongoing primary care. During 2019, the VI Department of Health served 18,832 clients. Of those, approximately 2,000 or 11% were Medicare eligible. In addition to providing services daily in the clinics, community health clinic staff respond to or initiate outreach activities to the community. During Senior Month, observed annually in May, various programs collaborate to conduct targeted outreach to senior centers. In 2022, this occurred at the Fambayón Gardens on St. Croix, the Celestino White Center on St. Thomas, and the Senior Center on St. John. Over 100 senior citizens received health screening, were offered the COVID-19 vaccine, received educational information on healthy lifestyles, and enjoyed healthy cooking demonstration by renowned local chefs. This is an annual outreach activity that teams look forward to planning and implementing. Further, the clinics participate in the annual agriculture and food fair in St. Croix, reaching over 100 persons in 2022 with hair health screening, vaccines, health educational materials, and more. Clients are referred to the clinics if further evaluations or studies are indicated based on their screening results. The Division of Chronic Disease and Prevention has 2 programs for seniors, the Chronic Disease Self-Management Program and the National Diabetes Prevention Program. The Chronic Disease Self-Management Program is an evidence-based 6-week educational group workshop aimed to improve participants' self-efficacy, knowledge, and ability to self-manage chronic diseases. Persons in this program range from 18 to 80 years of age with varying income and educational levels. Participants not only benefit from the content and materials shared during the workshops, but they also engage in peer-to-peer support, which has proven to be invaluable in disease management. Since the program's inception in 2018, the division has maintained its status with the Self-Management Resource Center as a licensed organization with 5 certified expert trainers. To date, the division has facilitated over 8 workshops with more than 150 participants. Approximately 80% or 120 of our class participants were senior citizens with a medical history of diabetes, cancer, cardiac disease, hypertension, arthritis, autoimmune diseases, and other chronic illnesses. The National Diabetes Prevention Program is a year-long self-management program that focuses on type 2 diabetes prevention. This program is facilitated in the community in a group setting and teaches participants tools and strategies to improve their lifestyles for optimal health. Topics include improving nutrition, improving physical activity, managing stress, reducing tobacco use, action planning, and setting goals. To date, the division has facilitated 2 cohorts with more than 42 participants. Approximately 40% or 17 of our class participants were senior citizens. In addition to this program, the Division of Chronic Disease and also collaborates with other divisions within the Department of Health to provide outreach for chronic disease management and prevention education to the seniors in the community. We have worked with local chefs to provide healthy cooking demonstrations and have hosted information tables on health fairs, utilize the media outlet platforms to disseminate education messages such as newspapers, radio stations, televisions, local and national, to ensure that we target the elderly population who are more likely to be affected by chronic diseases. Likewise, the Mobile Integrated Health Care Program under the Office of the Regulatory EMS Services serves mostly clients of the senior population. To date, the program has 69 patients and 99% of them are seniors. It provides personalized and flexible care for patients in an in-home setting. It provides an option for patients with decreased mobility to receive care for chronic illnesses, wounds, and other ailments in a manner that does not necessarily increase their risk of fall. This program has helped mitigate the health disparities in our community and allowed us to serve populations who would not have otherwise received care for their acute conditions. The overarching goal of the program is to prevent patients from having the need to call 911 and return to the hospital unnecessarily. Our Division of Behavioral Health engages seniors and outreach programs at various senior centers. Our latest outreach program was done at Elder Shelterbrand. It involved a sip and paint event where seniors were able to partake in the activity. Overall, the Behavioral Health Division offers services for mental wellness for seniors. This includes support services where they would spend time with a counselor, mindful activities to engage the seniors at the center and their overall well-being. To date, the active official enrollment of seniors in our outpatient clinic is 44, 24 females, 20 males. The division ensures seniors are linked to external resources that provide transportation to sessions. Likewise, the case managers pay visits to seniors who are unable to attend their sessions. We ensure pamphlets are available to seniors discussing various topics like Alzheimer's. The Division of Behavioral Health upcoming goals are to increase routine services for the seniors, utilize the vans more, to increase outreach at least once a month and re-engage AARP for our open talk sessions with seniors. Other collaborative efforts through health care quality includes assisting seniors with vital records and statistics, having these documents dropped off or expedited to prevent seniors from having to come back the next day. A mobile strike team initiative was created to help seniors get their vaccinations. The team visited the long-term care facilities to administer COVID-19 vaccines to various seniors. With the Division of Environmental Health, inspections are conducted for sanitary and safety requirements within the long-term care facilities. On the regulatory side, our goals are to regulate the senior facilities more stringently by creating new rules and regulations to govern the nursing facilities and assisted living facilities. The Department of Health recognizes that the senior population is indeed a vulnerable one and will continue to play a role in senior care in the territory. The Disparities Program, which sparked insurgence of our Office of Health Equity, has embarked on a mission to address the needs of the elderly as it relates to COVID-19 effects. We have hired and begun training community health workers to identify the social determinants of health in this population that may or may not be related to COVID-19. Once identified, plans to address these issues will be filtered to divisions within the VI Department of Health and other departments, private, nonprofit, and other, like for example, federally qualified health centers. We have 2, Registered Healthcare and St. Thomas Eastern Clinic. The Virgin Islands Department of Health executive team, and I would like to thank our VIDOH family for their continued dedication to the Virgin Islands community and recognition to all our team members for working tirelessly to protect and support. I join Commissioner Kazi Gomez in thanking Honorable Governor Albert Bryan Jr. and Honorable Lieutenant Governor Tregenza Roach. In conclusion, Senator Francis, the Department of Health is committed to reducing health risks, increasing access to quality health care, and enforcing health standards. We stand ready to respond to any questions you may have. Thank you, sir.
Thank you very much, Commissioner Encarnacion. Madam Clerk, please recognize the presence of Senator Carla Joseph, and also read the correspondence that was sent in from Turning Point at this time.
Good day, Senator Francis, Chairman of the Committee on Health, Hospitals, and Human Services, committee members, and invited guests. I am Cindy L. Joseph, Administrator and owner of the Turning Point Senior Care, the first privately owned facility of its kind in St. Croix. Thank you for allowing my written testimony to be read into the record regarding my perspective on the status of senior care in the territory. I am pleased to share my perspective on the status of senior care in our territory. Yet, I am uncertain as to how my data points will substantively add to this highly researched and exhaustively studied and discussed topic. Whether you've cared for a parent or you know someone who has, I am confident that the experts here are clear-eyed about the issues facing our aging population. In brief, we know that our seniors are experiencing a diminished quality of life. We are aware of the emotional and economic implications for women as unpaid caregivers, and we have acknowledged in detail the inadequacies of our healthcare infrastructure to address these concerns. What is most needed to improve the lives of the older adults and their unpaid caregivers in the territory is action. My strongly held values to honor, care, and to maximize the quality of life for older adults in our territory has translated into an effective business strategy that established the Turning Point Senior Care Facility in 2016. Founded on principles of competent, compassionate support care, we created a portfolio of services intentionally tailored to address the needs of aging individuals in our community. The Turning Point Senior Care is a supportive care boutique specializing in Alzheimer's, dementia care, elder daycare, long-term and short-term residential care, caregiver training, and in-home personal care services. If you haven't noticed, older adults are gems in our community. Many have foregone retirement, volunteering their time, skills, knowledge, and abilities. They provide care for our babies and children, act as mentors, and enrich the lives of others in countless ways. Community efforts abound to reciprocate support to our older adults as they age. However, two issues appear to work counter to that end and have produced unintended economic consequences. As a community, we value and give care to loved ones, but these values are not fully supported or reflected in public policies to incentivize market valuation for the care provided. Consequently, unpaid care practices are costly to families and act to decelerate the earning capacity for women, creating another vulnerable subset in the elder care matrix. Let me explain. On the one hand, the care of a loved aging parent will typically fall to one family member. The unpaid care might on occasion include other family members and friends to ensure the older adult is fed, cleaned, transported to doctor's appointments, connected to the community, or perform a host of other care tasks. Notably, across the globe, care work, whether in the form of elder care, child care, care for the ill or the disabled, are traditionally performed by women. On the other hand, despite the importance of personal care to keep elders safe and to facilitate the best quality of living, care work is commonly considered inconsequential in public policy agendas. As a result, the importance of elder home care is diminished, allowing it to be uncoupled as a critical factor from the continuum of care in the healthcare system. In the absence of adequate personal home care, risk factors increase substantially for neglect, injury, hospitalization, or need for long-term nursing home medical services. How supportive care is viewed and valued by the government and healthcare institutions is key. Integrating supportive care resources into policy objectives will provide an effective, low-cost, and preemptive care approach that is currently missing in strategies to build a robust healthcare system. Quality, reliable care work makes all other work possible. Personal care is valuable both inside and outside the home. Access to appropriate care services is essential to allow families, specifically women, to fully participate in the workplace. In the absence of accessible and affordable elder care services or compensation for time off from the workplace, many families will be unable to care for loved ones and remain in the workplace. Prioritizing strategies of care and support for our older adults is a moral imperative and an economic and capacity building necessity. According to the census data, our population is aging rapidly, and without targeting low-cost preventative elder adult care, productivity loss among unpaid caregivers in the territory's economy will be acute. Specifically, this will mean diminished engagements by unpaid caregivers in potential spending on market-related activities or investing in educational and vocational skills. Our economy and capacity building will suffer. In summary, I encourage the committee to take a broader approach in its efforts to expand and reinforce the continuum of care for our territory's seniors. Investments in home-based care services and establishing private partnerships with care providers are key to establishing needed support in the healthcare system. Such investments will be consequential for our older adults, allow unpaid care workers to remain in the workforce, create jobs, increase economic contributions and activities, and reduce the widening income disparities among women. If you have questions regarding this or any other issue, please feel free to contact me directly. Kindest regards, Cindy L. Joseph, Administrator, The Turning Point Senior Care.
Thank you very much, Madam Clerk, for reading that testimony from Turning Point into the record. And we could all agree that our population is aging rapidly. As I went into the Richmond Center, I saw many of our seniors there that, just like yesterday, they were up and about, and when you look at the age from about 60, you're able to start to attend some of these facilities. We're right around the corner. Frankie trying to hide his age, but he's right around the corner too. But yeah, this is certainly profound, and definitely we need to make sure that we're preparing our community to accept the reality that in fact we have an aging community. At this time, you had a presentation, a video to show.
We do have a video,
Okay.
yes.
Media, can you run that video real quickly, and then we'll go to my colleagues for a round of questions.
I'm thanking you for the employees, because I'm saying that some people, like seniors, they never talk to anybody for the whole day. And when they do come, it's such an enlightenment, to have them say, "Mommy, how are you? Everything okay?" They have a smile on their face, and they're very warm and welcoming. So it's beautiful. Us seniors, we appreciate it, and I know I do.
When I wake up in the morning, and the sunlight hurts my eyes, and something without warning, bears heavy on my mind. Then I look at you, and the world's alright with me. Just one look at you, and I know it's gonna be a lovely day. A lovely day. When the day that lies ahead of me seems impossible to face, when someone else instead of me always seems to know the way, then I look at you, and the world's alright with me. Just one look at you, and I know it's gonna be a lovely day. When the day that lies ahead of me seems impossible to face, and when someone else instead of me always seems to know the way, then I look at you, and the world's alright with me.
Excellent, excellent, excellent. And kudos, I must also commend Mr. Milligan for the work. Certainly when we visited the Richmond Center, the bright and vibrant colors in that facility is all about being uplifted. And certainly the seniors look in good spirit. Certainly they have the choir singing their songs, people playing bingo. I mean, they really were enjoying themselves. Imagine that during that pandemic, they were just home, pining away. The reality that they could come out and be sociable and socialize with each other is remarkable. I commend all of Human Services and the work that you're doing to continue to motivate them, as well as at the Herbert Gregg home. Again, you could see real dedicated employees that wants the best for their facilities. And, we have had that discussion by how we could expand and be able to observe some of those individuals, the borders, that can continue to present some challenges for the hospitals. We had that discussion earlier this morning, and we're really working towards a comprehensive approach to address that situation. And we here at the legislature want to provide the funding to be able to make that a reality. So as soon as we could get that cost analysis in, and we could be able to resolve that issue. And thank you for allowing myself, Senator Johnson, and Senator Carrion to be there. Earlier this week, we really had a good time there. At this time, I'll open up the floor for a 5-minute round, and we'll start off with you, Senator Blyden. You're recognized for your 5 minutes.
Thank you, Mr. Chair. Good afternoon, Commissioner Casey Gomez, Commissioner Encarnacion, Assistant Commissioner, and all other testifiers and staff. And thank you so much for your testimony. I also want to say I want to thank also Ms. Joseph for her comments and her recommendations. I do agree with her. Let me ask Commissioner Casey Gomez, in respect to your testimony, I know that you serve on the board of the Housing Authority, and based on your testimony mentioned in terms of a survey that was done in the United States that most seniors would like to live at home. But of course, we know the service is not there for them. As far as the housing communities, there are many, many elders there. And as far as data here in the territory, let me ask you, have you reached out to the management of the authority to see exactly how many elders, number one, they have in those communities, and what activities in terms of a survey they're interested in, and what services is needed for them? Because I know back in the day when I managed the authority, we actually brought in Human Services and many other organizations to provide activities, screening, everything you can think of for the seniors in the centers where they didn't have to go too far or travel too far. And the attendance was always high. Have that been done in this instance at this time, Commissioner?
Thank you for the question. Kimberly Causey Gomez, Commissioner of Virgin Islands Department of Human Services. Yes, I love serving on the Housing Authority Board because of the amazing projects that are coming down the pike and the renovations, especially Walter M. Hodge is the newest one. An actual survey of the total number of seniors, I would have to get that from the Housing Authority. However, they are including us, Department of Human Services, in their plans and their build out regarding some of their programs, so we can be involved in providing the programs at that site. So like how big is the space that you need, the type of dining room, the kitchen areas, those kinds of things, bathrooms, ADA accessibility, all of that. So they're including us in the planning process to ensure that we're able to provide those things on site. So yes, it's a great partnership that we have. But I will get the number. I'll get with Housing Authority, Edie Graham, to get the total number for you. I believe it might be on their website, but I'll double check.
Well, I know the number, and I was just asking if there have been any plan in terms of utilizing the centers, etc.
Yeah.
But in addition to that, I know that you have, of course, the Lucinda Menon Home for the aged. You have Queen Louise Home. You have Cedar, and a couple other areas that we have our elders housed at. My question also in that respect is, I know that housing, they're doing improvements and rebuilding most of their facility. They have a 10-year plan to have all those units replaced within the next 10 years. Within that plan, do you know how many senior living facilities are included in those plans or slated for those plans? Because
Not off the top of my head, but I'll be happy to get that information through the chair.
In addition, let me ask, with your staff, you have many different programs. Let me ask in respect to the, not a foster parents program, the one that deals with abuse. I might forget which division is that? That deals with abuse and neglect of seniors?
So the abuse of seniors is under the Adult Protective Services unit.
Correct. How many, in terms of the numbers of abuse, etc., have those numbers been going down or increasing as we move on? Say between last year and this year?
1 minute.
Have you seen an increase? You guys have the total number of referrals currently?
Good afternoon, Mikal Reimer Brown, Assistant Commissioner. We have had some highs, some lows during this pandemic. I believe what we are seeing more so are seniors who have been suffering with neglect. There are some issues of financial exploitation. More than often, we see seniors who may be going through self-neglect or being left alone because the family members cannot stay away from work. So yes, we do see cases of elderly abuse, and at times we have upswings. However, more so what we're seeing right now is the need for seniors who are dealing with neglect situations in their homes, needing the services and the support to family caregivers.
Time.
So, Senator Bleding, if I may, through the chair. So, if you want to look at numbers, we did a pretty comprehensive data in our budget hearing. So, if you look at the total elderly cases of 60 and over, there was an increase. So, 2019 we had like 480, up from October just to June. I haven't updated the statistics, so it's at 426. So we're already way up as it going up there. Of course, in 2020, 21, you were kind of down. And then APS 18 to 59, that's those with disabilities potentially. We are also seeing an increase. So we're at 210 referrals, and that was just from October to June this year, sir.
Okay, well, thank you for responses, Mr. Chair. In closing, I must say the true measure of a community is based on the way they treat the elderly and the young, and I appreciate the work that Human Services and other departments are dealing with our seniors, but I believe we have some more work to do in terms of really making our seniors proud and treating them the way they should be treated in their last years. Thank you so much for your response, and thank you for the time, Mr. Chair. Appreciate it.
Thank you very much, Senator Blyden, and you're absolutely correct. I mean, truly we have some work to be done, and it has to be done collectively. I don't think no one agency could be responsible for that. Before I forget again, I want to recognize the presence of Senator Carla Joseph. She's been there for a while, so I just want to recognize her. Good afternoon, Senator. Look forward to your engagement in this very important topic. Commissioner, what's the status on the Commission of Aging?
I'm not sure, to be honest. AC Reimer Brown? Do you know?
Yes, Mikal Reimer Brown, Assistant Commissioner. The Aging Commission, although we collaborate, the commission meetings itself have not really materialized. And I believe it's been during this COVID pandemic. Everyone was really caught up trying to provide the services. I do believe in FY23, we will be seeing more collaboration. One of the things that AARP and DHS is going to be working on is some upgrades to our Elder and Dependent Adult Abuse Prevention Act. So that is something that we're going to be working on collaboratively. But I foresee in FY23, we're going to activate and get some more activities and moving forward on services and issues and policies for our seniors.
Okay, very well. And Commissioner, what's the synergy? What is the discussion being had between you and the Department of Health in respect to our seniors?
We're getting ready to do an outreach with Department of Health for the seniors. So we're going to team up through the Live Your Healthy Way. I totally Live Your Best Life.
Live Your Best Life now.
I totally merged this. My apologies. But Department of Health and Human Services definitely are going to be doing the mobile outreach to our seniors, and so we're really excited about that partnership.
Okay. Anything you would like to add, Commissioner Encarnacion? The synergy?
Well, not just that, but we're are also embarking on a women's conference, which includes all ages, and that is going to be sponsored by the Office of the Governor, as well as Departments of Health and Human Services. And we also, from a behavioral health standpoint, we always collaborate with that. We spoke about that a little bit in our testimony, and we'll continue to do that as well.
Yeah, in respect to the behavioral health, especially for our seniors, just this morning, I heard on one of the talk shows where this lady was very passionate about her experiences with a son, an adult son that experiencing some behavioral health issue, and she's basically under siege in her own house, and you could just hear the passion in her voice and the fear. I truly believe we need to try to do an outreach to her and see how best we could bring some relief to her. It's unfair, for individuals to have to live under these type of environment, and when you become fearful of your own child, and through no fault of theirs, because obviously they're having some behavioral health issue. I believe that we need to really, as a government and even the private sector, is to bring some relief to those type of individuals. So I'd love to be able to dialogue and see how best we can be able to address that situation.
Of course, John, and if I may add, just last week, we got a call from the administrator in St. Thomas, an email, and so we were able to intervene, and we work very closely with the VIPD until we have our strike team fully in place. We do activate, we do assist, and we'll continue to do so. So as soon as we hear those conversations, we try to work. So if you can please get that information to me, we'll activate.
Very well, thank you. Senator Johnson, you recognize your point of inquiry.
Thank you very much, Mr. Chair. Whilst we're on this topic, Commissioner Encarnacion, I remember a few months ago we had a visit there of that beautiful van. What's the status on that van? Is that van out on the road assisting the agency when it comes to that type of behavior problems?
I have Deputy Commissioner Steele on. Deputy DC Steele, can you answer that question, please?
Yeah, I'll allow
He's
him.
actually there.
He's in person, so we'll have him come into the well and respond to.
Thank you.
Good afternoon, Deputy Commissioner. Put your name on the record, and then you could respond.
Hi, good afternoon, Deputy Commissioner Renan Steele. Yes, currently the behavioral vans are being re-employed. We were able to get the full staff in now, started for the St. Croix district. We've added a clinical therapist and an outreach worker for the St. Croix van. St. Thomas, we were able to onboard the clinical therapist assigned to that van full time, and we're still trying to get the staffing for the St. John unit. But in the interim, the vans are getting ready to go back on the road as they're temporarily having to be used specifically for the St. Croix location as kind of our operational clinic during some environmental issues within the behavioral health unit in St. Croix.
And Senator, you'll be happy to know we hired a local, one of our own came back. She's working from St. Thomas, working right now in St. Croix. Dr. Chatelle Noel is our new Director of Behavioral Health Services.
Very well. Yeah, we're hoping to have a rollout with her. And have you done a PR or anything on her so far? Introduction to the public?
I speak about her every time I have the opportunity. She's going to be doing some PSAs for us in regards to what we're doing, and we're doing some blogs also, and she'll be speaking on those blogs. And so I'll do a PR on her. It's important. And let me say, she's just excited. It's wonderful to have her working along with DC Steele, two clinical individuals who really have the love and compassion for behavioral health.
And I know today we're talking about seniors, but remember my request to have those vans in the schools as well. With the level of violence that we're seeing here, that's no normal occurrence. And I truly believe that we need to get them there to support not just our students, but also parents. So we need to get them into our schools as well. Thank you. Thank you very much. Next, we'll go to Senator Carrion. You're recognized for your 5 minutes.
Thank you. Good afternoon, and good afternoon to the team for the Department of Human Services.
let me dig in right into questions for this afternoon. We know, we heard this morning in the first block, and it's no secret we have a shortage in long-term care. What, if anything, has the department done to maybe partner with some of these facilities nationside or even Puerto Rico to open facilities here on the territory in St. Croix or St. Thomas?
Actually, the last site visit I did in Devereaux, Texas, they've now closed their site, but I did have conversations about a larger agency coming in to provide the services locally. So it is a conversation we've had. I've also had it with Sunrise in Florida, which is Miami, which is where a lot of a bulk of our clients are, patients are right now. So we are in conversations about it. It might be that we need to do an RFP, a scope of work, to put it out to see if there is going to be a response. But I have personally done that. Senator Carrion.
And is there a level of interest in those conversations? Do you see a level of interest from?
There is, and I believe, and through Commissioner Encarnacion can talk a little bit about those that may be interested in a certificate of need as well, coming locally, and I'm not sure who those are.
Okay, thank you, if I may. We have one that is willing to work with us. We're setting up a meeting with Commissioner Kazi Gomez and her team and Department of Health and this individual. So we're working on that, as well as I think there are about 3 very small nursing home facilities that have been opened within the territory from a CON perspective. And so we're trying to link all of those together. I know the hospital spoke about the weekly meeting that we're having to secure more available access to care outside of the chronic or the acute care facilities of the hospital, to have these individuals cared for more so independently or in a nursing care facility.
Okay, well, I'm glad to hear that, and I just want to encourage the department to continue pursuing that area, because we definitely need more facilities locally. As we were hearing today in testimony presented by Chairman Finch, the need for these facilities in their territory is crucial. So that's very important. So thank you for that. Now, has the department explore the possibility of maybe having adult care offered through Herbert Gregg or any other?
That may be part of our
space?
services when we expand to skilled nursing. So the 60-bed facility could potentially also do
Offer
something to
that.
that effect.
Very well. Meals on Wheels, and I know your Homemaker program or other programs also service our senior population. How are those areas working? Are they properly staffed? What's the status for those 2 areas? I mean, it's very short.
It's hybrid. There's a waiting list for both because of the increased needs for both. We're trying to get extra funding for Meals on Wheels to accommodate. We did expand that, so those that were not necessarily eligible for Meals on Wheels during COVID, we did expand that.
And for Herbert Gregg and also your Queen Louise Home of the Age, premium pay, I know my colleague is not here, but on his behalf and for your staff, what's the status of premium pay for your staff employees?
It's been submitted, and the status is, I believe it's at finance, so we're hoping to see some kind of action or traction by next week. I can't make a promise because I don't write the check portion, but Department of Human Services submitted everything for premium pay.
I'm glad to hear that, because I know they've been working through the whole pandemic. And also your nurses, retention bonuses. Any conversations with the Office of the Governor to also include you all, just like the hospitals were included?
We actually had that conversation, I believe it was last week or the week before, and it's Department of Health, Human Services, Office of the Governor, and ONB to kind of have that conversation. Oh, sorry. I'm so sorry. So the Office of the Governor, Department of Health, Department of Human Services, and ONB, we did have those beginning conversations about retention specifically for our nurses.
Commissioner Encarnacion, what about your staff, your nurses?
Same conversation. We actually entered into that conversation together, and we'll continue it as well. And we're communicating that word to the staff so that they would know what the plans are.
Okay, I'm glad to hear that, because I know your nurses have also been working diligently, and we need to also retain them while negotiations go on for salary increases. So I appreciate hearing that. Now, in your testimony, Commissioner Kasi Gomez, you mentioned that Herbert Greek Home is not a certified nursing home. Why is that, and what are the requirements to be able to fall into that category to be then properly funded through Medicaid?
So it's very strict, and that's what we're moving to with the skilled nursing facility. So when we build the new facility, it will be both the physical structure as well as the staffing structure. So there's specific guidelines according to the Centers for Medicare and Medicaid, and would adhere to that. So we've never had certification for our homes for the aged in order to do that, but that's what we're moving towards to ensure that we can save the government a little bit of money, but also maybe expand services.
Queen Louise is also
It'll
under
be-
the same status?
We actually got $65 million to begin that full prudent replacement.
But you're working on a plan then to obtain that certification?
Correct.
I'm glad to hear that.
Time.
Look forward for the day when that happens. Thank you, Mr. Chair. Thank you for your time, for allowing me the time.
Thank you very much, Senator Carrion, and kudos again to the DHS team for being able to get that FEMA award of $65 million. That is commendable. So you don't write the checks, but the squeaky wheels is what get the oil.
Oh, I'm squeaky, all right.
Okay, all right. You have to
No, we've
yell,
followed
scream,
up.
and kick for your employees. So
And I have followed up, and we're hoping to get those out next week.
okay, so just be mindful of that. The homemaker services and what's your clientele in the homemaker services? What's your census there right now?
The census for homemakers.
Yeah.
Either one of you. You have it? Go. Mr. Milligan.
If you could break it down per district, I'll be fine.
Alvin Milligan, excuse me.
Pull the mic down a little bit, please.
Sorry, Alvin Milligan, Assistant Administrator. For homemaker services, we just increased on St. Croix to about 61 persons. We still have our wait list. On St. John, we have about 4 right now. And on St. Thomas, we're at about 50.
And what does that waiting list look like?
On St. Croix, we have about 25.
25.
Yeah, and that's because, as the commissioner reported, since COVID there's a big increase. COVID just has come in and just turned stuff upside down, so there is a big increase there. However, the MAP Medicare program, they also have what is called a personal care attendant program that they're running now. So we're trying now to shift those persons who are eligible to go over to that program so we could utilize those fundings as well. So we did some assessments, so we're able to put on an increase of about 10 or 11 persons, and we hope to visit it within another week or two to see who else is eligible so we could shift them over to the MAP portion of it.
Please let us know how we could help to amp up the homemakers service, because obviously they're providing a service that would deal before it gets to that chronic stage. I think it's so critical. So if we could really beef that up, I believe that we would like to support that. Okay. Who's next? Francis Heidegger, you're recognized for your 5 minutes. Senator Francis Heidegger, you there? Senator Joseph. I'm sorry, Senator Sorrow, you recognized for your 5 minutes.
Thank you, Mr. Chair. Good afternoon to all. I want to center my questions really in the St. Thomas, St. John district. Mr. Milligan, how you doing?
I'm well today, Senator.
Good. So I look on your Facebook page and I see now this action taking place on St. Croix for the St. Croix seniors. And we have a large senior population in this district. Can you tell me what would be, or what are the, and this is not adversarial, just if you could explain to me, what are the bottlenecks that you're having in providing that same level to this district?
I think we are, it's just that it's not being publicized as much, so that's probably the issue there. But we partner equally in all districts. It's just that we just mentioned that just the other day that we need to probably showcase a little more on St. John and St. Thomas as well, because they do, and especially on St. John, those seniors are very, very much active. They do a lot of even hands-on stuff. They do like boat rides and stuff like that, but it's just that we don't really showcase them as much, and we'll make certain that we take care of that. Now that we have a full PIO staff and stuff like that, we just need to make sure that we put it out. We've been playing fair. I think that's the issue here, that we've been playing fair.
I haven't seen any organ and music playing and singing the hymns and stuff, I haven't seen over here.
Well, we do. And whenever I'm in the district too, I lend my support. As a matter of fact, I need to go to St. John in recent times to share that as well. However, we do have some of our seniors who are very much active in doing that as well on St. John and St. Thomas, but we can work on that. That's something that can be fixed like tomorrow.
Thank you. I'm looking forward to you coming or somebody with some skills to play the organ and we sing Come Thou Fount of Every Blessing or something, so the seniors can have a good time. Now, Commissioner, not Encarnacion, I know you today. Kazi Gomez.
Yes.
So the Queen Louise home, I know that you're slated for prudent replacement, but in the interim, tell me what's the interim plan? Because you and I have been back and forth on the state, the look of Queen Louise home. We know that FEMA moves at a horse and buggy pace, so we don't know where we get that prudent replacement, because I remember when we were trying to move the DMV to a new location and I was trying to hijack your Head Start, you let me to know you had $2 million to rebuild your Head Start, and Head Start is still sitting down there in a deplorable condition. So I know that this is a long way off. Tell me, what's the interim plan on the state of the Queen Louise home?
Well, actually, the
Is
full
it? Go ahead.
the full prudent plan actually includes the repairs to the current Queen Louise. So it's not just the full newly construction for that, but it's also going to include all of the repairs needed for the current one. The only challenge we're going to have is during those repairs will be where do we put the frail elderly during that time that we do renovation. So it is included in the plan. So to fix the current Queen Louise as well as build a brand spanking new 60-bed facility. So as far as the timeline is, we just got the funding. We just got we just got the award literally within the last 10 days, which is a really great spot for us. And then the plans for architectural and design will come next.
Okay, I'll hold you to that. Now, let's talk about your block grant. The last time you were here for the budget, you were denied, and you had some positions that needed to be filled for delivery of senior services, a lot of senior services, and you put almost all of those positions onto the grant, and then the grant was denied from OMB. So we were unable to render those services because of the structure. Have you made any progress in that area so that the block grant can be utilized to its full potential and you can still hire people to render these services?
Actually, we have our CFO, Lenny McGrath, on, and we also have AC Reimer Brown that's been working on it tremendously. So, Mr. McGrath.
Good afternoon, Lady McGrath, CFO. Senator, I actually have the block grant open on my desktop from yesterday. WAPA did an injustice. We've been working with OMB so we can submit it. It is a 2-year grant. So we plan to have that in. I was hoping for today, but it's going to be into OMB by Monday.
Okay. Can you guys hear me?
Yes.
Yeah, we're hearing you, Senator.
What was the story? Oh, okay. So, what was the story that you couldn't get in because no power? What did you say?
No. I said I have it open from yesterday. It's just we are inundated with year-end closeout. And I was actually working on it last evening and then the power went. So that was my cue to, even though our generator kicked in a couple minutes later, that was my cue to pick up and go home.
Mr. Chair?
But yes, the thing is that it's a balancing act. We had to move monies from some of the expenditures to give the leeway for availability to put positions on the block grant. It is a 2-year grant. So we are working in getting that to OMB.
Okay, Mr. Chair, is it just one round or?
No, we'll have a second round, Senator, but you have a follow-up question?
Okay.
You could do it.
Yeah, the follow-up question would just be for Human Services, because from the budget cycle when they came before us, there was already an issue with the black grant, them not, the positions not being able to hire people for those positions. So I wanted to know what is the impact, because it says, I understand a year-end closings, the fiscal year is starting come Monday, tomorrow. So what is the impact of this delay with the black grant, because these are critical positions that are impacting the senior delivery services. I wanted to know from them, what is this impact that they're feeling from not being able to move forward with the black grant so far? Thank you, Mr. Chair, for the latitude.
You're welcome.
Good afternoon, Mikal Reimer Brown, Assistant Commissioner. We certainly are going to press forward starting next week, even stronger, to get our social services FY 2022 block grant totally approved by OMB. We're going to be filling some positions that are on there, the homemakers, some of the nutrition aides. And I just want to make a plug for our Director of Homemaker Services, that if there are any nurses out there and you want to become our Director of Homemaker Services, whether you're LPN, RN, call us. Let us know you're there. We'll be ready for you in October, and we'll be pushing forward on that. We have had a very difficult last month. I must give high honor to CFO McGrath, who came in, and in these last 30 days, I don't know if she slept 3-4 hours. So it's been a tremendously difficult time for her to come in to close the year, plus deal with some of the grant issues. But we'll be working closely together, and we will get that block grant approved, and you will see those jobs out likely in the month of October advertised with DOP.
Very well, thank you. Thank you for that. And real quickly, in respect to public relations, I'm always impressed with the Department of Public Works. They're like all over the place when it comes to social media. You go Facebook, Instagram, Twitter. They're all over the place. And I know that you have a new team that you put together for public relations, but I would suggest that you copy some of what's being done by the Department of Public Works and make sure that you just flood in the place, because we have good story, we have things to talk about, and I think it'll be important to get those things out. So in respect to the homemakers, or these, how are you receiving, do you have referrals? How are you getting your clients develop their physicians are making referrals, or how
family members.
Family members.
It could be friends, family, anybody that knows, church members,
senators.
Yes, senators.
Yeah.
So anybody that knows that somebody that may need that service. Sometimes we get them from the housing authority. If the Department of Health, everybody that's seeing that individual that may need that assistance usually gets a referral.
Okay. Is that also something you put out on your website, or the PSAs about, or anything?
We have actually done, and we have a great communications team that just joined, so you will be seeing a lot more stuff. All of it. We got a YouTube now, and eventually TikTok. We'll make sure that you're on that. But I think, all in all, I think the communications, and we actually are going to start doing a little bit of a show to talk about what types of services and how you do them, and break down the 84 programs that we have.
Yes.
So our team will be doing that as well.
Very well. Very well. Good. Senator Whitaker, you're recognized for your 5 minutes.
Thank you. Good afternoon, Chairman. Good afternoon, colleagues. Good afternoon to the people of the Virgin Islands. And good afternoon to our testifiers. I definitely want to say that I really like the video and what you all do with the seniors. I had an opportunity, and I want to thank the team again. I did get a chance. I don't always get a chance to participate because of my intense schedule, but it's always a joy to spend time with our seniors. I am a big advocate for seniors as a person who was raised by a grandmother, and so it's for me really, really important that we care for our seniors. So again, commend you all for the reopening of the Senior Center back on September 8th, and however we can continue to support and work, and as the chairman has expressed, more communication so that we can highlight the good work. One of the, and Commissioner Kazi Gomez, you and I have coalesced over the home care services, as routinely a lot of our seniors have to leave the territory in order to have that 24/7 care. So I do echo, on the website you do have the information, but I would say really that's a good place to continue to recruit, and I'm really happy to hear that we're going to move forward in that regard. Many of our seniors are who are left at home are having to, they're walking down the street, and not for the help of neighbors, sometimes being able to make sure that they are okay. And we know the suffering that caregivers have, and that's why it's so important. The other question I have is around our senior facilities. I have engaged you over, for example, the Wilfred Pedro homes. How can we get human service also working with Department of Health to really help some of those seniors who do need care at our housing communities where there are senior populations?
Yes, good afternoon, Senator Mikkel Reimer-Brown, Assistant Commissioner. We work closely with Wilfred Pedro, I always mess that up, Wim Gardens. We do have our homemakers who go into many of those homes. We have our Meals on Wheels program. As we mentioned in the testimony, we used to have a nursing support services staff there, but because of diminished funding, we no longer have it. But we do subsidize, and we're hoping with our new funding from the governor's Living Your Best Life, Aging Your Way, we'll be putting out requests for proposals for private entities to join our homemakers to expand the services within homes like Wim Gardens and all through the community. So we do a lot of work in Wim Gardens. We no longer have the nurses stationed there. We hope someday to have that back, though.
And that's excellent, because I've been at that for entire term. I specifically adopted a community and kept up with what's going on there. One of the things also too that, and can you really share in terms directly of Herbert Gregg, how are we working? My big thing with our seniors, we need to kind of take them away from the facilities at times. Do you all have any plans to, as we look at facilities and recreation centers, to even work with, among other departments, for there to be an actual plan to build a facility where seniors can enjoy? One of the things that I've been pushing on is our seniors getting out of the homes, getting out of the homes at residential homes, getting out of their own homes to have recreation and have a good time.
Well, that's part of our plan, the state-of-the-art facilities for both Queen Louise and Herbert Gregg. But it's important to also add that a lot of them are bedridden. And they're not ambulatory. So those that are not able to do so, we're not obviously going to take them. We do have services before COVID for them coming in. So church services, our Lions Club, Rotaries would come in and help decorate, and they would provide shows there in our gazebo area and at Queen Louise. So we do have services that come in if they're not able to go out. Stanley's come and done music for them, and they were able to sit out and have some snacks while they were doing that as well.
And another turn now, the issue of fraud. A lot of our seniors are getting taken advantage of. I'm dealing with a case right now where a person basically used power of attorney and essentially, just abused the senior, and having to deal with the Attorney General and the like. Can you really highlight how has the division, department been dealing with senior abuse and working with the Attorney General's office, and even if it's federal, U.S. Attorney?
I take this very seriously. I have actually several close friends. Their parents have been taken advantage of and taken to the cleaners completely. So we work very closely with the Department of Justice. So anytime we get a referral, we do the investigation and make sure that we work closely with the Department of Justice to ensure that it's investigated, and then whatever our power are at that point to help move the case along.
And finally, what about the senior cards? The seniors,
the senior ID.
Senior ID. How is that coming? Is there any improvements that can be made? And also on our side, is there a fund? You guys have requisite funds to be able to support that program.
We're good with that, and it's free now. And so people do have the issue of why it's expiring. A lot of times, we like to put our eyes on our seniors. So even though it expires, when we talk about the fraud, waste, and abuse, a senior may pass and their ID may be utilized by a family member or a friend or something like that. So we want to make sure that that renewal process doesn't necessarily look at that, the fraud, waste, abuse, but we also look at it as an opportunity to provide services to that senior. So if it took you 4 years or 5 years to renew your ID, you're now 85. Now I can still put eyes on you now to see how your health is, what your needs are. And so that provides us a good opportunity to provide that.
Great. Thank you so much.
My pleasure.
Thank you.
Thank you very much. Before we go to our next senator, which is Senator Francis Heidegger, I wanted to ask you in regards to our personal care attendance services, are we up to date with the vendors' payment to those folks?
I believe they're up to date. I'll double check, but I believe they are.
Yes, Senator. Mikhail Reimer-Brown, Assistant Commissioner. We had a couple of delays with personal care attendants under a Medicaid program. And I believe we should be up to date on that. We try to do our check cycles at least monthly, bi-monthly for that. Many of the personal care attendants, they're small businesses.
Right.
And so it's even difficult to wait 2 weeks.
Yes.
And so when you submit your invoices, it has to go through an adjudication process through our MMIS system, and we are pushing out those payments. I routinely check with our Medicaid program and our claims supervisor. Because of her knowledge that they do not have a lot of cushion, she pushes through those payments for our personal care attendants. So I have to say, Medicaid, they're doing a pretty good job. If we have delays, we jump on it. We call our Department of Finance, and we get our personal care attendance programs paid pretty regularly.
Okay. I haven't had any recent complaints, but I know I've had in the past, and I've called to report those. Senator Francis Heidegger, you're recognized for your 5 minutes. We're not hearing you, Senator. Media, please assist. We're not hearing Senator Francis Heidegger. Try again, Senator. I'm sorry, we're not hearing you.
Testing.
Okay.
Hello.
There you go. Go ahead.
All righty. Good. We got it now. Good afternoon to my colleagues, to the people of the territory, to the testifiers and central staff. I first want to take this time to say a little bit of thank you. I had a issue with a constituent this week, and I was able to contact Human Services, and I had direct contact with Ms. Mikhail Reimer-Brown, and she really provided me with necessary information and assistance to help a resident that really needed some help. So I wanted to publicly say thank you for that. I want to jump into my questions, and you spoke a little bit about payment to some of the smaller private businesses. What types of plans and what types of procedures do you guys go through so that private businesses can partner with your agency, more of the types of services to seniors that they need? Because like people that are looking to become entrepreneurs or get into that type of business, how would they partner with you guys?
Mikhail Reimer-Brown, Assistant Commissioner, I thank you for that question, Senator, because specifically in this area of personal care attendance, I would recommend strongly that small businesses who are interested in providing services to seniors, you have to become a licensed business with the Department of Licensing and Consumer Affairs, and then you will touch base with our Medicaid program. You can do so even now, and you can get the requirements to become a personal care attendant. We will pay for those Medicaid eligible residents for you to go into their home per the prescription of the doctor. So if the doctor says you need 5 days a week and your business can provide that, we will. If you, once you're certified with us, you can be paid from our Medicaid program. We're also issuing requests for proposals for the St. Thomas, St. John District, and the St. Croix District for personal care attendant services. We anticipate those should be out before the end of the month of October. We were just awarded that grant. So there are several areas, but the personal care attendance program now will be one of the major ones. And then we're looking for a vendor who would like to do senior navigation services, who will assist beyond human services to help people in the community to connect, especially our seniors, with services not just in DHS, but throughout the community. So listen up by the end of
Excellent.
October.
Thank you. What type of strategic planning do you guys deal with transportation? As you know, sometimes seniors need to go out, get outdoors. Sometimes they need to get to medical appointments, doctor's appointments. What not only be inclusive, but also expand transportation services to assist them?
Also, with Medicaid, we have covered under our state plan non-emergent transportation. So Medicaid eligible members can call several entities and they can be taken to their medical appointments, or if they need to pick up prescription meds or other such related activities.
What if they don't have Medicaid? What options, are there any options available
Well,
if they don't have Medicaid?
Yes, if you don't have Medicaid, you have Vitran Plus, and Vitran Plus, they give very good affordable costs for seniors. As a matter of fact, that can help you. Those who have, as we know, Vitran, the regular Vitran bus is free for all seniors 60 years and older. So there are several programs that can assist our seniors.
As the population ages, what types of programs or extension of programs could be or are available in regards to people dealing with Alzheimer's, dementia, whether it's through Medicaid, Medicare programs? Could you please share with me and the public what types of programs are available in regards to these things?
Again, I think, Senator, we've been talking about the personal care attendance program. Medicaid on a hold will provide the health access that these families will need for those individuals who are dealing with Alzheimer's and dementias. Our programs throughout DHS assist these families. So it's across the department, but Medicaid and our Division of Senior Citizens Affairs provide most of the direct services to these families who are dealing with seniors and adults with disabilities.
In regards to senior centers, and this is just a twofold question, who deals with the nutrition, for example, if they go to some of these senior centers? And also, as the population ages, what are some of the plans that Human Services have to potentially, say, create more or expand senior centers? Maybe some of the government buildings that are available to be renovated, are there any plans in the works to potentially do any kind of build out or expansion as it relates to senior centers, as well as share with me a little bit about the nutrition programs that are available to them while they're at these centers?
So for the meals, actually, we have a nutritionist on staff that provides that dietary need to ensure that their needs met. So that's one option. And then the other, AC?
Yes, I just wanted to say we are going to be collaborating with VI Housing Authority on their new plans for WIM, and also another housing authority facility on doing recreational activities. My hope is in 2023 we can look at resuming recreational activities at Lucinda Millen Home. That was happening, as you know, the COVID has really taken out some of those activities. So we are very much open to collaborating with entities like Housing Authority and other private entities who would like to work with us and our senior center program.
Okay. Well, did I hear time? I want to make sure I don't go over.
You have a follow-up question, Senator? Your time was called.
Oh, no, I just wanted to wrap up and say that when it comes to human services, this is a very integral part of our community, as we always speak about the necessary things that needed, especially as we grow older. And when we have leaders in place that understand the need for this and making sure that the necessary tools are in place, whether it's the nursing aspect, the transportation aspect, the center aspect, those are very critical in making sure that the lives of Virgin Islanders, especially in their golden age, it's pretty good. So I want to thank you so much for giving me the additional time, and good afternoon again.
Very well. Thank you. Before we go to a point of inquiry, I wanted to ask, did I hear you say that, are you providing CNA training? You didn't say that, did you? No, right? Okay. Also, what is the status on the Medicaid for hospice? Where are we with that?
Mikhail Reimer Brown, Assistant Commissioner. Our Medicaid program, we have submitted our hospice plan. So it goes through a review by the Center for Medicaid and Medicaid Services. So for many who do not know, we have not heretofore had hospice care in our Medicaid program, but we will soon have it, I believe, because of the great job that our staff has done to prepare the plan to add hospice care.
Okay. And also, are you aware that Meals on Wheels not accepting new applications? Have you capped off on that?
We are currently capped because we are right now going to increase the per plate price, Senator. So we have to be very careful. It's a real balancing game, but we need to be able to feed our seniors well. And if we take on more than we can, we will not serve them well. So we are close to 1,000 people per day going out. So at this point, we do have a waiting list. We're hoping in 2023 we can reduce that.
Very well. Okay. I know that you have to leave momentarily. The question that you had was what's a question? You're recognized for a point of inquiry.
Thank you, Chairman. Commissioner Kazi Gomez, we had spoken about the Elder Dependent Adult and Disabled Person Disaster Registry. In my former capacity with elections, I in fact was the one who always pushed to make sure that persons coming into election office fill out the form. Yesterday, there was a meeting with Director Jashin, ADA coordinator, on the claim, a provider that's going to really help to make the system online. Can you just really put on the record where y'all would really moving from the paper-based nature of the system, as I've always asked about moving more towards an electronic version in working with Vitima and certainly the ADA coordinator?
Mikhail Reimer Brown, Assistant Commissioner. During the COVID, we actually began to take verbal telephone registration. They can, and we entered that on our website. They can download that and send that to us. And then we work with Vitima to have all of the individuals, we can actually tell where they are geographically. And now we're able to send messages. You may have heard them from Commissioner Kazi Gomez that are instant messages that go out to all of the persons on the Elder and Disabled Disaster Registry.
Thank you. And I'll be following up because we did speak that, of course, you have to be included in the conversation. So thank you.
Thank you very much, Senator Whitaker. Before we go to Senator Johnson for his round, we have a point of inquiry from Senator Saru. You recognize your point of inquiry?
Yes, thank you, Mr. Chair. Briefly, because I'm hearing a discussion around MAP, but is the department pushing the PAP program? That's one of the legislation that we moved in the 33rd legislature. And we expanded the pharmaceutical assistance program to assist with those who reached the donut hole and needed assistance with meds or equipment. And that was, when we looked at your funding had a large rollover from the year before because you weren't really spending those funds. So we expanded the PAP program for any type of disease and from 18 onward. So how are you using that to assist with the discussion earlier about meds and MAP?
Yes, Mikhail Reimer Brown, Assistant Commissioner. The Pharmaceutical Assistance Program is definitely assisting individuals who have chronic diseases and those who may not initially qualify for Medicaid. They're able to get started on the Pharmaceutical Assistance Program, and we've been paying for seniors and adults with disabilities. We've been doing a lot of work with adults with cancer who require some very heavy costing medication. So yes, the PAP program is doing some good work in that area. And our team of communications, they'll be doing some new commercials to really promote that so people can know they can apply if they're not eligible for Medicaid for the Pharmaceutical Assistance Program.
Mr. Chair, that's something that we need DHS to really push forward because this was passed in the 33rd. We are to the end of the 34th legislature, and there has been no marketing of the PAP program. People call the offices asking for help, and they don't even know a PAP exists. So thank you for the latitude, Mr. Chair.
Very well. And of course, they're hearing you the number of assignment and tasking for the new public relations team. So they got the work cut out for them. Senator Johnson, you recognized for your 5 minutes.
Thank you very much. Good afternoon again to my colleague. Good afternoon to the testifiers, viewing and listening audience. I want to follow up with Commissioner Tita Encarnacion and the vehicle. You're saying to me that the vehicle is getting ready to go back out. That's what I'm getting from you. So when was the last time it was out, and what stopped it from being out on the road?
Good
afternoon.
Go ahead, Commissioner.
Brennan, okay, good. I'll begin, and then DC Steele will continue. What's stopping it right now is in St. Croix, mainly. We're utilizing the van to care for the patients since our modular that the public, let's put it this way, the modular that the behavioral health services are being offered in right now is not being used because of mold issues. We've been discussing this in the past. We're hoping to resolve that issue. We did find a lease, we signed a lease agreement. We should be moving out really soon. But until that, we have to have the van available to care for the patients at the site. So that's what's holding it up. The last time it was out, DCC would be able to help you with that.
Yes, Deputy Commissioner Steven. The last time it went out was in July, was the last time it went out for an event, and since then we've had the issues with our building.
All right, I sure hope you guys can rectify that so that that van can be used for its right purpose. So I appreciate that. Mr. Milligan, don't move yet. Good afternoon. First of all, I'd like to say thanks to you, Mr. Milligan, and Commissioner Gomez and your staff for what I've seen and what you guys are trying to do. There's always going to be the need for more. And I want my colleague in St. Thomas to understand, Mr. Milligan ain't come in St. Thomas to live, but he come visit you. the tech Jamesy, remember Jamesy and the Happy Wife? And Kerry St. Thomas, he come back. so Mr. Milligan, I give you a little warning. We appreciate you and we love you, and I know we could share you, but let them know that the box stop right here. So what I want to start off with you, Mr. Milligan, what can we do to help you to even make that type of services for our seniors even better? What can be done? What needs to be done? Because the video is very uplifting. You see them really enjoying themselves going out and being out. And we'd definitely like to have more of that because my colleague said that we are around the corner. I done the corner already. so I want to make sure you have some service for me when my turn comes. So please help me. What can be done to even strengthen that type of, outgoing for our seniors?
Okay, good afternoon again. My name is Alvin Milligan. Just one. My name is Alvin. I think this one is okay. My name is Alvin Milligan. I'm the Assistant Administrator for the Department of Human Services, the Division of Senior Citizens Affairs. The first thing we have to reassure our seniors, and the demographics are a little bit different in each of the islands, believe it or not, is safety. To put out those events, what we do first, through the commissioner, we partner with agencies. We had to get VIPD involved. And what we did for most of those events that you saw, that we had to reassure the seniors that they're safe.
Okay.
No, man, I ain't kid. Yeah, to make sure that they're safe. and has been a challenge for us to do after our events. So one is twofold, not just to do the events, but to assure them that they can go out and have a good time. We don't want to do everything in a day because we live in a community where they're accustomed to do stuff after hours. So I need to also commend the VIPD because they partnered with us and they came out and they made sure that they followed the buses till every senior got home that night. So that was good. That's number one.
1 minute.
The next thing.
How can we help you? We want
Yes,
to help you.
the next thing is funding. As long as we have funding, we could do any activities that we want. We do have a budget for the senior centers. The thing is that always, we also ask for ideas as well. So if you know of anything that you think you like to see, we ask you that you could share that with us as well too. So funding, that's number one.
Thank you.
And I think if we have the funding to do these other activities, we'll do them.
Well, I appreciate that, and I appreciate the tour that we got, and I hope that we can get that analysis so that we can make sure that we can expand the service. But what I want to say to you, to Commission, the same thing I said to Department of Health. We need to get the Attorney General Office involved. For those of our borders that are sitting in your area too, that are collecting and no one is, the person is collecting the benefits, but yet they're not taking care of them. If I may wrap up with this last question here. In your testimony, Commissioner, you spoke about you're raising the awareness for abuse. In what way are you doing that, and what is your outreach to this community to get people more knowledgeable and really put a dent in that area?
With the new communications team, we're actually going to be doing a commercial specifically with that, and we'll partner with Department of Justice. We're actually, and AG Denise George also has a show that she does, and we've done some outreach. We'll be doing outreach with her regarding that specifically. So I think it'll be a hybrid approach where we do radio commercials, our communications team with social media, and partnering with Department of Justice for that show that she currently does. I think that would be a good hybrid approach to start off with.
I'll be looking forward to seeing them. Go ahead, Ms. Emily.
And just to let you know, I think it's next 2 weeks, the legal services are going to be doing some awareness. We're starting with St. John first. I think on the 20th of October, they're going to have a forum to discuss about different services that they provide, and also about elderly abuse and, getting stuff and reporting it, because a lot of people are being abused but they don't report it. That's number one. So we need to make sure that we could safeguard that, when you report it, that we are going to take care of you during the process. So that's the first thing that we need to do. But they're going to be starting on St. John on the 20th of October. They're taking the team over there, and they're going to have a full forum with different services that they provide as well. And we partner with them. I think we give them some funding to do that as well.
And Mr. Chair, let me just wrap up on this. I appreciate hearing about Queen Louise and the planning stage for building a new Queen Louise home. We're in a very good position in the Virgin Islands, but we have to execute. We have to make these things and have someone assigned that are going to aggressively stay with it, because sometimes these projects takes a little too long. And as you can see, the population of seniors are growing fast. I'm there. I got to go and get my ID one of these good days.
Anytime you're ready.
But we definitely need to emphasize the seriousness of time when it comes to these projects and building them out. What I saw with the old Queen Louise home, it's done its time.
Agreed.
It really haven't. You guys are doing what you can to hold on more to it, but we need to expedite these contracts and make sure that we utilize all funds and get a new facility going. Thank you very much, Mr. Chair.
Thank you very much, Senator Johnson. Before we go to the next senator, real quickly, Commissioner, have there been any discussion with the University of the Virgin Islands to assist and support in the endeavor of perhaps the caretakers programs for training, providing training, UVI cell? A lot of times we have issues in being able to provide that level of support and training and skills. Have there been any discussion with UVI in that respect?
I personally haven't recently. I mean, I did it probably last year, and that'd be something that we should revisit now.
Yeah.
Just as far as just training across the board for all of our staff. So I think that that's a great resource.
Okay. Yeah, please do that. Another issue is whether or not there is any prospect of having a discussion with a private entity to provide adult daycare. That's a serious void in our community. I hear that discussion quite often. And the government can't do everything, but maybe we could partner with a nonprofit organization or even for-profit, a private individual that could provide that level of service, and we could subsidize or support it. So if you could look into that as well, I
We
think
can look at
that-
a scope of work for that. And I just have a little bit of information from Senator Blyden's question from before.
Go ahead.
From the Virgin Islands Housing Authority. I asked for a little bit of data, so number of seniors over 60 currently residing in the Housing Authority is 431. So in St. Thomas, it's 294. Oh, actually, it's 431 in St. Thomas, 294 in St. Croix, for a total of 725 seniors currently living under the Housing Authority aspect of things. And then the future build is an additional 300. So I just wanted to make sure we got that information. Lydia Pelch was able to share that with me.
Very well. Thank you very much. Senator Gittins, you're recognized for your 5 minutes.
Thank you, Mr. Chair, and good afternoon to all.
Good afternoon.
Good afternoon.
You know, I often talk about the 5 Ps: prior planning prevents poor performance. But this government have certainly given the word planning a whole new different meaning. Because we planning, and we're going to plan until thy kingdom come. When can we look forward to seeing some action and execution when it comes to, how about Greg and Queen Louise and St. Thomas? I have had the opportunity to even walk through Queen Louise and St. Thomas. None of us would want or appreciate our loved ones to be in there. Queen Louise and St. Thomas look like a pigsty. That's how those rooms or sections, whatever you want to call it, are set up. And it's a sad, sad situation. I am, again, humbly asking, begging, pleading, whatever it is, for us to finally see some action, some execution, some completion of projects when it comes to these 2 senior areas. I've heard my colleagues talk about how close we are to the stage and how some of us are right there to the stage. It is serious. Are we talking about this for far, far too long? So I'm not asking anything right this minute on that, besides asking to see some action, execution, completion on these 2 areas. What I want to ask both, since we have health and human services here, I'm going to go back to the premium pay again, because we got to take care of those who are taking care of us. Both commissioners, I want to ask through your HR representatives, the affected employees within your outfit, were those employees respectively advised whether or not their names were submitted for premium pay? And I ask this question because employees to date should not, especially within these 2 departments, should not be asking or wondering at this time whether or not their names are on the list for premium pay. So starting with Department of Human Services and then on to Health.
All except for maybe 6 people within DHS met the criteria for premium pay. So all names were submitted. There is one caveat that I learned of during the visit.
I want to stop you right there a second. And that's why I'm always careful with my questions. Direct questions that requires direct answers. I don't want to know how many people names were submitted. I don't want to know how many people were qualified. I want to know if those affected employees were respectively advised by your Human Resources Division. Were they respectively advised that their names were in fact submitted?
Well, actually, how we did it in Human Service was I had each administrator submit specifically who worked during those specific times, because I did not have a deputy commissioner of HR, an assistant director of HR, or a labor relations manager. So each administrator worked with their HR generalist to ensure that the list that was given was certified and then given to me in order to process. So each administrator for each of the divisions submitted the list, certified that they worked during those time periods that were specific to it, and submitted it. And then we submitted the entire package to O&B, which is now submitted to Finance.
You know why I'm asking this, right? And Commissioner of Health, I haven't forgotten you yet. I'm coming to you.
Sorry?
But you know what? You could imagine why I'm asking the question in the manner in which I'm asking, Commissioner.
Correct.
Because we still have employees asking me to find out whether or not their names were submitted. And honestly, some of these employees, the areas that they're working, they shouldn't be in no doubt to date whether or not they will be paid premium pay. The only way that they should not be paid premium pay is if they weren't working between March 2020 and March 2021.
DHS can assume that all but those individuals that did not work and did not come out of their house, because we did.
Well, you know what they say
We
about
did.
assuming, right? But,
No.
But I'm not gonna.
But I've also expressed it through their administrators as well as myself. So I've said it both. I've said it publicly in this more than once. Not only today, but I've said it more than once because I've been asked by you specifically every time I've been in here, and I've said the
Yes.
same thing every time.
And,
so
and
right
sadly, we are in September, almost October 2022, and still, these frontline employees that we're talking about have yet to see a dime. Commissioner Encarnacion, what about your department? Have those affected employees been respectively notified via your HR department whether or not their names were in fact submitted for premium pay?
I just validated. We did not send an all staff email out, which we usually do. We have. I know you say you don't want to know this, but some of our employees did receive it, not all. So we're working on ensuring with the governor's office that all of DOH staff receive the monies that really and truly are owed to them because we worked so hard during COVID. So we're working on that.
I mean, it's
But
good
no
news
all
to
staff
know.
email, but we'll work on that.
I mean, it's good news to know that some have received it. But the reason why I'm asking the question the way I did is because I still have, and to my surprise, I still have employees who we know should be entitled to this premium pay that are still asking and saying that they don't know whether or not their names were in fact submitted. And that shouldn't be at this juncture. We're talking about the first responders, the frontline employees and whatnot. We got to take care of them. I don't know how else to say it. But we got to take care of those who took care of us during the darkest days that I've been saying over and over and over. I mean, it's like when we were police officers and whatnot. I mean, every time there's a preparation for a storm, I mean, it was almost like we forget that we're human beings. We got to be out there doing all these things, securing the sites where you're going to be giving out everything. And then afterward is like, oh, yes. we got to take care of ours as well. Good thing we had people that believed in those 5 Ps, that at some point when we rose through the ranks, we said, yes, you're going to go out there and secure these entities and whatnot, but we will ensure that once you finish your long 12-hour shift, that you don't have to go and stand in the same line to get these same reliefs. You got to take care of who is taking care of you. That's all I'm really asking. I know time has been called. If I can close out, just to ask about the Medicaid section commissioner. Who handles the special services? Ms. Creaky?
Annalyn's, well, she's actually in the process of retiring.
In the process of retiring. Today is her last day, isn't it?
Correct, it is.
So, I mean, kudos and praises and whatnot
100%.
can't pay the bills. But this lady has been carrying the mantle.
She sure has.
All by herself. Mm-hmm. With a caseload of over 4,000 or something like that. So, I mean, we can't let people go home just like that and act as if we're not grateful and thankful for all that they have done. I thank God that that lady didn't fall down on the job. And who you have now taking over her spot, one single person again, that is a sick person as well. And I'm asking you to look out for her health as well.
Will do.
Let's not let our people fall because we continue to just lay all the burden on one individual. Please, I'm asking, I'm begging, I'm pleading. Let's make sure that we put the foot soldiers where they're supposed to be so that we can help man this special services office. Thank you so much. Mm-hmm. And thank you both commissioners and your agency employees. I really wish things were a little better and a little smoother, but I will continue to pound the pavement for all of you. That's why you elected me to be here. This isn't a political statement, but I'm telling you, we have to look out for those who are looking out for us. Again, thank you. Thank you, Mr. Chairman.
Thank you very much, Senator Gittins. Annalyn Creaky.
Yes, give
happy
her a
retirement.
Mm-hmm.
Wow, all these years, St. Thomas, St. Croix, St. John. I remember there many phone calls, when I was with the police department.
Mm-hmm. I will miss her 11 p.m. calls.
You're finally going home. Yeah. Enjoy your retirement. Long life and happiness in your retirement. Commissioner of Health, let's talk a little bit about this Association of Nurses. When we talk about nursing in the general sense, we have school nurses, we have Queen Louise home nurses, we have Herbert Grigg nurses, we have DOH nurses, we have nurses at the hospital. How are we classifying nurses, especially when we start talking about the retention bonuses and premium pays? Some are in the loop, others are out of the loop. How are we making sure that all our nurses are taken care of? Because they equally could leave and go elsewhere or join the travel nurses and then come back. Can you speak to the Association of Nurses? How do we just kind of classify and catalog all of the nurses in the territory?
That's a complex question.
That's why I asked the nurse. That's why I asked the nurse.
And basically because they're all in different unions.
Yeah.
This week we went through union negotiations for LPNs, registered nurses, and RNLU, and to include in the RN the advanced practice nurses. However, those were only for health and hospital. We have human services. We're looking at those as well. BOC has nursing staff there. And like you said, they're in some of the other nursing homes as well. So it's really and truly, we have the Virginia State Nursing Association, I could say that. But they're not, in terms of regulatory, in terms of area of responsibility, that goes under the union as well as where they are located. So it behooves us to think futuristically and see how we can put them all. I have to tell you that Attorney Jas Springett is excellent at her job, and she is actually having these conversations. How can we simplify how we work with nurses? Because not only you're looking at the imbalance, I know there has to be a structure where acute care nurses may make a little bit more, but there are also some advantages to being a public health nurse, for example. And so that salary has to be just as competitive. So we're working at figuring out all of that. And I think that the discussions this week started that. And we're including Department of Human Services in those conversations a lot. And then we need to expand out of there. Education has a completely different union for the nurses as well. And you know that we depend on those nurses in education when we have a state of emergencies in reference to our general shelter. Yeah. So there's some commonalities that we have to deal with, some exceptions we have to deal with as well.
Yeah, we just got to be mindful that, when we start to reward some, that we demoralize others. And I think that, we have to find a way to make sure that all are made whole, because in fact, a happy balance, we want to, in fact, all of them are needed, all of them have work during the time. So we just want to, and I'm happy that our hospital nurses have finally, received their retention bonuses. I've been long advocating for that, but, how do we really capture nurses in a general sense to make sure that they're all, recognized and taken care of is something that, albeit complex, is something that needs to be done so that we don't demoralize some while we're rewarding others in that sense. Also, this RN network, I had a conversation when I went over to Herbert Gregg recently that there was some RN network where individuals had left that network then to join the Herbert Gregg home for the nurses that may have been left out of the premium pay. Have you been able to garner or glean, what's happening in that space so that those people can be compensated?
That was actually just brought to my attention this past week. I did not realize that the company did not do their part, and so I'll be rectifying that with.
You will be? Okay.
Yes.
Okay, great. Senator Sari, you have a point, and then we'll come to Senator Joseph for her 5 minutes. Senator Saro?
Thank you, Mr. Chair. Just a quick question for the CARES Act funding. Can you, DHS, explain or tell us how much you've spent so far for the senior citizens grant funds?
CFO McGrath would probably
Good afternoon. Good afternoon, Lydia McGrath, CFO. We have received a total of $4,161,323 in funding. We have spent $1,692,344.
Mr. Chair, if you look at the number, I don't think we're spending on those senior citizens. But thank you, Mr. Chair.
Ms. McGrath, you want to further clarify those numbers you said?
Most of the grants were issued in the area of 2021. Most of them have expiration dates of 2023 and 2024 for spending.
Okay, so you're saying that we have sufficient time that in fact you'll be able to remedy that situation, and that we won't be sending money back or leaving individuals out of the loop?
AC Reimer Brown is in flight, so I know she can't speak to the plans that she has for the funding, but the intent is to spend the funds down.
Okay. All right. Senator Joseph, you recognize, you wanted to clarify something, Commissioner Kazi Gomez?
No, I mean, our intent is to spend the funds, and we can look at specifically which ones, because they're multi-year grants, and so it's kind of, so when you're asking how much there is, some may be expiring today, but then sometimes we might get a low-cost extension, so that will allow us to liquidate and/or encumber for another year, and so they're all in different stages. So we'll make sure that at the end of this fiscal year, we do a comprehensive analysis, of course, and making sure that we spend as much money, because I do not like spend money or send money back at all.
Very well. Yes, and the issue is that obviously if they're expired today, it will be expiring today, whether or not we have applied for an extension in advance of the expiration as well. Yeah. Senator Joseph, you're recognized for your 5 minutes. Thank you for your patience.
Thank you so much, Mr. Chairman. You can hear me?
Yeah. Yes, we can.
Mr. Chairman?
We can hear you, ma'am.
You can hear me?
Yes,
Okay,
proceed.
beautiful. Thank you. A pleasant good afternoon to you and all my colleagues, as well as all of our testifiers here joining us this afternoon. Topic that we are discussing this afternoon, because we know we don't need the statistics or the census to show us we have a quickly aging population, and we need to do our very best to ensure that they are receiving the services that they so deserve. Now, I want to go quickly to questions surrounding borders. I remember in the budget process, there was a number of borders at the Roy Lester Snyder Hospital, and I read in today's testimony from the Wang F. Louis Hospital that they too have a number of borders. And these borders are typically individuals who they cannot discharge from the hospitals because of them not being able to have housing or have anyone to care for them. And this is all part of the spectrum under continuum of care. This wording, continuum of care, is constantly being thrown around, but we have to realize that we are in a critical stage, an emergency stage here in the Virgin Islands, especially with our growing population, for our elders and disabled individuals to receive critical care around the clock, 24/7. And that's why we're having a lot of borders, because these type of services are not available consistently in our islands. So let me go to you, Commissioner Kazi Gomez, and a wonderful good afternoon to you. I always enjoy seeing you and talking to you. How are we looking with dealing with the borders? Because I noted in your testimony, you said you are looking, and that doesn't tell me that you're going to be able to do it, to having 1 to 2 admissions into some of our senior facilities.
Good afternoon. Thank you for the question. So there's currently 17. We have a weekly meeting between the hospitals and Department of Health to look at each individual patient or client, or we call them residents, to see what the best plan of action is. We will be accepting 2 at Herbert Grigg, 1 from each hospital and 1 from the community. And then we're accepting 2 at Queen Louise once we are COVID cleared, because we had 3 positives at Queen Louise recently. So once that is clear, so that'll be 5, right? No, 4. 4 off their list, right? So that brings us down to 13. We also have a contract with Casa de Salud in Puerto Rico, and so we're looking at that perspective. So we're taking each individual patient to ensure that wherever we can place them, it's in their best interest and be able to do it. So if you looked at an example, and this might be a little expansion to what you were saying, so like if you were to look at, I'm not gonna, of course, giving any names or anything, but if you were to look at those that need placement, 1 has no family members at all, 1 has an apartment, but doesn't want to go home. 1 needs house cleaning to make sure that it's applicable when they get there. 1 has an appointment with housing to see if they can get into a home, because they can live alone, but they just don't have a place to live independently. Right. And then 1 just made 55.
I'm sorry.
No, it's okay.
Commissioner, because I don't want you to eat up my time. I have other questions. So I understand from just looking at the cost for the hospital, and I pulled up their budget, and this is from the Roy Lester Snyder Hospital specifically. They spend over about $5.9 million a year to care for their borders. $5.9 million they represented in their testimony. Is there any way that you or Medicaid, because it's under you, can work with the hospitals or even send up any type of justification because they are CMS certified to pay for some of or any of these costs?
Not to my knowledge, because it would depend on, they're not even in our care and custody as well, so we would have to obtain guardianship if we were to care for them. So we are in weekly discussions with the hospital and with Department of Health to ensure that we're making needs for each one of them. If that is the case and we're able to do so, of course, we'll be able to do that. We also have about a $15 million residential budget.
Have you explored that?
Time.
Have you
Agreed.
explored that? You
Sure.
in your conversations with the hospitals and the like, have you really want to get them out to the hospitals because they are taking up beds for persons who really need that level of acute care. But have you explored that? Because we're looking at that sizable amount of money. I have some other questions, Mr. Chairman. I don't know if my time is called.
Your time is called, Senator, but if you have some wrap-up questions, you may proceed.
You to look at that and have that explored in your conversation and discussions. Now, I wanted to ask you, Commissioner Kazi Gomez, you serve in your, how many elders have been identified in need of care at the Lucinda Millen home? Based on your statistics.
Well, currently we're serving between 6 and 8. It fluctuates. So right now we're serving between 6 and 8 residents at Lucinda Millen.
Okay, I just have one final question, Mr. Chairman, if you would allow me. Let's go to, and I had a couple of others for Department of Health, but I could wait for a second round if there's the next one. The number of staff members do you have for your family caregiver support? Because I know a lot of our people are really doing that work. A number of people, they're working, they're juggling their family, caring for their elders, and they neglect themselves, and sometimes some of them pass, who are the caregivers, before the person that they are caring for. So how are we looking to support them, and how many persons you have on staff, and how many persons are you serving in your family caregiver support program? I don't remember reading it in your testimony.
Currently, there's 5 staff members in the family caregivers staffing-wise. We have 170 approximately within the Division of Senior Citizen Affairs. And as far as statistics specifically for family caregivers.
How many? Yeah, how many persons are you serving in the family care? Well, I see it here. You have 132 clients and 63 on St. Thomas and 55 on, well, 63 on St. Croix and 55 on St. Thomas and 14 on St. John. Do you have a waiting list? That's what I was trying to get at. For persons to participate in this program.
Good afternoon, Senator Joseph Alvin Milligan here. Actually, the numbers on St. Thomas is 66, St. John is 15 currently, and St. Croix is 68. We don't really have a wait list because what happens is that the persons that need the service would come into the office and, you know, make the recommendations or fill out, do the interviews, whatever, do the assessments with the staff in there. So we don't have a current wait list for caregivers like that.
Okay. Mr. Chairman, I do have some more questions, but if
Yes.
my time has called, I don't want to abuse it. Thank you so much for, I have a number of questions, but thank you so much, Mr. Chairman, for the leeway.
You're welcome, Senator. You double your time. So we'll do a quick second round. So you could follow up with additional questions on the second round. At this time, Senator Blyden, you recognize for 2 minutes. Senator Blyden? Senator Carrion? You recognize for your wrap-up.
Thank you. Yeah, just going back and looking at some of the Budget records. I do realize, regards to Herbert Grigg, let me ask you, Commissioner, what was the budget appropriated, let's say, the last 5 years? And because it seems to have been a decrease in allotment to Herbert Grigg.
So for the general funds, for 2020, it was 2.6 million, 2021 was 2.3, and 2022 was 2.2.
So there has been a decrease.
A little bit, yes.
And how has this really affected, and that's just the last maybe 2 or 3 years, as you're mentioning, but I'm talking about even 5 years before. Looking back, the budget was totally different. How does this affect your ability to operate and function how you would like?
So if you went 5 or 6 years back, it goes back to pre-Irma Maria. So then your bed space would be 40. So now we're at less. So if you look at it from that perspective, so we're serving less than we were 5, 6, right before Irma Maria. The cost of everything has gone up. Pampers has gone up. Bed linens, all of that has gone up. Laundry detergent's gone up. Food has gone up. Insurance has gone up. So right now, everything has gone up. And so we're seeing that on a regular basis when it comes to operational supplies. So in the event that we were to expand Herbert Grigg, like we spoke of when you came to visit, it could increase our operational costs even though we're going to do the analysis, about 1.2 million probably, if we were to take, an extra 10 or 11 beds.
So clearly the decrease really has affected the ability, even though there's been less beds, but still the cost of living, like you said,
Correct.
everything with inflation, everything has just increased. So it's not really fair. So we're really looking for that full cost analysis to be able to add those additional beds. And with additional beds, of course, you mentioned comes additional staff, additional supply, the whole logistics component, that everything that, all the wraparound services that are necessary. If we're really talking about providing quality health care, and in this case, quality care for our senior population, we need to ensure that you have the necessary funding in order to do so. So that's something that is of a great concern to me, how it's been decreasing when everything else has been increasing. So I look forward to receiving that analysis through the chair to see how we can assist and really empower your department, and especially Herbert Grigg, with the necessary funds to be able to carry out and provide that quality service to our seniors that they so much deserve it after giving so much to us. Thank you, Mr. Chair.
Thank you very much, Senator Carrion. And along that line of discussion is that it's critical that we're able to, again, support this. We don't want for the services to be hamstrung by by a couple of dollars. When you look at $3,000 for the kitchen staff on a monthly allotment basis, $5,000 for our medical staff on a monthly basis, they have to decide whether or not to buy medication or not to buy medication and those type of things. I think that it need a little bit of a cushion. So that's why we need the cost analysis so that we could support and assist in that.
If I may, Chair, to add to that, it's not just the expansion of Herbert Grigg, because it's not gonna solve your border issue, right? Because that's gonna have to be a hybrid approach. So if I expand Herbert Grigg, okay, great, that's 10 or 11. But then what happens when 6 months from now we're gonna have the same issue? It just goes back to less care. So my residential budget currently is about 15 million, between 14 and 15 million. So in the event that I need to send someone off island to accommodate some of it, my residential budget is going to increase. So the daily rate fluctuates anywhere from $250 to I think $875 per day per person.
Yeah. Well, it has to be comprehensive. I mean, we'll look at the off-island, we'll look at the expansion of those facilities, we'll look at other areas that we could perhaps put them into the private sector, Turning Point over to Miss Mona Barnes' facilities. We look at some of these areas, other areas, but the fact of the matter is by having those borders at the hospital is really presenting a crisis situation. They're taking up beds that could be utilized for somebody that's sick and ill, so we really have to divert that energy elsewhere and put them there. So I understand you want to, and I spoke about that earlier today with the CEO. Yes, we want to create that happy balance where we addressing the borders as well as being able to at least look at some of the waiting list issues in our community. So But we have to comprehensively and collectively address that situation because it's really repercussions throughout our community, especially at the hospitals. Senator Francis Heidegger, you recognize for your wrap up? Not there. Senator Sorrow? Senator Whitaker? No. Senator Johnson?
Good afternoon again, and thank you very much, Mr. Chair, and again to the testifiers. What's the waiting time for someone to be placed in one of your seniors' home? What's the waiting time? You said you had a waiting list. Also, when was the last time that waiting list was purged to make sure that folks are not still in the list that should be out?
Well, it's reviewed on a regular basis. The only time that I'm able to take someone off the waiting list and put them in the home is if somebody passes away.
And what's the average waiting time for someone who's trying to get into one of the facility?
I have Director Martinez, I believe, and she may be able to kind of see what the average wait is, because we have like 25 for each facility currently.
Okay.
And so if we, Ms. Martinez, are you on by chance?
Yes. Yes, can you hear me? Good afternoon.
Good afternoon.
Go ahead and state your
Hi.
name for the record first.
Yes, Ana Velez Martinez, Director, Residential Services. Unfortunately, like how Commission just mentioned, unless somebody passed, that's when something becomes available in the facility.
Ms. Martinez, please turn on your camera.
She's not feeling well.
So, Senator Johnson, like I said, unless someone passed, that's when a bed becomes available. So I don't have a time frame of saying every month, every 2 months. So we always book, and that's the only time.
So some people could be
But
on the
we
waiting
do
list for a
review all
year
the-
if nobody. So if we have no attrition within our homes, the wait list will sit there for the whole year.
Now, you spoke about the borders possibly coming over to human service. Have you put a budget cards in place if and when that do, and what is your PGMS?
The ballpark is about 1.2. I want to fluctuate that a little bit because I want to make sure that it kind of goes in with the operational costs that I currently have. The analysis that was given to me did not necessarily. It did include like initial housekeepers and cooks because we'll definitely need that, but like sure the laundry and stuff. So I just need to vet it. I just want to make sure that I review it before I really give you my full analysis. But it's about 1.2 million with the operational and new staffing.
Thank you very much, Mr. Chair.
Thank you, Senator. Commissioner, in your testimony, you mentioned the fact that in the immediate future that there's 3 new residents at Herbert Gregg. You said it will be 2 from St. Thomas, 1 from St. Croix. What's the logic of
No, 1 from each hospital and 1 from the community.
1 from each hospital?
So we're trying to get rid of, we're going to try to balance the borders, and so since trying to make it even, so 1 from St. Thomas, 1 from St. Croix, and 1 from our community locally. So it's just 1 from St. Thomas. We're all one island, like one territory when it comes to bed space. And then we'll also take 2 for Queen Louise once we're able to open up a little bit, and it'll probably be another 10 days before we can do so.
So that's not a displacement of that person from St. Thomas. You already vetted that person to determine
Correct.
no family members or all that stuff.
The application's already in and approved.
Okay. Yeah. Point of inquiry, Senator Carrillo.
Since I heard that Ms. Martinez is also connected, apart from the expansion that we've been discussing, currently with the amount of residents that you have at Herbert Gregg, is what we are allotting, is that sufficient for the operations that home has right now? Because in our walkthrough, there were some concerns about not enough funding and so forth. So what would be that
the magic number?
that magic number currently for what you have so that each division can really run and provide that service necessary. I don't know if you or Ms. Martinez that is connected can share
Is it
that with us.
specifically for Herbert Gregg or
For
for
Herbert
Queen
Gregg.
Louise too?
Specifically for Herbert Gregg.
So with the expansion, so you have a current budget of what, 2-point-something million for Herbert Gregg. We also have a revolving fund. And in the event that we were to hire additional staff, you're looking
No,
at.
I was saying without the expansion.
So without the expansion, just the operational costs?
The funding that you're receiving now, is it sufficient to be able to provide that quality service that they deserve?
Let me do
And
another.
what are the shortfalls you're
Let me do
having?
a 23 analysis for you for that specific. Because it's not, to be honest, if we increase to 25, which is what we're getting ready to do. So if we're always at 25, let me see what the daily rate of the cost would be. It's lower than the national average, that I can tell you. And most of them don't pay, so that goes back. So we're about $100, $150 a day less expensive than a stateside facility.
Commissioner, you spoke about the two proposed facility, 60-bed facility. You mentioned that the one in St. Thomas, that property and procurement is working towards identifying a location for that. Is the one on St. Croix, is there a location already earmarked? Will it be on the same grounds as Herbert Gregg?
We have lots of acreage on Herbert Gregg, so we have a comprehensive plan. It'll also look at where the is it called Great Hall? The ruins there. It's a whole complex.
Right.
So it's not just where the Herbert Gregg is. It's also where our Head Start centers and stuff are over there.
Yes.
So it's an entire complex for Herbert Gregg. That's still in the mix. But Queen Louise, luckily, we do have the land, and we're in the process of purchasing it.
Okay. So the possibility will either be at the Queen Louise site in Concordia or...
So Queen Louise, we already
You're
have...
talking about Queen Louise and St. Thomas.
Queen Louise and St. Thomas.
Yeah.
We already have the land that we're purchasing. So we're in the process with property and procurement with the negotiations to purchase that property.
Right.
Once we purchase the property, then based on that property will be the A&E drawings and all of that goes with it.
And the one in St. Croix will be at the Kings Hill site.
Correct.
In that location. All right, very well. Senator Gittins, you're recognized for your wrap-up.
Thank you, Mr. Chair, and good afternoon to all again. Human Services. So, like your mission statement, you offer social services in order to better the quality of life for people here in the Virgin Islands. And I've heard questions from my colleagues, and everyone always asks, what could we do to help? What could we do to help? And one thing we can't say is we ain't got money. We can't say we ain't got money. But again, we need to see things moving. And one of the things that I'm seeing is that we missed the boat again. We have missed the boat again with these major projects that we should have been ordering materials and getting things built and whatnot. Florida just got swamped. You see how many lives lost? My heart goes out to them as they start to rebuild. That is going to push us now, the Virgin Islands, back how far again in getting materials to the territory? Because now they're going to be in demand.
Okay.
We're talking about cars and cars driving up and whatnot. What are we doing to ourselves? Again, this government has given planning a whole new definition. I'm going to continue to beat this dead horse, or this horse, until they get up. But tell me, Department of Health, quickly, why would a nurse within the Department of Health not be qualified for premium pay? Besides the fact that they didn't work at all between March 2020 and March 2021. Would there be a reason for a nurse a licensed practical nurse or a RN, a staff nurse, not to receive that premium pay?
There should be no reason why that person wouldn't receive premium pay.
Okay.
I did discuss this with, with Director O'Neill from OMB. She indicated those that are making above 70,000 will still receive it, but wouldn't be receiving it with the others. We're hoping to see that in October or after October. So that would be the only reason. I did communicate with my HR Deputy Commissioner, who will be working with DOP and our finance to ensure that we know exactly who will be receiving if they haven't received it, and communicate sufficiently.
That's understandable, and thank you for that clarification. But I also asked that because I didn't think that a LPN would meet that threshold of the 70. But if they fall in that category, then yes, that's soon coming. Now, DHS, tell me the same question. Now, why wouldn't those that are considered essential workers, because everybody in your agency should be essential workers, everybody. But tell me those essential workers within, what do you call it, homemaker services, Meals on Wheels, and even the adult protective services. Why wouldn't an employee within those respective areas not receive premium pay?
There's no reason for them not to receive it.
There's no reason for them. So again, I'm asking you all to go back and have a conversation with your employees, please. Something could have fell between the cracks, but we just need to make sure that we pick it up and we correct it.
I'll personally revet the list to make sure that we'll review everything and make sure everybody's informed.
Thank you. Now, you have a legal arm within DHS. You have a lawyer working with DHS.
I have a chief legal counsel, yes.
You have does that chief legal counsel have a staff? Because I noticed we love these big fancy titles. We got chief of this and chief of that, and they ain't got no Indians. So this chief legal counsel, does he or she have a staff?
No, they have one person that's mostly been the criminal victims point of contact, and they have hearings and appeals that comes under them as well. We've actually had a
Commissioner,
we've had an attorney posted for a year with no vetting.
Please, Commissioner.
Yes.
Your legal services section or your chief legal counsel, does he or she have a staff to work with?
No.
Thank you.
I just said they had two, hearings and appeals, and the person for criminal victims, and that
Man,
comes under legal.
You're confusing the dickens out of me.
Two people
you say
report
no,
to her.
and then you're saying two. Yes or no?
Yes.
So yes, the answer changed now to yes.
Not sufficiently. Not sufficiently, though.
Slow for me. That's why we don't get the answers. So the two people that you're saying that works for the chief legal counsel are what titles?
Executive, I don't know exactly her title, but she, executive something.
You have an HR person online?
No, he's currently off island.
And I'm asking this now because this goes back to the earlier segment of our hearing today. I was surprised that the CEO didn't even tell my colleague, you know, we just had that discussion as I met with him outside of the hearing, and we were talking about borders at the hospital. And I said, one thing that you all are not doing is utilizing the arm of our Department of Justice to go after some of these families.
Mm-hmm.
Because when you look at it, 8 out of 10, you could tell that these folks are receiving some type of assistance from the government, checks going here and there, and they ain't going towards where it's supposed to be. And while they have this person bordering there, somebody else spending the money going elsewhere. People need to get locked up around here. Total nonsense happening. So I asked about your legal arm within the Department of DHS because I want to know what is the role or the function of that legal office within DHS? Is that your administrative legal counsel, or is that the legal counsel for the Department of Human Services that can assist with some of filing cases and whatnot in court with some of these matters that we're talking about?
She may be able to assist. I usually go through the AG's office, though. So
yes, you would go through the AG's office to file the cases in court, yes. But if the respective agencies have a legal arm and they have a staff, yes, they can start the process where by the time they get to the Department of Justice, you have a product that they can work with. So that's what I'm asking. What's the role of your legal counsel? Are they your legal counsel or the department's legal counsel who can assist your staff with preparing the necessary documentations to submit to the Department of Justice?
considering she does all contracts, hearings and appeals, and criminal victims, I feel like it might not be fair to ask her to do that in addition to.
Understood.
So
Understood. Hence my question about staffing.
Correct.
So we see the need for a proper staffing within the Department of Human Services. So you need a whole legal services division within that agency. Again, your mission statement is to offer social services to better or to enhance the lives of or quality of life for all Virgin Islanders.
Correct.
Thank you so much. Thank you, Mr. Chair.
Thank you very much, Senator Gittins. Commissioner, when a client comes to Herbert Gregg or Queen Louise, do they forfeit? Do they contribute? Is there any contractual agreement in which they commit to utilizing some portion of whether the Social Security pension or whatever to assist with
It's
their
a comprehensive application. So in the event that they are able to do so, Social Security, whatever it may be, comes to their cost of residential. I'll be happy to share a copy of the application with you just so you have an idea what it looks like.
Yeah, please. I think we'll get a better understanding of what happens in that space.
Sure.
Additionally, in regards to the premium pay, because I think that at some point we need to put that to rest. In regards to premium pay, I don't think that the OMB director makes a determination who gets paid. Their agencies were responsible for sending in the names of those individuals that work during that time, correct? And all she did was send back and ask for the I-9s to be filled out, and then checks are cut on that matter, provided that they make under the $70,000. We know that the $70,000 is still under scrutiny for whether or not they will be authorized to make the payments.
Correct.
But OMB cannot make a determination that a employee will not be paid.
That
or
is why the
compensated.
application, Division of Personnel gave us the specific application, came to the department head, which was myself. I completed the application with the assistance with all of my administrators, making sure that they were the ones that said whether their employees worked or not. So even HR wouldn't necessarily be able to tell you whether they were teleworking the whole time or if they were in the office. That's why the administrators did that.
And I think that's what needs to be put to rest, whether or not you need to then individually meet with each of these employees, whether or not they qualify for it. If they worked, then obviously they're eligible for it. But you're the one, or the agencies are the one that sent up the names.
Correct.
To be compensated or to be paid.
Correct.
So
And
if the
then
name is not on the list, they're not going to get paid. And then
Correct.
somebody needs to sit with them and say the reason why their name was not on the list.
Agreed.
Okay.
Agreed. Yeah.
All right. Senator Joseph, you recognize for your wrap up. Yeah, we're not hearing you, Senator. Senator, we're not hearing you. Media, can you hear us?
Hello?
Very well. Now we're hearing you.
Oh, wonderful. Thank you so much, Mr. Chairman. I wanted to ask Commissioner Kazi Gomez, I'm still on you because I didn't finish up. Tell me how much monies were awarded for fiscal year 2022 for your Centennial Treasure Awards, and how many persons received awards? If you can tell me that number. If you can't, just supply it to the chairman.
I'm going to allow Mr. Milligan because we had a couple of years combined. I know that I personally went and delivered 6. For 2022, we delivered 6 checks, and that was in the amounts. How it's set is $5,000. So a portion goes towards the burial services, and a portion goes directly to the client.
That's correct, Senator Joseph. And currently we have another 6 that we're going to be doing within the next 2 weeks or so. Well, 3 weeks or so as well. So, and that's between both districts.
Okay, thank you. I have some follow-up questions there, but I could speak to you offline. Now, tell me about your CSEP program. How many persons have been employed, received permanent employee from the CSEP program?
Where they went from CSEP, what do you mean, to permanent employee?
Into permanent employment. Because I do know that the Department of Human Services provided opportunities for a number of seniors who are participating in this program to receive hands-on training. How many of them have been hired by the Department of Human Services or any of the other agency or private entities from the CSEP program? I needed to get some statistics on that.
I will have to, I'm sorry, I don't have that. I just have the total number that are currently. I'll be happy to get it through the chair.
Could you send that information to the chair?
Sure.
Thank you. Let's move in quickly on. I wanted to ask
Can you
Commissioner
before you ask your last question, can you
Mm-hmm.
repeat what's that through the chair that you wanted?
Oh, certainly, Mr. Chairman. I needed to get the statistics on the CSEP, on their outcomes specifically. How many are currently enrolled and how many have been placed in jobs permanently? That's part of what I believe is some of their grant requirement reporting.
Thank you.
Because they're receiving the training and so they need to be placed in a job permanently.
Thank you. You may wrap up now. Thank you.
Okay, thank you. I do have one final question, Mr. Chairman. I don't want to really
you may wrap up now, and then Senator Sarah.
This is Senator Joseph.
That's what I'm saying. You may wrap up now, Senator, and then followed by Senator Sarah.
Oh, okay. I only heard Senator Sarah and I'm sorry. Okay, now I wanted to ask you, Commissioner Encarnacion, kindly indicate for us how many persons have you served in some of these programs, specifically the one on chronic disease and prevention. This is a very important workshop you do. Anything for preventative health is important because then we are not going to the hospitals all the time and we're able to live healthy and more vibrant lives and not depending on our healthcare system. How many persons have you served?
I can give some examples. There's one program that 120 individuals participated and 80% of that were seniors. And to date, the division has facilitated 2 cohorts, which more than 42 participants. 17 of that, which is 40%, were seniors, but 42 participated. That's for chronic disease itself, as you were asking.
Okay, thank you so much. I really want to finally just say really kudos to the staff. I know it's not easy, but I would like you to just remain vigilant and be encouraged because it's a lot of work that you do and it's vital work to keep our communities rolling, and you provide such a vital service to those who are in much need of that type of service. Thank you so much, Mr. Chairman, for the ability to wrap up.
Thank you, Senator Joseph. Senator Sarah, you're recognized for your wrap-up.
Thank you, Mr. Chair. Quickly, DHS and NDOH DHS. So there's $4.1 million in total that you have for the Senior Citizens Grant Fund, and you only spent 1.6. Those funds expire today?
Ms. McGrath.
Good afternoon. Good afternoon, Lydia McGrath, CFO. We have a couple of grants that are expiring today, and those are the ones that have been spent. The rest are expiring 23 and 24.
So you're going to be able to spend $2.4 million by 23 and 24?
Well, we intend to spend all of the monies by 23 and 24.
All right, buddy. Okay, Meals on Wheels. The funds allow for you to hire over 1,000 drivers. How many drivers do you have now, Meals on Wheels?
Meals on Wheels, Senator, I have 18 employees.
Drivers?
Drivers.
Do you not need more?
I'm sorry, can you repeat the question?
Do you not need more staff? Have you exhausted the funding for the Meals on Wheels?
We'll need if we serve additional meals, we'll need additional staff. It's not just the driver, but it's also the person that goes with them as well. And we'll need more transportation in order to do the different run. So it's a little, it's
Okay,
combined.
so so the question is, are you meeting the needs of those who need that assistance?
Not all, because we still have a bit of a waiting list.
Okay, and do you have the funding to hire the people to meet that need?
Not completely, no. Because if we utilize any of the funds that we have, it'll definitely end. So it'll be either we increase the GVI or get it from another source to ensure that we're actually serving everyone that needs the Meals on Wheels.
Okay, and Mr. Chair, just lastly, one more question for DOH. Who's the person over the Division of Thank you, Mr. Chair. Who is the person over the Division of Chronic Disease and Prevention?
Dr. Linnea Fredericks.
Dr. Linnea.
She's on the call.
Are you there?
Yes, I am. Hi, good day. Linnea Fredericks here.
Thank you. Question. So this program, I see that it's an evidence-based 6-week educational group workshop aimed at participants' self-efficacy, knowledge, and all of that good stuff, right? So, what's the what?
Efficacy. To empower them to be able to, yeah.
Oh, okay. I was like, can I not read? So the question would be, we have a lot of seniors who are getting their toes amputated because they're going for manis and pedis at the regular mani and pedi shop. What does that outreach, I'm really concerned about the toes, right? What does that outreach look like? I hear the education component, but is there something that we could do? I know one senior right now is dying from gangrene. She doesn't want to amputate her leg because she went for a mani-pedi. And I see it a lot too. Like we have one podiatrist, Dr. Flippin, and that's what she sees as well. So what does that outreach look like? Because we do have a high diabetic population.
Well, what we are planning to do, and we actually just went to Puerto Rico 2 weeks ago, the week when Fiona was here, to launch a collaborative between the FUHCs and the Department of Health clinics so that we can enroll the patients who have diabetes into this program where they're going to be working on learning more about managing their diabetes, to include ensuring that they have the education to know all of the components, which includes proper foot care, which includes making sure they have their A1Cs. It also includes making sure they have their hypertension in check, cholesterol, so all of the risk factors that they experience as a result of being a diabetic. So that's something that we are in process of kicking off. We went to Puerto Rico, we had the training, and now we'll be rolling it out within the coming weeks.
Okay. Mr. Chair, sorry for this, but I don't know if we're collecting the data, but somebody that's have a simple ingrown toenail and wants it to be clipped out, because I can just go for a regular pedi and get my toes polished and the wrong clipping and then bam, an infection happens, gangrene sets in, you lose your toe, and something else happens. So if you could do some PSAs and some strong, just 60-second cool ads about the importance of understanding proper foot care, I would really appreciate that, because I'm seeing a lot of seniors, since when the campaign trail, so many seniors are missing toes from simple mistakes and misinformation. Thank you for the latitude, Mr. Chair.
If I may, thank you so much for
Thank
that.
you,
We can definitely
Senator
work on
Sarah.
that.
One sec.
And-
One sec. Wait for the chair.
Mr. Chair, if I may.
Yes. Thank you, Senator Sarah. Commissioner, you recognize.
Thank you so much, Mr. Chair. Thank you, Senator Soro, for that. That's something that we can definitely work on. And not only that, but look at the regulatory aspect of that as well. So we link both, but make sure chronic disease is involved in that.
Thank you for that.
Thank you. Commissioner Encarnacion, the emergency medical technicians who are no longer under the Department of Health, who would have been the agency head that submitted those employees' name for the premium pay? Would it have been you, or was it the fire director?
It would be us. And for the record, all our employees were submitted.
Okay. Thank you. Just know that we're asking these questions because we still have some of these first responders, to my surprise, and frontline employees who don't know whether or not they're getting the premium pay or whether or not even if their names were submitted. Hence my question for asking if your HR division notified these employees respectively. All right, but I'm glad to know that there was a Department of Health that submitted the names of all emergency medical technicians. They worked under the Department of Health at that time, correct?
At that time, correct.
Thank you. What do you want to do?
I see so many seniors with
Senator
no
Joseph,
toes.
you had another question? No?
Commissioner, you can do like some one-on-one workshops where you could like get a podiatrist to come in and give free pedis and stuff. That's too much?
No, but
Senator Sarah, you had a follow-up? Is that Senator Sarah?
Well, I was actually.
Senator Sarah, you have a follow-up? Your mic was on, so I mean.
I'm sorry. I was just asking the commissioner off the record if part of federal funding can allow for once a month for those in the senior homes. Because even when you go to the Celestino White Senior Center, it's supposed to be independent living, but a lot of them are not independent. If we could go to those senior areas and give free mani pedi through a grant funding, maybe once every 6 weeks, once a quarter, to really give them that food care. I am so concerned about the diabetic population and the mani pedis that go wrong.
that's linked to a question that was asked before, if the Department of Health can go into others. We worked with with Housing Authority in the past, and have rotated some staff in that. So once now that but we're in the endemic phase, we can actually provide more of those services as well.
Very well. Thank you, Commissioner.
Thank you.
Thank you, Senator Soro, for your question. At this time, we'll go to closing. I'll allow for both commissioners to give a 30-second closing. And I want to, again, extend my appreciation for the work that's being done by the rank and file employees. I think that they have done a yeoman's job in carrying out the tasks during these difficult times post-hurricane as well as a pandemic situation, and people have been severely challenged. How are we handling our employees' behavioral health? How are we handling their issues and concern? Because I would imagine that we're pretty convoluted, right? I myself feel like there is that there's so much going on at any given time, you know. So can we just quickly, as you do your wrap up, if you could just talk about, you know, how are we handling our employees' behavioral health? And I see Dr. Sims is still there, right? That's a good one for her to speak towards. I know that she has some training every so often with her employees and be able to interact with them. But, you know, if we could just talk generally, how are we handling our employees' behavioral health during these difficult times, I'll appreciate it. Commissioner Encarnacion, we'll go to you and Dr. Sims first, and then I'll come to Commissioner Kazi Gomez.
Okay, I'll start and let Dr. Sims begin with that portion of it. But it's so interesting because she and I were having this conversation just this morning, because we're starting a mind, body, and soul conversation with Department of Human Services. This is, you know, and we're going to start on the 6th, where we have Zumba, and then after the Zumba, October 5th, and after the Zumba, we'll actually have a cool down session. That's really where we engage the mindfulness of that person and everyone that's there, and then they can take that with them away. So it's not just for the Department of Health, but for all employees. However, I was speaking with Dr. Sims this morning and trying to employ someone to focus solely on the employees for the division, for the department as well. So Dr. Sims, you want to continue with that?
Thank you. Dr. Nicole Cragwell Sims, Assistant Commissioner, Department of Health. Yes, so those conversations have begun, interested in bringing persons in to actually have communication with our staff that's outside of executive leadership, just because of how the dynamics is looked at in terms of executive leadership versus line staff. We're also discussing, a few years ago, we used to have after work sessions where you just kind of talk, you left your titles and your official names at the door, you come in, you spoke, and what you discussed there stayed there. So we do want to reinstitute that, as well as having everyone, you know, bring their child to work, and that's not their literal child, but themselves, where we have times in a day where you resort back to childhood. We do things in that area, in that realm, and just bring you back to a jovial time. So we're actually working those things through the Department of Health and eventually the government.
If we can, we're also having a blog. We're starting a blog also this week coming, and the blog will focus on the mind, body, and soul, and you'll have individuals from the Department of Health Human Services speaking to how we can actually expand our mind in reference to behavioral health services, but include the physical portion of it as well. So those are things that are coming up. To close out, I just want to say that, first of all, we're here really as a support to the Department of Human Services, which we continue to do on an ongoing basis. So happy to be here to support them, and we'll continue to do that. Elderly care is definitely something that is first and foremost on our minds, as they are, as we said before, some of the ones that are very high in reference to our chronic diseases throughout the territory. And we spoke about cancer being the leading cause, not just of illness, but death. We spoke about cardiac, especially in women. And we know that, you know, Senator Francis, you could speak to this. Breast cancer, October is Breast Cancer Awareness Month. It's not just women, men, 1% of men do develop breast cancer. So it's up to us to come together as an entity. And of course, over 50, you have a higher incidence of breast cancer in women and men. So it's now up to us to look at from the senior perspective, the elderly's perspective. Dr. Sims doesn't like the word senior, by the way, so we have to figure out how we're going to change that. But the elders' perspective as to how we actually create more of a synergy in our community for those that we honor as much as we say we do. Thank you, sir.
Thank you very much. Thank you very much, Commissioner Kazi Gomez.
Well, we're going to bring in Dr. Sims to do all of our stuff for our staff, right? Is that okay? We actually had really amazing employee appreciation events recently, and now that we're fully staffed in HR, they're coming up with a strategic plan to help appreciate our staff and look at the mental health needs of them as well, especially since we are all caretakers and essential workers. So we're on the upswing of that aspect of things, and so I want to just give give a shout out to that team for working through that, and for our committee that planned the two events. We had it in St. Thomas at the beach, and we had it at Hotel on the Key, and we had a great time. Right? We had fun games and dancing and karaoke and all kinds of stuff. So I think that's a good start to kind of just get out of the office and do something differently, because I think appreciation is important. Elder, and I'm going to say elder seniors, elder care is really our whole entire community's responsibility. It's not just DHS, it's not just the hospitals. We all have to come together to ensure that we care for our most vulnerable. And you know, when you asked about how you can help, part of that is sponsorships or wanting to come in and do something for, you know, those that are at home or whatever. So we're more than welcome. We have a wish list of items. But I have to say thank you to Department of Human Services staff. They work nonstop, tirelessly, nights, evenings, weekends, holidays, 365 days a year, and I'm so thankful for them because they do love what they do, and they care, especially our seniors. Our Senior Citizens Affairs Division. You can see the passion when they're talking. When you walk through Herbert Gregg, you saw the passion. Yeah. So everybody's role is important when it comes to caring for a senior, because it's not just their physical location, but their mind, their body, their soul, their nutrition, everything. So just want to say thank you for that. Thank you, Chairman, for having us today and allowing us to share, and all of your colleagues here, as well as Department of Health. So I really appreciate the opportunity, and we look forward to the next time.
Thank you very much. I think today's hearing was rather important, you know, both in Block 1 and Block 2, but more so in Block 2, and especially some of the data that was shared. You know, when we talk about 18% of our population is elderly, and you know, most of those individuals either have one or more chronic illness. You know, it really becomes you know, complicated, and it's even further complicated when we don't have the health care facilities to support these chronic illnesses that they're experiencing, you know. But we're so weighted. We have a lot going on in our lives, and you know, if we're not able to be able to vent and get some of those concerns out in the public, you know, it becomes even more complicated. We should not have to fight for what's due to us in terms of compensation, you know, whether it's premium pay, whether it's retroactivity, you know, whether it's your regular paycheck, your pay increases, your contract negotiation. You know, we really have to take that fight away from our employees and have them free to do what they need to do, to provide a level of service, because we're service oriented, to provide a level of service to this community, and this community is so reliant and dependent on these type of services. I went over to the Richmond Center, the Herbert Gregg, and it was just like a real sense of relief. I was in a place where I knew just about every single person that was in that room by first and last name, association, either have worked with them before, or you know, some family member have worked with these individuals. These are our people. These are our people at the end of the day, you know. So we got to continue to do our part to bring some relief to them. So, you know, I think when we look at even the hospital, and there's definitely a partnership here where we could try to relieve some of the border situation that they're experiencing, you know, so that they could have more beds, more rooms to be able to meet our public. I think the public got a good overview of the JFL North and what's being done to open that facility in the near future. You know, so I want to thank the CEO, the chair, as well as Mr. Darrell Smalls and Block Number 1, and certainly to thank you and all of your employees at the Department of Human Services, the Health Department, Turning Point. I also provided a testimony. AARP was invited and they weren't able to be here, but they are a true partner in a lot of our efforts to meet our elderly, so I want to thank them as well. I want to thank my staff, my colleagues for their input today, and it's Friday. It's Friday, so we want to get out of here in reasonable time. We had a lot of rain last night, and from all projections, we will have some more rain this weekend. You know, so let's brace ourselves, continue to pray for those individuals that have their soft roof and have to mop water. It's a rough time in this community, so we have to really all bond together We have a small population where we look at it, and we just have to stick together to get through this. The Committee of Health, Hospital, and Human Services of September 30th. Thank you, media. Thank you, Central staff, for everything today. The Committee of Health, Hospital, and Human Services of September 30th, 2022 is hereby adjourned. God bless.
And the last day of the fiscal year.